અંદર ઇવેન્ટ ફ્લો અને આજની જે ઇવેન્ટ છે એ વિશેની માહિતી આપશે.
આદરણીય વરિષ્ઠ તબીબો, મારા સહકર્મી ડૉક્ટર્સ, એનએમઓ ભુજ, ડેન્ટલ ક્લબ ઓફ ભુજના બધા પ્રતિનિધિઓ અને આમંત્રિત મહેમાનો, હું સૌને હાર્દિક નમસ્કાર કરું છું. આજે આપણી આ મેડિકોલીગલ કોન્ક્લેવમાં એક વિશિષ્ટ અને મહત્ત્વપૂર્ણ અવસરે આપ સૌનું હાર્દિક સ્વાગત કરતાં મને અત્યંત આનંદ અને ગૌરવની અનુભૂતિ થાય છે. આ કાર્યક્રમની વિચાર પ્રેરક થીમ છે એવરી ક્લિનિકલ ડિસિશન હેઝ એ લીગલ ડાયમેન્શન. વોટ ઇટ મીન્સ, આ એક માત્ર વાક્ય નથી, પણ આજના તબીબી વ્યવસાયની એક અનિવાર્ય અને વાસ્તવિક સત્યતા છે. એક પ્રસિદ્ધ વિચારકે એવું કહેલું છે કે એવરી ક્લિનિકલ ડિસિશન હેઝ અ લીગલ ડાયમેન્શન, અને બીજું કે મેડિસિન ઇઝ અ સાયન્સ ઓફ અનસર્ટેનિટી એન્ડ એન આર્ટ ઓફ પ્રોબેબિલિટી. એટલે કે આજના સમયમાં આ અનિશ્ચિતતાને કાયદાની સમજ અને સંતુલિત કરવી એ જ એક સાચો વ્યવસાયિક અભિગમ છે. તબીબોનું મુખ્ય ધ્યેય હંમેશા દર્દીનું કલ્યાણ અને યોગ્ય સારવાર માટે રહે છે, પરંતુ વર્તમાન સમયમાં દરેક ક્લિનિકલ ડિસિશન સાથે યોગ્ય ડોક્યુમેન્ટેશન, ઇન્ફોર્મ્ડ કન્સન્ટ, અસરકારક સંવાદ, વ્યાવસાયિક જવાબદારી અને કાનૂની જવાબદારી પણ એટલી જ મહત્ત્વપૂર્ણ બની ગઈ છે. ગુડ ડોક્યુમેન્ટેશન ઇઝ નોટ એન ઓપ્શન, ઇટ્સ અ પ્રોટેક્શન. આજના આ કન્ક્લેવમાં આપણે કન્સન્ટ કઈ રીતે લેવી, વોટ ઇઝ એકચ્યુઅલ કન્સન્ટ, આપણે ખાલી પેશન્ટને સમજાવીને આપણે જે સાઇન લઈએ છીએ, દેટ્સ નોટ અ એકચ્યુઅલ કન્સન્ટ. તો હાઉ ટુ ટેક અ એકચ્યુઅલ કન્સન્ટ. અગર પેશન્ટનું કોઈનું ટેબલ ઉપર ઓન ટેબલ ડેથ થાય છે તો ડેથ ઓન ધ ટેબલ, ક્રિમિનલ નેગ્લિજન્સ ઇન ક્લિનિકલ પ્રેક્ટિસ, તથા કોઈ પણ આપણા તબીબી સહકર્મીઓને નોટિસ આવે છે કોર્ટ તરફથી તો શું કરવું જોઈએ, એ બાબતનું એક આપણે વિષયો ઉપર આજે વિસ્તૃત ચર્ચા કરીશું. અને રિયલ લાઈફ જે મેડિકો-લીગલ આપણને જે પ્રોબ્લેમ્સ થઈ રહ્યા છે, કે કોઈને નોટિસ આવે છે, કોઈને કોઈ ખોટી રીતે હેરાન કરે છે, કે એ બધા વિષયો ઉપર આપણે એક મેડિકલ ડિસ્કશન એટલે કે આપણે પેનલ ડિસ્કશન રાખીશું, જેની જોડે આપણી સાથે આપણા રિસ્પેક્ટેડ સ્પીકર સાહેબ હશે, જે મનુભાઈ પટેલ સાહેબ આપણને સેશન આખું મોડરેટ કરશે. પ્લસ આપણી સાથે આપણા બે પોલીસકર્મીઓ જે ઊંચા દરજ્જાનો ગ્રેડ ધરાવે છે, આપણા બે વકીલો આપણી જોડે હાજર રહેશે, અને આપણામાંના જ આપણા એનએમઓ ભુજ, આઈએમએ ભુજ અને ડેન્ટલ ક્લબ એસોસિએશન ભુજમાંથી આપણે આપણા જ જે સહકર્મીઓ છે એમને પણ આપણે પેનલ ડિસ્કશનમાં ઇન્વોલ્વ કરીશું. આ પ્રસંગે આપણા આદરણીય વક્તાઓ ડૉક્ટર મનુભાઈ પટેલ સાહેબ અને ડૉક્ટર દિલીપ વાલકે સાહેબનું હું આઈએમએ ભુજ, એનએમઓ ભુજ અને ડેન્ટલ ક્લબ ઓફ ભુજ વતી હાર્દિક સ્વાગત કરું છું. આ બંનેના વિશાળ અનુભવ અને જ્ઞાનથી અમને ઘણું બધું શીખવા મળશે એવી અમને સંપૂર્ણ આશા છે. સાથે જ આ કાર્યક્રમને સફળ બનાવવા માટે છેલ્લા 1.5 મહિનાથી અથાગ મહેનત અને સહયોગ આપનાર ઇન્ડિયન મેડિકલ એસોસિએશન ભુજ, નેશનલ મેડિકલ ઓર્ગેનાઇઝેશન ભુજ તથા ડેન્ટલ ક્લબ ઓફ ભુજના હું હાર્દિક અભિવાદન કરું છું અને આભાર વ્યક્ત કરું છું, જેમના સહયોગથી આવા એક જ્ઞાનવર્ધક કાર્યક્રમનું આયોજન શક્ય બન્યું છે. મિત્રો, મેડિકો-લીગલ અવેરનેસ હેતુ તબીબોમાં ભય ઊભો કરવાનો નથી, પરંતુ જ્ઞાન, સાવચેતી અને યોગ્ય વ્યવહાર દ્વારા તબીબ તથા દર્દી બંનેના હિતનું સંરક્ષણ કરવાનો છે. અવેરનેસ ઇઝ ધ ફર્સ્ટ સ્ટેપ ટુવર્ડ્સ પ્રિવેન્શન. સો ચાલો આજે અહીંથી આપણે માત્ર કાનૂની જ્ઞાન લઈને ના જઈએ, પરંતુ વધુ જવાબદાર, વધુ સજાગ અને આત્મવિશ્વાસથી હેલ્થકેર પ્રોફેશનલ્સ બનીને નીકળીએ. અંતમાં આજે વહેલી સવારે જે સમય કાઢીને આ કાર્યક્રમમાં ઉપસ્થિત રહેલા તમામ મહાનુભાવો, જેમ કે તમે બધા ડેલિગેટ્સ છે, 200+ રજિસ્ટ્રેશન થયું છે, તો તમારા પોતાના માટે એક વખત જોરથી તાળીઓ થઈ જાય. સો હું આ મેડિકલ લીગલ કોન્ક્લેવમાં ફરી એકવાર તમારા બધાનું હાર્દિક સ્વાગત કરું છું. આપ સૌની ઉપસ્થિતિથી આજનો કાર્યક્રમ ખરેખર વધુ વિશિષ્ટ અને અર્થપૂર્ણ બન્યો છે. થેન્ક યુ. જય હિન્દ.
I would like to request our first speaker, Dr. MC Patel sir, to please come on the stage and have the talk on his topic. Dr. Manubhai Patel we know that he has recently elected as a National Foxy President. 10મી ઓગસ્ટે સાહેબનું ઇલેક્શન થયું અને નેશનલ ફોક્સી પ્રેસિડેન્ટ છે. હી ઇઝ He has an instrumental role and pivotal role in FOXI uniform consent. He has been a chairperson of Ethics and Medical Legal Committee since in 2011 to 2013. He has also played crucial role in PNDT and Gujarat PNDT State Supervisory Board, and he has also been the National Managing Faculty of Indian Red Cross Society. So welcome, Dr. MC Patel, sir.
Thank you. Statue of World, and we all are proud of that statue. Warm welcome all the delegates and wishing you a litigation-free practice. At the outset, I would like to thank IMA Bhuj, NMO Bhuj, Dental Club of Bhuj, and all the delegates who have come here and inviting me and Dr. Walke to express our views about the subject. At the same time, I would like to thank Bhuj OBGYN Society in particular, because during my election campaign, Bhuj Society had done 100% voting, and that was big support to me. Of course, all Gujarat supported me, and we have won with a very thumping majority and highest in a history of FOXI election till today. So it is only due to joint efforts on part of state organization of OBGYN. And my commitment is still there. Wherever you are, I will be there. Promise to reach the unreached. Counseling and consent in clinical practice is the today's topic for discussion. Usually I start any of my talk with this question: is it worth discussing? Yes, and if it is yes, then why? Because medico-legal litigations are increasing in number constantly and steadily, and unluckily, gynecologists rank first, followed by orthopedic surgeon, then cardiothoracic surgeon, but gynecologists are in driving seat as far as litigation part is concerned. And ignorance of law is never an excuse, because as soon as any act, any law, any ordinance passes in government gazette, it is presumed by law that each and every citizen of India knows that law. So ignorance of law can never be an excuse. I didn't know that cannot be excused in court of law whenever you are facing any litigation. And before we switch over to the topic, let us understand two words. One is agreement. Every promise and promises forming the consideration for each other is an agreement. Say for example, if we decide, let us go to movie this evening, this is a kind of agreement. But any agreement, when it is enforceable by law, then it becomes a contract. And in our medical fraternity, whenever any patient comes to us and we accept him or her to treat, then it becomes a contract or implied contract between patient and ourselves. We are offering our expert services and patient pays for that, or patient promises to pay for that. So it becomes a contract. And under Indian Contract Act, Section 13, it is defined as a when two or more persons agree upon the same thing in a same sense, it is a contract. And as far as our medical part is concerned, what is contract between patient and ourselves, what is consent on part of patient, voluntary agreement, compliance or permission without compulsion. Here word without compulsion is very important, where legal validity of it is dependent on it being given after understanding clearly what it is for and with all risk involved. So patient should have knowledge about treatment plan which we are going to offer. And this is very important and very famous landmark judgment case, Samira Kohli versus Prabha Manchanda. It was decided in 2008 in Supreme Court, and in that very case, Supreme Court came up with guideline and some important points. What should be the ideal consent in Indian consent? So, it is more than just sign here. It is not consent paper and we say patient you sign it. It is not like that. It is more than that. It was decided and discussed in this particular case. And in that very case, I do not want to go into detail of that very fact of the case, but where criteria was decided in that very case. So what is valid consent and which are the criteria for any consent to be valid in Indian consent? A very important part is consent given for unlawful activity is not valid. Even if patient is willing or patient is ready to give consent that you give me a injection, I want to die, of course it is consent, but it is unlawful and that consent is not valid and you cannot entertain, because euthanasia is not permitted in India. There are only two exceptional cases, one Anuradha Sandbag and very recently Haresh Rana, in which Supreme Court has given a permission for passive euthanasia and lifetime support was withdrawn slowly and patients were allowed to die. Otherwise, even if patient has given a consent, then also you cannot entertain passive euthanasia. So, one more criteria, who can give consent? It is very clear when patient is major and when patient is mentally sound, only and only patient can give consent. Any other person who have signed the document is not valid in eye of law. Patient should sign the document. If patient is minor or mentally challenged, then consent of guardian is required. Otherwise, patient will sign the document. But one more very interesting situation. Can minor give consent for examination? Many times, relative brought patient who is less than 18 and she is for examination, many times history of sexual assault also. So, in this situation, can that patient give consent for examination? Yes. If she is more than 12 years, then even if she is minor, if she is less than 18 but more than 12 years, she can give consent, because in eye of law, though she is minor, but she is considered as a matured minor. So, she can give consent for examination. But at the same time, can she give consent for surgery or procedure? Many times patient is brought in this condition and she is bleeding or some stitches are required, some anesthesia or analgesia is required. For that she cannot give consent because she is minor to give that consent, and for that consent of guardian is required. One more area, can visually challenge give consent? Of course yes, if she can listen, whatever conversation we do with her or him, and if she can listen, she have any question, we can answer those questions, then she can sign the document. But here word of caution, there should be one guardian or any person who knows that very patient, he will sign the document that before me it was explained to the patient and after understanding patient has given a consent. Same way one more area, can deaf and dumb give consent? Same way, if she can read all the document, you can give all document to read, she can go through. If she has any question, she can ask and we can answer those questions. But here also, there should be one guardian as a witness that before me, it was explained to the patient. In an emergency, no consent is required. But burden of proof will be on your shoulder to prove, and you can prove it by proper documentation only. If it is immediate to save life of patient, immediate necessary to save life of patient, even without consent you can proceed accordingly, but you will have to prove that it was dial emergency and whatever you did, it was in good faith of patient. So consent should be voluntary, it should be free, signed by patient or guardian as per the case may be, and others are witnesses only. So on behalf of patient, when patient is major and mentally sound, nobody else can give consent. So we should be very clear in that part. One more criteria, are your patient properly informed? Because in that very case of Samira Kohli versus Prabha Manchanda, Supreme Court was very clear that patient should have knowledge about nature of treatment which you are going to offer with all its side effects and all its benefit. So we have to explain that also. So at the time of counseling, at the time of explaining, no fraud, no coercion, no false promise. And we are under obligation to explain all the available alternative to the patient. Say for example, if it is a case of acute appendicitis, and we have two options, medical method also and surgical method also. So we can offer both. If it is, of course, it is about to burst, then naturally we have to go for surgical alternative, that is different story. But if it is not an emergency, then we can explain, and whichever way patient is comfortable to receive, we have to treat patient that way. So we have to explain all the available alternative of treatment to that very patient. With success rate, particularly in ART treatment, we have to explain about success rate also in your clinic, in your city, in state and in country. So this is very much required as per guideline from Supreme Court in that very case. And just mention in the prior, we have prepared 30 different consent in FOXY, and on FOXY uniform consent it is available. And we 3 medico-legal experts have prepared. 2 are here, Dr. Dilip Walke and myself, and one more our friend Dr. Nikhil Datar from Mumbai. We have prepared those consent. And in those consent, other than gynecologists, in those 30 consent, we have prepared consent for anesthesia, consent for blood transfusion, consent how to refer patient to higher center. In many times we have to refer patient to higher center. So this type of consent are available for anybody to use. You can download and you can use in your day-to-day practice. But when we were preparing those consent, for one word or one line, we had a discussion for hours together. Because many a time, if Dilip Walke puts one argument, I may be differ or Nikhil may be differ. So with the long discussion, we came up with this 30 different consent. And to give me the authentic view, we had a collaboration with Maharashtra Law Society. And we referred all those 30 consent to Law Society, and we requested them to ask question to us. And we were ready to answer all the question, if at all. And we had some question to ask to them also. And then after we have put all those consent on FOXY website. So we have prepared consent in 2 parts. This is usual, even if any speciality you go, but you will have to take consent this way only, according to this case of Samira Kohli versus Prabha Manchanda. We have prepared in 2 parts. Part 1 is information about surgery. Say for example, name of procedure or surgery. If it is a case of cesarean section, then we will mention cesarean section. If it is appendicectomy, then we will mention appendicectomy. If it is knee replacement, then we will mention knee replacement. Meaning, what is the meaning of that very surgery? In a very simple language we have prepared. Say for example, for this cesarean section, we have mentioned to cut open abdomen, to cut open uterus and to deliver baby. That way we have prepared consent. Purpose or indication, why we are going to go for that very surgery or procedure. So we have to mention indication, description of procedure in brief, how that procedure or operation will be done, benefit of that very procedure. After that very surgery or procedure, how patient will be benefited, we have mentioned that also. Alternative, just I mentioned prior, we have to mention all the alternative available to the patient in that very situation. Consequences of refusal of procedure. Many times patient is not ready to give consent. So, which are the consequences of refusal, we have to mention that also, and in those consent which we have prepared, we have mentioned that also. Outline substantial risk involved in that very procedure or surgery. Say for example, risk involved with anesthesia, possibility of excessive bleeding or blood accumulation, possibility of infection, injury to surrounding structure. Every individual has a different way to cope up. Say for example, scar formation. Some might have keloid formation also. So we have mentioned that also. And very rare condition, that is allergic reaction to any drug, we have mentioned that also. And when we are dealing with any obstetric case, then what could be the neonatal outcome, we have mentioned that also. And part 2 is undertaking. So whatever we have explained in part 1 about information about our procedure or surgery which we are going to offer to the patient. So patient will go in part 2 undertaking. So whatever she has understood with our counseling, she will give undertaking. But very important part is this. Here it is mentioned in red color. Many a time patient has given us a consent, but we have to go beyond the scope of consent given by patient. So if it is a cold case, if it is not an emergency, if patient has not given consent, then you cannot go beyond the scope of consent given by patient. So we have mentioned like this also. I understand that during course of surgery, doctor may find other unanticipated, unhealthy condition that may need specific action, procedure, surgery and anesthesia. If doctor feels that it will be beneficial to treat such condition while performing proposed surgery, and if I am not in a mental or physical capacity to give consent, doctor may take necessary decision after discussing with Mr. or Mrs. So and so. I authorize that above mentioned person to give proxy consent on my behalf. So if patient has given consent like this, you will have to discuss with that very person whom patient has given an authority, and if he or she gives consent, it is as good as consent given by patient. But one more paragraph we have mentioned that patient may give consent like this also. In order to save life, it may even be necessary to do additional surgery or procedure or prolonged anesthesia which are beyond the scope of consent given by me. I authorize doctor to take such decision if need be. So if patient has given consent like this, then no need to discuss with anybody, and you can go beyond the scope of consent given by patient for that very surgery or procedure. And at the end, signature or thumb impression of patient. If it is thumb impression, then it should be attested by a person who knows that very patient and who is major and mentally sound. 2 witnesses, one in favor of patient, one in favor of hospital, and signature of doctor is also must in consent paper. You will be asking why. So in the beginning I mentioned that whenever treat any patient, it becomes a contract or implied contract between patient and ourselves. And under Indian Contract Act, unless all the party involved in the contract signs the document, document is incomplete. And that is why signature of doctor is very much must in that very consent paper. One more question many times we have to face. Does Supreme Court expect us to talk about all possible complications? So in that very case, Supreme Court was very clear to anticipate certain complications or requirements depending upon the condition of the patient. So we have to anticipate certain complications and we should be readily available to deal with the situation. Say for example, if it is a case of central placenta previa, so naturally one should anticipate that she may end up into bleeding, she may require blood transfusion, she may require hysterectomy also. So we have to mention all this. But at the same time, court was also very clear that no need to explain remote or theoretical risk involved which may frighten or confuse the patient and result in refusal of consent for necessary treatment. So no remote or theoretical risk are to be explained. It was very clear on part of Supreme Court in that very case. One more area. Can we allow attendee during surgery? Can we record that very surgery? And can we display that very surgery in workshop, in conferences or in medical colleges? So in all this situation, prior consent of patient is very much must. If patient has given consent, you can very well allow attendee, record and display also. But whenever you are displaying that very surgery or procedure, personal identity of patient should not be revealed. So we should be very careful in this situation. Separate consent for anesthesia, because we have to explain as far as anesthesia is concerned about nature, benefit, purpose, effects, alternative and substantial risk involved in that very anesthesia. And anesthesiologist is the best person to explain all this. So consent for anesthesia should be taken by anesthesiologist. Separate consent for blood transfusion. Again same thing, purpose, effects, alternative and substantial risk involved. Why separate consent for blood transfusion is required? So in this particular case, court was very clear that surgery involves risk, but blood transfusion involves additional risk. So additional consent is required for blood transfusion. But if at all you have not mentally prepared or suddenly there is bleeding and blood transfusion is required, so at that time you have no time to take separate consent. But at the time of taking consent for general surgery or any procedure, if you have mentioned, if at all required, I give consent for blood transfusion also, then it will save you in court of law if at all it happens. Because in this particular case, allegation on part of patient and relative was consent was not taken from us for blood transfusion. It was allegation on part of patient, and that is why separate consent is required. Refusal of treatment. Many a time patient may refuse to give consent. So, need to explain risk of refusal of treatment in this situation. But at the same time, court was very clear that no need to explain remote or theoretical risk of refusal of treatment, which may pursue patient to undergo fanciful or unnecessary treatment. So, in both these conditions, balance should be maintained at the time of explaining about complication to the patient. Common consent. Diagnostic and operative procedure together, one can go with one consent in the same consent, and at the same time particular surgical procedure and additional or further procedure. Say for example, hysterectomy with salpingectomy, hysterectomy with salpingo-oophorectomy, hysterectomy of mere cyst removal. So, in this type of situation, one common consent can be done for both the surgery or procedure. But it is very clear that consent giver for specific treatment cannot do other procedure unless it is life-saving. An argument that it was beneficial, would save time, would save pain and suffering in future doesn't stand in court of law. Say for example, if you are doing 4th cesarean section and if you feel that next pregnancy could be dangerous for the patient, but if patient has not given consent for tubal ligation, you cannot go for tubal ligation because it is not acute emergency. Patient is not going to be pregnant very next day. So, it is not dial emergency. You cannot go beyond the scope of consent given by patient. Let us see this case. In that very case, consent was given for diagnostic laparoscopy. It was case of primary infertility. But during diagnostic laparoscopy, doctor went with ovarian drilling and salpingectomy. Case was filed because it was without consent, and compensation of rupees 25,000 plus 2,000 was awarded in favor of patient. One more case. In this particular case, it was case of DUB previous to LSCS, and patient was for total abdominal hysterectomy. So, consent was given for total abdominal hysterectomy, but after anesthesia on table, doctor decided to go for vaginal hysterectomy. Consent was given for abdominal hysterectomy. He started with vaginal hysterectomy, but at the time of ovarian stump, there was profuse bleeding and ultimately laparotomy was done. In this particular case, it was pelvic kidney just behind, and there was injury to blood supplied to that very kidney. 9 units of blood were given, and even if after laparotomy they couldn't control bleeding, and ultimately nephrectomy was done. But patient was lucky that she had one normal functioning kidney at normal position. But case was filed in this particular case, and court was very clear. Bleeding is no negligence. Bleeding may occur at any time, in any surgery, at any place. Bleeding is no negligence, but deviation from route, from abdominal to vaginal is not acceptable unless it is life-saving. So, in this case, compensation of rupees 5 lakhs was awarded in favor of patient. So, we should not go beyond the scope of consent given by patient. One more area. Should consent be written? Is it mandatory? So, by law if we go, there are only 3 conditions in which written consent is very much mandatory. One is organ transplantation, second under PCPNDT Act sonography of antenatal patient, and medical termination of pregnancy under Medical Termination Pregnancy Act 1971. So, in all other cases, you can go with oral consent also, but word of caution, burden of proof is on your shoulder to prove, and many times patient may go hostile. We were never informed, we had never given a consent. So, though it is not mandatory to go written consent except these 3 conditions, it is always advisable to go for written consent in each and every case. Consent can be taken by assistant doctor also. It is not necessary that consent should be taken by doctor who is going to do procedure or surgery. Can it be taken in pre-printed form? This is also very interesting thing. In one of the cases which happened with R.G. Stone Hospital versus Vinod Agarwal. Vinod Agarwal was HIV positive patient and he had some urological problem. Due to his HIV status, many hospitals refused to get him admitted and treat, but RG Stone Hospital was ready. He was admitted, surgery was done, everything was fine. Operative, post-operative period was totally uneventful. In due course, patient was discharged. Even then, he filed a complaint against RG Stone Hospital, and he had a complaint that my consent was taken on pre-printed form, and to take consent on pre-printed form is unfair trade practice. And unluckily, case was decided in favor of patient, and compensation of rupees 10 lakhs was awarded by National Commission. And RG Stone Hospital was ready to pay that 10 lakhs of rupees. Now imagine the situation. If this case was not challenged, then what would have been our practice? Either we would have to take concern in handwriting of patient, or in handwriting of surgeon, or in handwriting of assistant. And at that time, we were preparing this uniform consent. So Nikhil Datar, our one more colleague, Dilip Walke and myself, we decided to approach RG Stone Hospital. RG Stone Hospital was not ready to challenge that very case, but Nikhil Datar had good relation with them. We approached them and we convinced them, for wider interest of medical fraternity, you prefer appeal. And appeal was preferred. And at the time of tabling this appeal, our argument was, what is unfair trade practice? Any unfair means to promote business is unfair trade practice. In our medical fraternity, if we take consent in handwriting of patient, or if we take consent in handwriting of surgeon, or in handwriting of assistant, does it enhance our practice? No, court was convinced. So this appeal is tabled. Now it is stay. We are quite hopeful judgment will be in our favor, but till then we can very well use pre-printed form. That is why we discuss this case. Should it be in English or in vernacular language? Naturally, if it is in vernacular language, it is always better. Just I mentioned prior also, who should sign the document? Patient, guardian, and doctor also. Hysterectomy with salpingectomy, hysterectomy with salpingo-oophorectomy, cesarean with myomectomy, cesarean with tubal ligation. So in all additional surgery, prior consent is very much must. This is form C. It is prescribed form for consent in case of termination of pregnancy. Gynecologist or any other family physician or whosoever practicing medical termination of pregnancy, it is very much mandatory. I repeat, it is mandatory to take consent in form C. But this consent is very simple consent. What it is mentioned, hereby give my consent to termination of my pregnancy. It is simple consent, so it is not informed consent. So in these cases, you will go with two consent. One consent which is mandatory to be taken in form C, and one consent, informed consent, as we take in any other surgery. And on Foxy website, it is available to take consent for medical termination of pregnancy by medical method and by surgical method. Both separate consent are available on Foxy website. If patient is minor, that consent of guardian is to be taken in form C whenever you are terminating any pregnancy of minor. As far as consent form in ART clinic, they are also again prescribed form, and it is given in ART law, and we have to strictly follow all those forms. I do not want to go into detail of that very consent. One more area, withdrawal of consent. Patient has all the right to withdraw consent for which she has given consent. Say for example, if she has given consent for some surgery, but before surgery she can withdraw consent also. But at the same time, we will explain her what is the consequences of withdrawal of that very consent. But in spite of all this, if patient is not willing to give consent, then we cannot force patient for the same. And to conclude with this very famous case of C. Jaipal Reddy versus Padmini Veluri, in that very case, National Commission has very specifically mentioned that consent is not mere piece of paper where patient or patient party has to sign, but it is a very important document of your counseling, of your consent. So whatever you counsel, whatever you communicate to the patient, you have to mention each and everything in consent paper, and once patient sign that very document, it becomes a documentation of your communication. So whatever you have communicated, it is documented in consent paper. This gentleman have so many staircases, but he doesn't know how to use them. So it doesn't matter how many resources you have. If you do not use how to use them, they will never be enough. There are so many judgments in Supreme Court, in different high courts, in our favor, in favor of medical fraternity. But if we do not use those judgments in our favor at the time of facing any case, then they won't be helpful. So have some basic legal knowledge and always obtain medical legal opinion whenever it is required. So there is always a way. So if you want to sleep like this, take tender care of your patient, take valid consent, pray Almighty God before going to sleep, and keep my visiting card below your pillow. So with regards, salute to all. Thank you very much. Please do not assume. Please ask if any query, any question, if time and organizers permit. Thank you very much.
Yes, sir. Yes, sir. Do we have, we do have the question answer session. So we have collected questions from Google form. So I would like to ask first question. Is negative consent for MLC signed willing by patient and relatives admissible in court?
Nini, what do you mean by negative consent? For what particular situation?
MLC cases માં સાહેબ ઘણા લોકો medical cases માં negative consent આપતા હોય છે. Is it valid to take?
નહીં પણ નહીં એટલે કઈ રીતે નેગેટિવ કન્સર્ન હું સમજ્યો નહીં. હા હા એ આપણે છે ને પેનલ ડિસ્કશનમાં એક કેસ લીધેલો જ છે, એટલે આપણે ડિસ્કસ કરશું. જે કોગ્નિઝેબલ ઓફેન્સીસ હોય, જેમાં જેલની સજાની જોગવાઈ 2 વર્ષ કરતાં વધારે હોય, એવા કેસમાં વી આર અંડર ઓબ્લિગેશન ટુ ઇન્ફોર્મ પોલીસ. પછી પોલીસને એ લોકો કહે કે અમારે કોઈની સામે કેસ નથી, એન્ડ પોલીસ કેન ક્લોઝ ધ ફાઇલ, બટ નોટ ટુ એન્ડ અપ ઇન ટુ એની કાઇન્ડ ઓફ પ્રોબ્લેમ, it is always better to inform police.
Second question is, valid consent form doctor પાસે છે, complete clinical records છે, radiographs છે, photographs છે, documented treatment notes છે, but the patient letter alleges that I was never explained a particular risk. Then what happens? What evidence can a doctor generate?
In eye of law, once you sign any document, it is presumed by law, whichever written above, it was read by you, you have understood, and after understanding, you have signed the document. Simple. In any bank loan or so, we are given bunch of papers, and we sign each and every paper. Then after, we have no argument that we didn't read, and straightway we have signed the document. Once you sign the document, it is very much valid document in eye of law.
One more very interesting question. If a patient consents to a comprehensive treatment involving multiple procedures over several visits, so does that initial consent remain valid throughout the treatment, or should consent be reconfirmed with all the procedures?
So usually there should be fresh consent, but say for example tomorrow you have planned surgery and you have taken consent today, it is very much fine. But you take consent today, and after 10-15 days if you are going to plan surgery, then it is not valid. It may be questioned, and it is always better to take consent for 1 day prior. As such, there are 2 types of consent. One is informed consent, which we discussed, and one is real consent. In our Indian practice, we are taking real consent. We put case paper to the patient. Patient may go through or patient may not, and patient sign the document. It is real consent. As such, informed consent means in foreign country it is very much prevalent. They give all the document of this procedure or surgery to the patient. Patient may take all this document at home. She can go through all those documents at her leisure, and on next visit, she will sign that very document before you and one witness. That is as such informed consent. But real consent is also very much applicable in eye of law.
Is there any question from audience?
The question that you ask about the patient going in the court and saying, "Ke मुझे तो कुछ पता ही नहीं चला क्या लिखा. Now this may not be actually possible in an elective case, but this is definitely possible in a patient in labor. Patient labor में है और फिर आपने सीजर का कंसेंट लिया, तो डेविल्स लॉयर कैन गो इन द कोर्ट एंड से पेशेंट को इतना पेन हो रहा था कि आपने जो कुछ भी एक्सप्लेन किया मुझे पता ही नहीं चला. सो दिस कैन हैपन, नॉट दैट इट इज जस्ट बिकॉज शी साइंड ऑन अ पेपर does not mean she was in a condition to understand what was being told, and that's the reason why me and Dr. MC Patel, you can go on the Foxy website and read the uniform Foxy consent. We have got a consent for vaginal birth, and this consent for vaginal birth we say that you take during the antenatal visit itself. So what happens is all this explanation that you have done about cesarean, about instrumental delivery, you have done that explanation when she was in a proper mind to understand that. So that argument in the court of law will not be a valid argument.
So, well said, because on part of prosecution, when advocate on part of prosecution has no argument, then many a time he will put this type of argument. When she was in agony of labor pain and she has signed the document, so that document cannot be considered valid in eye of law. Then not to end up into this, just mentioned by Dilip Walke, we have prepared consent for vaginal birth. We have not mentioned normal delivery.
One more thing, now that our Dr. MC Patel is going to be the president of Foxy, एक responsibility आपके पे डालूं सबके सामने.
बिल्कुल.
The consent that we have are always, we are taking a written consent. I want Dr. MC Patel to now to devise an app wherein the consent can be any consent. For example, मैं परसों एक हिस्टेक्टमी करने वाला हूँ से XYZ हॉस्पिटल में. वो कंसेंट कौन लेगा? हॉस्पिटल वाले लेंगे. वो रिटर्न कंसेंट कहाँ रहेगी? हॉस्पिटल में रहेगी. मेरे पास क्या रहेगा? I may be just attached to the hospital. मेरे पास कुछ रहने वाला है क्या? So what I want Dr. MC Patel to now do is to devise an app. On the app, अगर मेरे 2 दिन के बाद में हिस्टेक्टमी है, तो मैं on the app उसको information जो इन्होंने लिखा है ना on the uniform Foxy consent, I'll send that information to the patient. Patient will give me a digital signature. Android पे अपन Amazon को देते हैं signature, तो हमें क्यों नहीं दे सकते? Patient will give a signature to us that she has read all that you have sent to her in whatever language, in Hindi, Marathi, English or Gujarati also. You send that, and when she comes to the hospital, she will take the undertaking, and the undertaking also can be taken on your mobile app. So what is going to happen? जितने भी केसेस मैं आज इस हॉस्पिटल में कर रहा हूँ, कल उस हॉस्पिटल में कर रहा हूँ, मैं 10 हॉस्पिटल में काम करता हूँ, आई डू नॉट हैव द कंसेंट विथ मी ऑफ ऑल द हॉस्पिटल. So now it can be, the consent can be with the consultant also. तो आपके लिए ये काम छोड़ा है मैंने. No?
It is already in my. So now that very consent, uniform consent, we prepared in English, but now it is available in Marathi, in Kannada, Gujarati version is also ready, and I was busy with my election, so I have to give final touch, and within few days it will be available in Gujarati also. Hindi version is also on, and my plan before I take office as a Foxy president, I am going to go for translation of that very consent in all the languages in India which is prevalent. And also app also, but Sir.
Dr. Padarkar, sir.
Yes.
Thank you, sir. Very much informative. Only simple question I will ask you. How long we have to keep the record of MTP consent of the patient? For how many years?
So not only MTP, I will say each and everything. So if we go by law, then as far as record of PCPND related all the cases for 2 years, for MTP cases for 5 years, ART cases for 10 years, and after 10 years we will have to transfer all those records to National Registry. As far as surrogacy treatment part is concerned, for 25 years. So this is mandatory by law. By guideline from IMA or NMC or with experience of our medical legal expert. According to NMC, OPD case paper for 2 years, indoor case paper for 5 years, but we say for at least for 7 years. But as far as our obstetric cases, that is delivery cases are concerned, for 18 plus 2 for 20 years. Because after attaining majority, that baby may show within 2 years. Of course, in India, now it is not that very cases, but in foreign country, it is already there. So we should be careful. And in this era of digital and this computerization, it is not that difficult. So we will have to preserve all those records. So at least for 7 years. As far as income tax part is concerned, or our account related documents, at least for 7 to 10 years. And as far as register part is concerned, birth register lifetime, death register lifetime. And if you are facing any litigation, then till final disposal of your case, you will have to preserve all the records.
Thanks a lot, sir. આપણે ટાઈમની થોડી કમી છે એટલે ઓકે we'll
Hello.
take only one question now. Dalset.
Morning, sir. Small question. If a patient comes in ER without any attendant, guardian or a relative, they are giving consent or I explain them on call. So it's valid because real-time situation. I work in ER department. One lady was brought with a history of RTS. She slipped from the bike. Minor daughter was with her, and she has a communicated fracture in the knee. Her husband was in contact with me. He gave all the consent. We go through the X-rays we treat, but he refused to give the slab or plaster, and he told us to shift the patient to the other hospital. I don't want to go further. And one guy, random guy came and take. And next day he came and blamed us that you have not put the slab, and that's why the fracture has been gone worst. So how we can deal with these situations?
Patient was conscious.
Yeah, she was conscious, I told, but he told that...
She was major.
Yeah.
She was conscious. She herself can give consent.
But he told he
No,
was
no,
in pain
no.
and agony, and so...
Agreed. But if you have taken consent of that very patient, and you can take signature as a witness, any co-patient, any visitor of your hospital, that before us, it was explained to her that this is very much required, and she had given a consent. It is valid.
Thank you, sir.
Not necessary that witness should be her relative only. Any major person who is mentally sound can sign as a witness, because word guardian is used. And what is the meaning of guardian in eye of law? Any person who guards the patient is guardian. Need not to, he or she should be her relative. So it will.
Last question,
આપણે
sir.
કયા પેશન્ટને ટ્રીટમેન્ટ માટે ના પાડી શકે કે નહીં મારી પાસે નહીં બીજા પાસે કરાવો જજ કહી દે છે નોટ બિફોર મી તો ડૉક્ટર ક્યારે રિફ્યુઝ કરી શકે વેન હી કેન
એના માટે ટાઈમ ઓછો છે પણ છતાંય there was very famous case of Parmanand Katara. In that very case, one boy who was going on bicycle, he met an accident. And Parmanand Katara is social activist. He brought that very child in nearby hospital. Hospital refused to treat that very patient. It is a roadside accident, it is a MLC case, and we do not want to indulge in all this. So patient was brought to another hospital. That hospital also refused, and patient was to be brought to another hospital. During that time, patient was succumbed. Treatment was given. Ultimately, patient was saved. But Parmanand Katara went with public interest litigation in Supreme Court. Please give us the guideline which type of cases cannot be denied and one has to treat. So in that very case, Supreme Court was very clear. If it is a cold case, you have all the liberty to choose whether to treat, whether not to treat. You can very well say no. One more thing, if patient or relative are dictating you how to treat, then also you can refuse. So one more thing, if you have advised certain investigation and which are very much necessary to come to conclusion or diagnosis and to have a treatment plan, and if they are not willing to go for that very investigation, then also you can refuse. And this all guideline from court only, this is not from me. But if it is an emergency, then you have no choice, you have to treat, you have to stabilize that very patient, and then you can refer patient to higher center, irrespective of your subject. Same question was asked in Lok Sabha in 2014, and then Union Health Minister Dr. Harshvardhan, good friend, he had answered this. Whenever any patient is brought to any clinical establishment in an emergency, you have to stabilize that very patient, and after patient is stabilized, till then you have not to charge also. You have to go with free of cost, and after patient is stabilized, you can ask patient if he or she is willing to take treatment further with you only, then you can charge. But if patient is willing to go any other hospital, you have to refer that very patient to any other hospital. But it is an emergency. You have to stabilize, you have to give primary aid, or which we call golden hour treatment. We have to give to the patient, and it is very much must, and it is very much mandatory, I would say, for each and every treating doctor.
Thanks a lot. Thanks a lot. Now it's time for our second talk. A topic for the second talk is death on table. I would like to request Dr. Dilip Walke sir to please come on the stage. Dr. Dilip Walke sir is a 35 years of experience gynecologist and medical legal consultant. He's the chairman of Ethics and Medical Legal Committee, FOXI 2007-2010. He's the director of Osphere ART Private Limited, and he has been also the president of Pune Obs and Gynec Society in 1920, and he has been the co-author of Uniform FOXI Consents. I welcome you, sir.
Yeah. And one thing you forgot to mention, why I am here. I'm here because of my friendship with Dr. MC Patel, because first of all, the disclaimer is that I'm not a lawyer. I do not have any medical legal books to my credit, no articles like Dr. MC Patel. I am a simple clinician like all of you. My only thing is that when I was the chairman of the Ethics and Medical Legal Committee, मैंने इन जैसे लोगों के साथ दोस्ती कर ली. और दोस्ती करने के बाद मैं ये जो भी लीगल जार्गन्स बताते हैं ना यहाँ पे, कंसेंट इज अ कॉन्ट्रैक्ट, कंसेंट इज अ कॉन्ट्रैक्ट बोलने के बाद उनको समझता है, अपने को नहीं समझता है ना. सो व्हाट आई यूज्ड टू डू इज, ये जो भी जार्गन्स यूज करते हैं टू नैग MC, इसका मतलब क्या मेरे को सिंपल भाषा में समझा. तो ऑल दैट ही यूज्ड टू टेल मी, आई पुट इट in a simple language in my slide so that all of you can understand. So that is the secret of whatever talks that I give on medical legal aspects. So I am a medical legal expert, not because I am actually an expert. It is all because of Dr. MC Patel and my friends in the legal luminaries. NMO and the IMA has invited me for this talk second time. I am coming here to Bhuj after 10 years, and so there are two possibilities. One is that they have liked my performance in the past 10 years back, but the second possibility is they have totally disliked it, and they want this time, on the second time, they want me to improve my presentation. So I take it as the second one, and I've tried to make it more interesting and more, I've tried to improve my presentation, because small daily improvements over time lead to a stunning result. So 10 years I have taken to improve myself, and I have come here after 10 years of slowly trying to improve my presentations, and I hope I will be able to impress all of you here. So for this topic, what we'll do is we'll consider a fictional situation that you are working in a 5-bedded nursing home, and I'll take examples of obstetric cases only because the obstetric is one thing that I understand. So a 5-bedded nursing home, you have done an LSCS, and there is a postpartum hemorrhage, and there is a cardiac arrest-like situation. So let's discuss table death from this situation of a cardiac arrest-like situation, and you're trying to resuscitate the patient. The biggest issue of death on table, especially in obstetric cases, is this narrative. Narrative that nothing can go wrong in an LSCS or nothing can go wrong in a normal delivery, because if there is a mishap in a patient who is delivering, or if there is a mishap in a patient who is on table for LSCS, then definitely the doctor must have goofed up. So this is the narrative that people have. Nothing can go wrong in obstetric cases. And the least that we can do as an organization is to do media campaigns, because you know, if there are obstetricians sitting here, you know that PPH can kill the patient, you know that an amniotic fluid embolism can kill the patient, you know that a shoulder dystocia can kill the baby. So all these unforeseen high-risk cases, iske bare mein there has to be some media campaigns. The organizations like an IMA or NMO or FOXI can do all these media campaigns for that. And at individual level, whatever we mentioned just now, that consent for vaginal delivery, in which you talk about all these possibilities as a risk of a vaginal delivery. There cannot be anything. Is there anything called as a normal delivery? What is your opinion? Normal delivery होता है क्या? कोई भी delivery normal नहीं होती. Either the delivery is vaginal or the delivery is by cesarean. So never even talk about normal delivery. उनको बोलने का normal कुछ नहीं होता. there is vaginal, yeah, there is an abdominal delivery, and vaginal delivery में क्या क्या हो सकता है? So this is what we are. So you have to make your efforts to convince the people that there is nothing like normal and there can be mishap even in a delivery. So the narrative will take a long time to change. Let us discuss what we can do at the ground, that zero level, ground level, what we can do. First thing is a slide that I am showing, very easy to say from the dais, लेकिन actually जब अपने आप पर आता है ना, people like MC Patel या Dilip Walke can come here and say, don't panic. बोलना आसान है, लेकिन हमारे पास होने हमारे भी फटती है, right? So that is what happens. But at least don't panic, because we know that if this case goes in the court is going to ask who managed the case. The court is going to ask what was the qualification of the person who was managing the case, and then the court will require you to have only reasonable and average skill. So if you can prove that you had the qualification, you can prove that you had an average skill. एकदम when you are doing a laparoscopic hysterectomy, आपको boss surgeon होने की ज़रूरत नहीं है, averagely skilled surgeon, and if you can prove that you took reasonable care, nothing is going to go wrong in the court of law. At least इतना डर अपने दिमाग से निकाल दो. Relax and resuscitate. Who should relax? You should relax, and who should resuscitate? Ideally, the resuscitation should be done by the anesthesiologist. Now, why do you say that the resuscitation should be done by an anesthesiologist? हम ये क्यों कहते हैं? क्योंकि इंट्यूबेशन किसको आता है? एनेस्थेटिस्ट को आता है. अगर पेशेंट को कार्डियक मसाज देने का किसको आता है? अपने को आता है क्या? नहीं आता है. So that is the problem. We don't know. We don't even know what is basic life support. Advanced life care support तो छोड़ ही दो. बेसिक अगर मैं आपको बोलूँ चलो मुझे दिखाओ, एक मैनिकिन यहाँ रखता हूँ, आप पूरा उसको कार्डियक मसाज दे के दिखाओ, दे सकते हैं क्या? सो वी आर नॉट ट्रेन्ड इन दैट. सो दैट्स द रीजन वाई ऑन टेबल अगर एनेस्थेटिस्ट अवेलेबल है तो लेट द एनेस्थेटिस्ट, वो कितनी भी जूनियर होने दो, लेट दैट एनेस्थेटिस्ट टेक ओवर एंड लेट द एनेस्थेटिस्ट डू द रिससिटेशन. बट इफ देयर इज नो एनेस्थेटिस्ट, देन अगर आपकी डिलीवरी हो रही है वहाँ पे और पेशेंट को कार्डियक अरेस्ट हो गया तो कौन करेगा रिससिटेशन? एनेस्थेटिस्ट को फ़ोन करने के बाद 10:30 बजे एनेस्थेटिस्ट को मॉर्निंग में फ़ोन करके वो एनेस्थेटिस्ट 15 मिनट में आता है कि मेरे को बोलो, भुज में आता है. ये सोच के मैंने एनेस्थेटिस्ट से शादी कर ली और मुझे लगा कि सुबह वो मिलेगी, लेकिन वो मुझे भी नहीं मिलती क्योंकि वो कहीं और कॉल करते रहते. Morning 10:30, fetal distress, the baby is going to die. Definitely, I am telling you, because of want of anesthetic. So if the anesthetist is not available, who should be doing all the resuscitation? लेकिन हम लोग ट्रेंड ही नहीं है ना. डायरेक्टली पेशेंट को इंट्यूबेट कर सकते हैं क्या? उसके ऊपर सीख सकते हैं क्या? हम लोग नहीं सीख सकते. एंड दैट्स द रीजन वाई सिमुलेशन बेस्ड ट्रेनिंग ऑफ इंट्यूबेटिंग मैनिक्विन, उस ट्रेनिंग करना ज़रूरी है. सो आज मैं डॉक्टर MC पटेल को पहला काम मैंने क्या दिया? ई कंसेंट. दूसरा काम मैं क्या दे रहा हूं अभी आपके सामने, भुज के लोगों के सामने मैं बोल रहा हूं. हम लोग उनको 2028 के एंड में पूछेंगे ये 2 काम किया कि नहीं. एंड व्हाट इज दैट वर्क? डॉक्यूमेंट्री एविडेंस ऑफ सिमुलेशन बेस्ड ट्रेनिंग फॉर एवरी फॉक्सियन. सो लेट अस फॉर्म a simulation based, so because we can talk theory in the conferences, but we can learn hands-on only on a mannequin in a simulation based situation training. So one work for the president-elect is please form a simulation based education committee in Foxy. क्योंकि अगर मैंने उनको बोला ना कि simulation based training करो तो कोई करता नहीं. अब जब वो कोई चेयरमैन बनता है ना किसी कमेटी का तो फिर वो काम करना शुरू कर देता है. तो दैट्स द रीजन आई एम टेलिंग यू, सिमुलेशन बेस्ड ट्रेनिंग के कैंप्स मत करो सर. आप एक सिर्फ कमेटी फॉर्म करो, वो कमेटी का बंदा काम करेगा आपके लिए. सो दिस इज द सेकंड वर्क दैट आई हैव गिवन फॉर डॉक्टर MC पटेल. इक्विपमेंट ड्रग्स फॉर रिससिटेशन. पहले जब हम लोग जाते थे ना, मी एंड डॉक्टर MC पटेल, वी यूज्ड टू टॉक अबाउट मिनिमम बॉयल्स एंड डिफिब्रिलेटर होना चाहिए. बिकॉज बॉयल्स में क्या रहता है, यू कैन गिव द गैसेज देयर. इन मॉनिटर क्या रहता है, पल्स, NIBP, ECG. एनीथिंग एल्स इज रिक्वायर्ड ऑन मॉनिटर? एनी एनेस्थेटिस्ट हियर है ना? 2-4 है. अरे यहाँ ही बैठे एनेस्थेटिस्ट. ओके, सो विल यू बी हैप्पी विथ अ डिफिब्रिलेटर एंड अ मॉनिटर विच इज शोइंग pulse, NIBP and ECG alone? Now you will want to have an anesthesia workstation What is the medico-legal importance of an anesthesia workstation? Is now you can always say that मेरा छोटा सा nursing home था, लेकिन मेरे पास ventilator भी था. So that is one thing. And you imagine an anesthetist. अगर cardiac arrest हो गया and he is your anesthetist, वो pump करेगा या drug देगा? अकेला आदमी क्या कर सकता है? So at least if there is a workstation, the pumping will be done by the machine and he'll have hands free to give all the drugs. So now even a small nursing home should have an anesthesia work. So next time after 10 years नहीं, मैं next time मुझे 2 साल के बाद बुलाओ और मैं 2 साल के बाद आऊँगा और मैं पूछूंगा how many small nursing homes have an anesthesia workstation, and everybody should raise the hand then. Now at this moment small nursing home किसके पास anesthesia workstation है? 1, 2, 3, 4, 5 बस, that's all. Next time पूरे हाथ ऊपर होने चाहिए. Number 1. Number 2, monitor with ETCO2. You cannot have a monitor with pulse, NIBP and EC. उससे कुछ नहीं होता. वो मॉनिटर सिर्फ लोगों को यानी कि इम्प्रेस करने के लिए रहता है, बाकी वो मॉनिटर का वैल्यू कुछ नहीं. ETCO2 रहेगा तो वो मॉनिटर का वैल्यू है. एयरवे, ऑल एयरवे इक्विपमेंट्स, LMA, बिकॉज इन LMA इज वन थिंग. जैसे जितना आसान यूरिनरी कैथेटर डालना है ना, उतना ही आसान LMA है. So you should, every nursing home should have an LMA. Till the time that he comes, you can at least put an LMA. और पेशेंट का रेस्पिरेशन तो आपके हाथ में रहेगा. सो एन LMA एंड एन एमरजेंसी ट्रे. बड़े बड़े हॉस्पिटल में क्रैश कार्ड रहते हैं, हमारे पास एक ट्रे हो सकता है और ट्रे में सब कुछ रखो, ट्यूब, ड्रग्स, स्टिकिंग प्लास्टर, कैची, सब कुछ रखो. सो दैट सिस्टर को सिर्फ बोला, सिस्टर गेट एन emergency tray and she'll be able to give you everything to manage a cardiac arrest. So this is what I did. And when I was the president of Pune Obstetric and Gynec Society, मैं क्या करता था, अंदर आप आने के पहले बाहर एक मैनिकिन रखता था और मैनिकिन के बाजू में एक LMA रखता था. So before you enter, वो साइन लेना इंपॉर्टेंट नहीं था. बिफोर यू एंटर जस्ट पुट इन एन LMA and then enter the hall. So now what happened in Pune, all the gynecologists are trained in putting in an LMA, and I can tell you 2 cases wherein before the anesthetist came, the gynecologist could put the LMA and the respiration was secured and we could save those 2 patients. Otherwise there would have been 2 more mortalities in Pune. So document your resuscitation well. While documenting resuscitation, it is very easy for you to just copy whatever has been written somewhere. Now, so have a pre-printed, laminated protocol for cardiac arrest and anaphylaxis ready and printed on the wall of your labor room or your OT. So जब notes बना रहे हैं, आपको सिर्फ copy करना है वो notes को. Because अगर मैंने आपको बोला चलो उठो और मुझे बोलो cardiac arrest का management, अपनी ततपप हो जाती है ना, याद नहीं रहता. But if you have everything ready, you can just copy it. So just copy and keep simulation-based scenario logbook with you. अगेन आफ्टर प्रेसिडेंट्स का इनका ईयर खत्म हो जाएगा, सबके पास में एक लॉगबुक होना चाहिए टू प्रूव इन द कोर्ट ऑफ लॉ ऑल्सो कि मैंने सिमुलेशन बेस्ड इंट्यूबेशन एंड एडवांस लाइफ सपोर्ट का ट्रेनिंग किया था. सो दिस ट्रेनिंग सर्टिफिकेट विच कैन बी देन गिवन बाय फॉक्सी विल हेल्प मेनी ऑफ आवर डॉक्टर्स इन द कोर्ट ऑफ लॉ लेटर ऑन. नो एक्सपायरी डेट ड्रग्स इन योर हॉस्पिटल. मैं अभी आपके किसी के भी नर्सिंग होम में आके एक एक्सपायरी डेट का ड्रग का एम्प्यूल ढूंढ सकता हूँ. विच इज दैट एड्रीनलिन, बिकॉज उसका एक्सपायरी बहुत स्मॉल रहता है. सो बी केयरफुल, बिकॉज कुछ भी प्रॉब्लम हुआ तो पुलिस विल पिक अप दोज ड्रग्स. यू मे नॉट हैव एनी यूज. देयर वन केस इन पुणे, ट्यूबल ligation done under spinal anesthesia, and the police came and they found one ampule of scoline which was post expiry, and they said patient died because of that. So no expiry date drugs there. No prescription for life-saving drugs. The fact that you are given a prescription for life-saving drug means that your hospital was lacking that. तो अगर मेरे हॉस्पिटल में ऑपरेट कर रहा हूँ, मेरे पास लाइफ सेविंग ड्रग नहीं, मनु भाई को फ़ोन करो, अरे जहाँ एक लाइफ सेविंग ड्रग लेके आ. डोंट गिव द प्रिस्क्रिप्शन टू द रिलेटिव. आई नो ऑफ वन केस इन पुणे वेयर प्रिस्क्रिप्शन फॉर अ पेंसिल सेल फॉर पल्स ऑक्सीमीटर वॉज गिवन to the relative, and this is person is trying to defend a case of cardiac arrest during cesarean section. So now can he prove in the court of law कि उसके पास pulse oximeter ready था? Can he prove in the court of law the patient monitor कर रहे थे? So these things you have to be very careful about. Call for help, because the moment somebody calls you for help, you feel ये झंझट में कौन पड़ेगा, उधर जाके patient already मरने वाला है, मैं जाऊँ तो मैं भी वो केस में लटक जाऊँगा. No. When you go in any hospital as a good Samaritan, the courts are not so unreasonable to put you into trouble also. So if you have done something, unless you did something palpably wrong, you went there and you did something palpably wrong, then the court will consider you to be negligent. for somebody else's negligence, if you go there and you try to save the doctor as a good Samaritan, you will not be held liable. Communicate with your staff first. So even before I am talking about communicating with the relatives of the patient, I am talking about communicating with the staff. Call everybody, the staff, the ayah, the nurse, the metrani, the receptionist, and tell them what happened and why it happened. The reason is, if whenever there is a death on table, relatives आपको आके पूछते नहीं क्या हुआ, वो आया मेत्रानी को पूछते अरे अंदर क्या हुआ. They try to ask them. So if the ayah says something else, the receptionist says something else, the ayah says patient का तो bleeding होके मर गई, or you are trying to defend the case as amniotic fluid embolism, then you are in a mess. So call everyone, tell them what happened, why it happened, so everybody will be actually talking in the same voice, and it will be helpful for you to defend the case in the court of law. Even if you are closing a dead patient, check the mop count. Even on table the patient is dead and you are closing the patient, check the mop count, because ये patient का अगर PM हुआ तो PM में अगर mop मिला तो आपकी negligence को और enhance हो जाता है. So be careful. ये मैं क्यों लिख रहा हूँ? Because I have gone through it. I was already closing a patient of a death that occurred on table, and my junior anesthetist told me, sir, mop count dekh lo. And I did not understand the importance then. Now I understand why he said so. Shift the patient to a tertiary hospital. We may have to shift the patient in two situations. One is after death. Now, many years back, people used to give an advice that अगर आपके while you are operating, if there is a death on table, आप एक काम करो, वो पेशेंट को आईसीयू में शिफ्ट करो, डेड बॉडी को आईसीयू में शिफ्ट करो, and make a show that we are making some efforts to save the patient and declare the patient dead not in the OT but through the ICU. Do you think it is a good idea or a bad idea? It's a bad idea, because in present day situation we have got all the record of on the monitor of when the heart stopped. It was okay in the good old days when there were no monitors. Now there are monitors, so the court will be able to find out when exactly the patient died. And if you try to do all this kind of a thing, then it only means that you are actually doing a forgery, and for forgery the punishment is arrest, and for any negligence the punishment is compensation, which who's going to pay? The professional indemnity insurance company is going to pay. So this is one. After that, and before that, take a very joint and defendable decision. Hemodynamically stable patient, accompanied by doctors who are actually trained in resuscitative measures like a BLS or an ACLS training certificate, with all the resuscitative drugs, with a well-equipped ambulance, with a transfer notes and a document to the closest center of patients or the relative's choice. And if the choice is left to us, closest center we have where you got RAPO. वो tertiary care center के साथ आपका RAPO होना चाहिए, and if not affording, to any of the government hospital. And consent for transfer we say for abundant caution, but if it is an emergency, you can transfer the patient even without a consent. Complete the paperwork, because paper should not be too visibly manipulated, not too perfect, not many omissions of obvious step, no contradictory notes, and absence of consent. So why I am saying all this is because हम लोगों को एक we take pride in saying ना patient को देख के मुझे पता चलता है उसको appendicitis है, देख के मुझे पता चलता है. We take pride in our clinical knowledge के patient को ऐसा देखता हूँ ना मैं diagnose करता हूँ. तो वैसे ही in one of the conferences one of the judges said आपका पेपर देख के हमको पता चलता है कि manipulated है. So don't be under this impression that you can manipulate और court में पता नहीं चलेगा. Be very careful about that. Supposing, are there any junior resident doctors here? Junior resident doctors, anybody? नहीं. तो I always ask these questions कि अगर आपने एक patient table पे लिया और there is a table death and later on you came to know अरे consent लेने को भूल गए थे, तो आप क्या करने का? Anybody wants to give an answer? क्या करने का? Patient तो मर गया, अब क्या करने का? मनुभाई ने क्या दिखाया था consent पे? Left hand impression, है ना? And a sign, left hand, so left hand impression then. This was exactly what was done in a hospital in Bombay. A left hand thumb impression was taken, and later on in the court of law it was found that the patient was MA in English literature. Now MA in English literature will ever give a left hand thumb impression? Never. So, and then what was proved? That the doctor had done forgery. Forgery means arrest, and negligence means compensation. So what will you prefer? Arrest or compensation? compensation. So that's the reason why I always say don't get into all this forgery. Set the OT in order. ये सारी चीज़ें हैं. Clean the floor, dispose the blood-stained drapes, check all equipment. Check all equipment में कौन सा equipment बहुत important है? ऑक्सीजन सिलेंडर. पुलिस को और कुछ नहीं समझता. पुलिस को सिर्फ ऑक्सीजन सिलेंडर ओपन है कि क्लोज है उनको समझता है. सो चेक ऑल इक्विपमेंट, सेव ऑल मटेरियल, चेक द एक्सपायरी. ये जब मैं बोल रहा हूँ ना, क्लीन द फ्लोर, डिस्पोज द ड्रेप, कोई अगर लॉयर यहाँ बैठा होगा ना तो वो क्या बोलेगा? आप कौन है सर? एम आई नॉट इरेजिंग क्राइम सीन का सब एविडेंस को मैं इरेज कर रहा हूँ ना? हाँ, तो मेरी बातें सुनो लेकिन कहीं बाहर जाके बोलना मत प्लीज. राइट? सो दिस व्हाट आई एम टेलिंग यू इज अबेंडन कॉशन. चुपचाप ये सारी चीजें ऑफ द डायज है. क्योंकि क्या होता है सर, एज सुन एज समबडी एंटर्स ना, हमें तो लगता है दिस इज अबाउट 300 ml ऑफ ब्लड लॉस, लेकिन पेशेंट के रिलेटिव क्या बोलते हैं? बकेट भर के ब्लीडिंग हो गया था. पूरा बाल्टी भरी ने ब्लीडिंग थी, सो वॉट एवर इन गुजराती. सो दिस इज द वे पीपल understands bleeding. So what you do is clean the floor, dispose the dread, check the equipment, especially the oxygen cylinder, save the material, check the expiry. The last one is check the endotracheal tube. So what will I do to check the endotracheal tube? The anesthetist would tell me that the endotracheal tube is in the trachea, isn't it? ये चेक करना है ना डेड बॉडी के ऊपर कि बहुत ट्यूब ट्रेकिया के. दिस वाज एग्जैक्टली व्हाट वाज डन इन वन केस अगेन फ्रॉम बॉम्बे. उसने चेक किया दैट द ट्यूब वाज इन द ट्रेकिया, लेकिन बॉडी को उठा के जब ट्रॉली से बेड ऑपरेशन थिएटर के इसके ऊपर टेबल से ट्रॉली पे लिया, द ट्यूब वेंट फ्रॉम द ट्रेकिया टू द इसोफेगस. सो पोस्टमार्टम में क्या आया? The tube was in the esophagus. So now what I advise myself and Manubhai nowadays give is tube निकाल के बाजू में रखो. पुलिस आने के पहले ट्यूब निकाल दो. So these are some of the ideas which we actually start giving with experiences. It is the lecture on medico-legal cannot be the same 10 years back and today. Things change, and we also, our advice also sometimes change. इन्फॉर्म द रिलेटिव इज अ सेरेमनी. ये हिंदी पिक्चर जैसा नहीं हो सकता है बाहर आके बोला आपकी हम पेशेंट और बच्चे में सिर्फ बच्चे को बचा सके, माँ मर गई. ऐसा बोलना इतना हिंदी पिक्चर में चलता है, एक्चुअली चल नहीं सकता है. सो यू हैव टू स्लोली बिल्ड अप. From time to time give information, and then information has to be given by a senior with proper communication protocols, and the communication skills is something called as spike protocol. Spike protocol कहाँ पे सीखेंगे हम लोग? लेक्चर पे सीखेंगे क्या? There is a protocol of communication. So is it nice to understand spike protocol sitting in an AC hall and listening about communication skill? No. Where should we learn it? In simulation based training again. So another importance of simulation based training, no blame game. क्योंकि क्या होता है, the surgeon would say नहीं ऑपरेशन तो सब अच्छा हो गया, लेकिन क्या हो गया ना, तो वो ऑक्सीजन थोड़ा कम गिर गया और एनेस्थेटिस्ट उनको ऑक्सीजन दे नहीं पाए. So what is he trying to say? मैं ठीक हूँ लेकिन एनेस्थेटिस्ट का गड़बड़ है. या एनेस्थेटिस्ट को पूछेंगे तो बोलेंगे ऑपरेशन तो सब ठीक हो रहा था, ब्लीडिंग बहुत हो गया, इसके लिए ब्लड प्रेशर लो हो गया, इसके लिए प्रॉब्लम. डोंट डू दैट. द मोमेंट यू स्टार्ट डूइंग इट, द केस इज वन बाय the devil's lawyer. So be prepared for a mob frenzy also. So these are important things which you have to remember when you are talking with the relatives. 4 major questions. We will actually answer these questions and then I'll rest my case. Right? Rest my case. This is what the lawyers say. After everything, I'll rest my case. Number 1, should all death on table, including maternal death, be informed to the police? Yes or no? Yes or no, sir? Exactly. So now, here is a lawyer he's got a knowledge about the statutory requirements of the country. अगर मैं कल एक हार्ट केस को ऑपरेट कर रहा हूँ जो ASA ग्रेड 4 है, वो मरने वाला ही है, तो हर every heart case that dies on the operation table, I am supposed to inform the police? No. But for abundant caution, because in obstetric cases, supposing I am an obstetrician, in obstetric cases the patient is young and patient is not expected to die on table. That is the narrative that the people have. It is better for abundant caution to call the police. Why to call the police? To come and decide whether medico-legal PM is to be done or not. Which means, I am asking you your question, is the onus of trying to convince the relative for doing a medico-legal PM upon the doctor or the police? It is upon the police. और हम लोग क्या करते हैं, ये अपनी जवाबदारी ऐसा लेते हैं, नहीं नहीं हमको ये पेशेंट को मेडिकोलीगल पीएम के लिए भेजना पड़ेगा, ये करेगा, और वो ऊपर के आके मॉब वायलेंस शुरू कर देता है. सो यू हैव टू जस्ट से दैट द पुलिस विल डिसाइड. इफ यू नो द कॉज ऑफ डेथ, can you give the death certificate even in a maternal death? Yes or no? Is there any statutory law which says that I cannot give a cause of death if I know the cause of death? For example, I am operating on a LSCS for placenta previa, and the patient died because there was a lot of bleeding, and then because of which there was a multi-organ failure, and because of which patient was in irreversible shock and the patient died. Do I not know the cause of death? Yes, I know the cause of death. So there is no statutory law in our country which prevents you from giving a death certificate if you know the cause of death. So if you have called the police, tell the police that I can give a cause of death if you want. And if you do not know the cause of death, tell the police I do not know the cause of death. Let the police decide whether the body has to be taken for a medico-legal PM or not. Which comes to our next question, कि हम लोग ये रिलेटिव से लिख के लेते हैं ना कि हमको डॉक्टर के अगेंस्ट कुछ नहीं है, हॉस्पिटल के अगेंस्ट कुछ नहीं. इज इट अ गुड प्रैक्टिस और अ बैड प्रैक्टिस? 10 साल पहले आपने मुझे बुलाया होता और ये क्वेश्चन पूछा होता तो मैं बोलता अरे इसका कुछ वैल्यू नहीं है. नाउ आई से इट इज़ अ गुड प्रैक्टिस, टेक इट. इट मे नॉट हेल्प यू बट इट मे हेल्प द पुलिस. बिकॉज अगर जज ने पूछा कि आपने मेडिको लीगल पीएम क्यों नहीं किया, द पुलिस कैन टेल द जज कि उनने लिख के दिया था, देयर वाज नो सस्पिशन of any problem in the minds of the relatives, and the doctor was ready to give the cause of death, so I took the cause of death. So it may not help you as a doctor, but it may help the police. Can appropriate authority doing that review in a maternal death pull you up for medical negligence? वो जो होता है ना मैटरनल डेथ होने के बाद में लोकल भुज की जो मेडिकल जो अथॉरिटी है, दे विल कॉल यू, मैटरनल डेथ है करके, एंड दे विल स्टार्ट पुलिंग यू कि आपने ये क्यों किया, आपने वो क्यों किया, आपका सर्जरी बराबर नहीं था. डू दे हैव द राइट? एनीबडी फ्रॉम अप्रोप्रिएट अथॉरिटी हियर? नो. सो डू दे हैव द राइट टू क्वेश्चन यू फॉर नेग्लिजेंस? नो. द क्वेश्चन फॉर नेग्लिजेंस विल कम फ्रॉम ओनली द कोर्ट, not from the appropriate authority. That's so you have to remember that they are only supposed to ask you पेशेंट ने आयन लिया था क्या, पेशेंट आपके हॉस्पिटल से कितना दूर रहती है, पेशेंट के पास रिक्शा के पैसे थे क्या नहीं. So all these things they are supposed to ask. They are not supposed to pull you off for any negligence. So remember that. How do we prepare for police panchanama? Give the statements, number and signed copy of the complete indoor paper. If insisting before completion, sign under protest. अगर वो पुलिस आया और बोल रहा है मेरे को अभी के अभी पेपर दो, तो राइट देयर आई एम गिविंग इनकम्प्लीट पेपर, हैंडिंग ओवर टू द पुलिस अंडर प्रोटेस्ट एंड साइन. So that in the court of law there will be a document that the police was harassing the doctor. So the doctor had given the indoor paper before he got any time to complete it. Keep ready 2 female punch. Allow the body to be taken for medico-legal PM and hand over the DC. If the police has come and if you want to give a death certificate, give it, but don't hand it over to the relatives. Hand it over to the police. Now, know whether you can be arrested. Post Jacob Matthews, now you cannot be immediately arrested. There has to be an initial inquiry. Then after the inquiry, it goes to the government hospital. The government hospital forms a committee, and there is an FIR if there is a prima facie evidence of criminal negligence, and criminal negligence is about gross negligence. So the people sitting in the appropriate authority in the government hospital should understand the difference between civil negligence and criminal negligence. Civil negligence means ये क्या कि आपने पिटोसिन ड्रिप शुरू किया लेकिन मॉनिटर नहीं किया, सिविल नेग्लिजेंस. लेकिन क्रिमिनल नेग्लिजेंस के क्या, रॉन्ग फुट ऑपरेटेड, रॉन्ग पेशेंट ऑपरेटेड, मॉफ लेफ्ट इनसाइड द एब्डोमेन. सो ऑल यू हैव टू डू इज find out whether there was a gross negligence or not, and accordingly the compensation is given if there is some. पुलिस आने के बाद पुलिस के ड्रेस में कोई आया तो मुझे डर लगने लगता है. Somebody has come in the police info. अभी मेरा जो जोश से मैं बात कर रहा था वो जोश थोड़ा कम हो जाएगा. पुलिस आने के बाद क्या होता है, जोश कम होता है. so नहीं मैं बहुत बुरा. ओके, लेट्स कोलैब सर. ना आजकल जेंजी का जमाना है, लेट अस कोलैब. So now what happens is, and अनफॉर्चुनेटली जो स्लाइड में बता रहा हूँ ना वो पुलिस की मिसचिफ की स्लाइड है पहले ज़माने के. अनफॉर्चुनेटली क्या होता था, पहले जब डेथ ऑन टेबल होता था एंड व्हेन द डॉक्टर्स यूज्ड टू बी pulled up for medical negligence. Before the BNS क्या होता था? They used to confuse between 304A and 304 Part 2. एंड यूजुअली वो क्या करते थे ये पुलिस वाले, हम लोग को 304 पार्ट 2 में अंदर डाल. इफ टाइम परमिट्स में ये व्हाट इज द डिफरेंस बिटवीन 304A एंड 304 पार्ट 2 मैं बता देता हूँ, बिकॉज नाउ इट इज नॉट गोइंग टू बी सो, बिकॉज आफ्टर BNS थिंग्स हैव चेंज. पहले क्या था? देयर आर 3 थिंग्स: कंडक्ट, नॉलेज एंड क्या था तीसरा? हाँ, कंडक्ट, इंटेंशन एंड नॉलेज, राइट? 3 चीजें रहती हैं. फर्स्ट ऑफ ऑल, ऑपरेट करते समय पेशेंट मर गया, कंडक्ट है, कंडक्ट है, राइट? इंटेंशन है. डज द डॉक्टर हैव एनी इंटेंशन टू कॉज डेथ? नो. तो नो कंडक्ट है, नो इंटेंशन, नो नॉलेज, 304 पार्ट ए, 2 years imprisonment वगैरह वगैरह. 304 पार्ट 2 नॉन बेलेबल. कंडक्ट है, यस. इंटेंशन है, नो. नॉलेज है. पुलिस क्या बोलती थी? आप तो डॉक्टर है, आपको तो सब कुछ आता है, आप नॉलेजेबल हो कि आप ऐसा करोगे तो पेशेंट मरेगा. सो अंडर दैट दे यूज्ड टू पुट अस इन फॉर 304 पार्ट 2 विच वाज अ नॉन बेलेबल अरेस्ट. नॉन बेलेबल है, बेल टू बी टेकन बाय द given by the magistrate. So this was going to, this used to happen, and the और फ्राइडे को अगर अरेस्ट किया तो देखो, यानी कि डॉक्टर को अंदर डालते थे. अभी क्या हुआ? Then we used to go there and argue with the police. There is a difference between having knowledge and being knowledgeable. Because I am a doctor, I am knowledgeable about the anatomy of the body, about the physiology of the body, but I do not have knowledge in the legal term. But ये उनको है ना बताने में बहुत problem होती थी. And it used to happen that some of the police, some good police used to understand, but some bad police used to not understand, and they used to put our doctors inside the jail for 2 days, 3 days, 4 days, and that used to be a problem. Thanks to Manubhai, thanks to him, that now BNS has come. After BNS, medical negligence has been codified. The पहले ज़माने में डॉक्टर का negligence अलग से नहीं देखा जाता था. Any death used to be judged by 304 and 304 Part A, 304 Part 2. Now there is a BNS 106(1), which is same as 304A. So अभी क्या होने वाला है? अभी ये जो पुलिस की मिस्चिफ थी ना पहले between 304A and 304 Part 2, this will not be true anymore. Now we will be seen under the same lens and we will have no problem. However, Manubhai has still made one mistake. And what is that mistake? They have included all the modern medicine people in this BNS Act. Unfortunately, the Ayush doctors are not yet still that. So the definition of the registered medical practitioner in 106(1) is about allopathic doctors. The definition doesn't include Ayush doctors. So Ayush doctors will have to do a lot of advocacy to see to it that they are not into this. Yours truly will always be available on this phone number for any of your questions. Thank you very much for a patient listening.
Thank you very much, sir. We will have some 2 or 3 questions only due to time constraints. Sir, the first question is, many relatives are refusing PM examination after death in MLC cases. So what should be our approach if they are willing after constant force? What should we do?
आपके क्वेश्चन में ही आपका आंसर मैंने पहले दिया. सो ये जो ओनस है ना ऑफ trying to convince the relatives to send the body for medico-legal PM, this is not your job at all. First of all, ये दिमाग से निकाल दो कि medico-legal PM के लिए पेशेंट को भेजना, बॉडी को भेजना, ये आपका काम नहीं है, ये काम पुलिस का है. Your job is to just call the police and tell the police one of the 2 things. One thing is, if you know the cause of death, tell the police मुझे cause of death पता है. अगर आप कहते हो तो मैं देने के लिए तैयार हूँ. Give the cause of death and hand over the cause of death to the police. That is point number 1. If you do not know the cause of death, you tell the police मुझे cause of death पता नहीं है, आपको जो करना है करो. Let the police talk to the relatives that the body has to be taken for medico-legal PM. It is not your job at all. So that is the answer.
Any other question from audience? Dr. Vinit Thakab.
Sir, my question is about death in general. One scenario is death at home, and one scenario is death, brought death to the hospital.
Correct.
In that case, what is the legality and what is my responsibility? I'm supposed to declare that it's okay, I cannot give the cause of death.
Yeah.
But what is my legality in that case? Suppose if in later date they claim that something was wrong and all that, so what becomes in that case?
I got your question, and usually such questions come from family physicians, but you are a hospital owner, you may be on hospital. You are so this, and my brother is a family physician, so we have discussed with my brother about this question. The legal take on this is you should give cause of death to only the person whom you are treating, number one. And ये जो अपन बोलते हैं ना कि whether the consent is valid for 48 hours or 72 hours, ये all this is nothing is mentioned in the law book. कोई भी स्टैट्यूटरी लॉ नहीं, ये हम लोग ही बनाते हैं. हम लोग ही बनाते हैं कि हॉस्पिटल को अगर पेशेंट को 48 आवर्स पहले कंसेंट लिया है तो इट इज़ वैलिड, 3 दिन पहले लिया है तो नॉट वैलिड वगैरह हॉस्पिटल की पॉलिसी. नाउ विल कमिंग बैक टू द योर डेथ. इसके ऊपर हम लोगों ने अपने ऊपर एक रूल बना दिया है कि अगर आपने वो पेशेंट को प्रीवियस 15 डेज में देखा है, नंबर वन देखा है, और आपको उसको डायग्नोसिस मालूम है दैट ही इज़ अ हार्ट केस, देन यू कैन गिव अ cause of death. So a cause of death can be given to a patient whom you have been treating and you have seen that patient in the 2 weeks prior to the date that the patient came to you. Very easily said, but very difficult for family physician, because family physicians में कभी कभी patients आते बोलते मेरे पिताजी घर पे है और घर पे उनकी मौत हो गई है, and you have never seen that patient, and फिर हम लोग क्या करते, cause of death is cardiorespiratory arrest because of myocardial infarction. यानी ये है एक जुगाड़ है. इसका मतलब ये है इंडिया में मायोकार्डियल इन्फेक्शन ज़्यादा से ज़्यादा हो रहे हैं. क्यों? क्योंकि हम लोग जुगाड़ करते हैं, राइट? सो दिस इज़ वन थिंग दैट this the answer to your question is yes. If such a dead body comes to your hospital, ideally legal answer is don't give a cause of death, but the practical answer is आपको when you are a family physician आपको थोड़ा थोड़ा जुगाड़ करना पड़ता है. Some answers are off the dais and some are on the dais. On the dais, send the body for PM.
Good morning, sir. Thank you for very beautiful information. Sir, being a dentist, I want to know if accused person impression or any small treatment which is not under anesthesia, local anesthesia, do we need to take a consent when it is order given by government?
Yes, yes. I think you should see why a consent. There is something called as an express consent. आज अगर मैं gynecologist हूँ and patient comes to me and I have to do a per vaginal examination, it is understood that she is ready for a per vaginal examination. But when I want to do a breast examination on that patient, then I have to take an express consent. I have to ask her, मैं आपका breast examine करना चाहता हूँ, मैं करूँ या ना करूँ. जब वो हाँ बोलेगी तभी मैं करता हूँ. So when you are doing a procedure in your dental clinic under anesthesia, even if it is a local anesthesia, this local anesthesia can also have some complications, right? The probenecid that is there in the local which as a preservative can cause problem. So whenever you are doing anything under local anesthesia, I think there has to be a written consent also. पहले ज़माने में हम लोग ये argue भी करते थे. When Manubhai just said that there is no need for written consent, पहले ज़माने में हम लोग argue करते हैं कि the fact that the patient came in the hospital, the fact that the patient went on the operation table, it means that she gave a consent for surgery. But now it is no more valid. We have to take a written consent. How much time does it take to just to take a written consent on that? So one thing is even if you are a dental specialist, you have to take a written consent for the procedures that you. I have never seen a dentist taking consent. मैं कल ही करके आया मेरा RC. उसने कब मेरा consent लिया नहीं. अगर कुछ होता तो.
One more question, last question, Verma Sahib.
Good morning, sir. I am also a dentist. So recently I came up with a discussion among a WhatsApp group that in a Hyderabad court, a judge refused the written consent and he has asked for audio-visual consent. So how feasible is that and how practical?
Yeah, so see, as per the IT Act, something that is going on audio-visual can be considered to be a consent provided you have taken a consent prior to, like आपने कैमरा लगाया, बताया ही नहीं कि कैमरा है, और पेशेंट से बात करते समय बोला मैं अभी तुम्हारे दांत निकालूंगा या वॉट एवर हिस्टेक्टमी करूंगा, then that is not a consent. But if you tell the patient that whatever we are discussing is going to be recorded and it will be kept as an evidence for the counseling that we are doing, then that can be taken as a consent. And what I want again, Dr. MC Patel to do, क्या होता है कभी कभी you have a patient who is say ruptured ectopic, patient का BP 70 है, अभी मेरे को इस patient को immediately लेके जाने का ऑपरेशन थिएटर में और इमीडिएटली ऑपरेट करने का, तो मैं उसके रिलेटिव को अंदर बुलाऊं, देखो ये रप्चर्ड एक्टॉपिक है, इसमें ऐसा होता है वैसा होता है, ये मैंने आपको एक्सप्लेन किया, ये जो मैंने आपको एक्सप्लेन किया ये कागज़ लो, इसके ऊपर नीचे साइन करो. इतना टाइम है क्या मेरे पास? नहीं है. सो व्हाट वी डू इज वी जस्ट कॉल द रिलेटिव्स, and because now she's not in a state to give the consent, so you talk to the relatives. What I am telling is the minimum that you can do, you can have an app which I want Manubhai to develop for us. Have an app and tell on the app कि ये अभी मैं record कर रहा हूँ, whatever I am talking with the relatives, keep the mobile there and talk to the relatives. Whatever you have spoken to the relative will be taken as an evidence in the court of law that you have actually taken an audio-visual consent and then started. So all these consents, the solutions have to be simple. You cannot have difficult solutions. Many of the medical legal experts give you difficult solutions. नहीं, आपको consent लेना ही पड़ेगा. आपको patient ने refuse किया तो आपको refusal consent return में, ये जितना आप उसको से, ये जो consent के ऊपर डॉक्टर की साइन होनी चाहिए, पता है पहले हम लोग लेते थे क्या? नहीं old timers here, old timers sir, पहले लेते थे अपन, कभी लेते थे, डॉक्टर साइन करता था. अभी क्या है, अपने डॉक्टर्स लॉयर्स बन गए ना, तो फिर लॉयर जाके बताना शुरू कर दिया कंसेंट इज अ कॉन्ट्रैक्ट, और फिर डॉक्टर को भी. सो हम ही अपनी कबर खोदते मेनी अ टाइम. सो गुड ओल्ड डेज में आई नेवर यूज टू साइन माई कंसेंट, नाउ डेज आई हैव टू साइन बिकॉज मनुभाई टोल्ड मी दैट कंसेंट इज अ कॉन्ट्रैक्ट. सो what I tell these medical legal experts, make it simple for us, don't make it difficult for us. So simple solution is just tell that I am going to take an audiovisual consent with you and you can keep it and that will be taken as evidence in the court of law.
Does CCTV camera with the mic counts as audiovisual consent?
आपके हॉस्पिटल में यहाँ वहाँ CCTV कैमरा लगा है ना, that cannot be taken as a consent.
Okay.
A CCTV camera specifically in your consulting room for the sake of for the sake of counseling, there you record that I am talking to you and this is going to be recorded for the purpose of consent. First have that recording. When the judge will see that recording, then the judge will say yes, this was a proper consent.
Okay. Sir, one more question. There is a patient showing up at my clinic and minor surgical procedure has to be done. We have taken the measurement of blood pressure as a precaution and the pressure comes at 170 or 110 and I refuse the procedure. Patient says that मेरा BP तो इतना ही रहता है, हमेशा आप करके दो, I am ready to give the consent. Should it be done or not?
No. Patient कुछ भी बोलेगा, मेरा BP इतना ही रहता है. You are a clinician. No, see, court are not so. आपको अपने क्या लगता है ना, courts बहुत unreasonable है, because you come and see and all the cases being shown on the ये ना screen, हमें लगता है कि court बहुत unreasonable है. Court is not that unreasonable to doubt your clinical acumen. So if you feel that this BP is high enough not to do the surgery today and it has to be done tomorrow after the blood pressure is controlled, you are the boss and you will take that decision.
Thank you, sir.
Thank you, everyone. We are concluding the second session. We'll now move towards the third talk, and the talk is of Dr. MC Patel about criminal negligence in medical practice. On behalf of Indian Medical Association, NMO and Dental Club of Bhuj, I would like to welcome all the dignitaries, Mr. Hemsi Chaudhary sir, Mr. Rajesh Thakkar sir, MJ Christian sir and Jetty sir. We welcome you all from our bottom of our heart. Our next topic is criminal negligence in medical practice.
Criminal litigation or criminal liability is a major threat over and above civil litigation and litigation under CPA. Because if you are served with a notice or you are facing any litigation under civil suit or CPA, you have time. You have time to contact your seniors, you have time to contact your advocate, medical legal expert, you have time to reply the notice. But as far as this criminal part is concerned, many a time straightway police comes, you are under arrest. So in this situation, exactly what is criminal liability and which are the defenses for that, we are going to discuss. So I mentioned prior also, when any patient comes to you and you accept her to treat, it becomes a contract or implied contract between patient and yourself. And before that, we have to understand negligence. What is negligence? In our medical curriculum, we are taught two words, act of omission and act of commission. So, act of omission means not to do something which a reasonable prudent doctor would do. Say for example, if we have to give injection penicillin, any prudent doctor would go for negative test dose. And if it is test dose is negative, then only he will give full dose. And without test dose, if full dose is given and something goes wrong, then it becomes a act of omission. And same way, act of commission. Act of commission means doing something which a reasonable prudent doctor would not do. Say for example, if it is a planned surgery, you have advised patient to come nil by mouth, and patient has come with full stomach, and surgery is planned in general anesthesia. Naturally, no prudent doctor will give anesthesia, general anesthesia on full stomach. And if you give and something goes wrong, then it becomes a act of commission and it becomes a negligence. So, in short, to understand what is negligence, breach of legal duty or care owed to patient by doctor, whereby patient suffers damage physical, psychological or financial. So, there are 4 ingredients of negligence. In court of to prove negligence against doctor is difficult. I repeat it, it is difficult one. So, there are 4 ingredients and one will have to prove in court of law. One is existence of legal duty. So, I mentioned prior also, as soon as any patient comes to you and you accept patient to treat, then your legal duty starts from that point of time, breach of that duty. So, for any reason, if there is breach of that legal duty, that you didn't take proper care and something goes wrong, but very important part is damage suffered by patient. There should be some damage to the patient is also one more ingredient, and very important ingredient is doctor's conduct is direct and proximate cause of such damage. So, it should be proved beyond reasonable doubt that doctor actions was responsible for that damage which patient suffered. So, this is basics of negligence, and with this coming to our proper topic. Can doctor be prosecuted for negligence under 304 IPC old version and now section 100 or 106 of Bharatiya Nyaya Sanhita? Offense under IPC related to medical profession. So, as far as IPC part is concerned, 304 causing death by negligence, 336 act endangering life and personal safety, 337 causing hurt by act endangering life, causing grievous hurt, that is 338, 312 to 316, that is related to miscarriage. Even today, to terminate pregnancy is a crime under this IPC section 312 to 318. Now newer version, Bharatiya Nyaya Sanhita. But we have shelter of umbrella with MTP Act 1971. Under 1971 MTP Act under section 2, it is very specifically mentioned. If you have terminated pregnancy in accordance with provision of MTP Act 1971, then no other law, IPC or any law time being in force will be applicable to you. But you will have to prove that you had terminated pregnancy in accordance with MTP Act 1971. 269 to 272, that is negligent act likely to spread infection or disease which is endanger to life. This is also one criminal offense. So, main worry for medical practitioner is section 302. As such, there is no intention of any doctor to kill any patient. So, usually 302 IPC, now newer version, BNS, is not applied. But in one of the cases which happened in state of Rajasthan, one of our gynecologists was charged with 302. In that very case, there was case of PPH and patient expired. And she was so scared and she committed suicide. and then after there was much agitation, etc. I do not want to go into detail, but usually 302 is not applied in any medical negligence or so. Section 304 and 304 very nicely mentioned by Dr. Dilip Walke, but in short, there are three words we have to mention: intention, knowledge and care. If anybody inflicts any injury to anybody with intention to cause death, then it is an intentional act, and under section 299, 302 or old version of IPC, it was punishable offence up to lifetime imprisonment or sometime death sentence also. But if anybody inflicts any injury to anybody with knowledge that this injury is sufficient to cause death in ordinary course of nature, then it becomes a culpable homicide, not amounting to murder, and for that 10 years of imprisonment is the provision, and it is non-bailable. And as far as 304A is concerned, that is death due to rash and negligence. So in this, it is 2 years imprisonment, it is bailable on police station level only. Now newer version is section 100 and section 106 mentioned by Dr. Dilip Walke, so I do not want to go into detail. But it is very obvious, negligent act is not so severely punishable as an intentional act, and most often applied in cases when patient dies as a consequences of and during medical treatment, and point in issue is whether doctor has taken adequate care and caution to prevent serious consequences of this action. This is taken into consideration at the time of deciding any case. And this section specifically tries to punish carelessness and negligence which has resulted into death. So, very important question, can doctor be prosecuted for criminal liability? So, is very important question. And very famous case of Jacob Matthews versus State of Punjab, which was decided in 2005 in Supreme Court, and Supreme Court came up with guideline in this type of situation how case should be interpreted, and mentioned by Dr. Walke also. But before that, Jacob Matthews versus State of Punjab, this case was taken as a base in that very case, that is Suresh Gupta versus Delhi High Court. In that very case, it was case of nasal deformity, and Suresh Gupta is plastic surgeon in practicing in Punjab, and patient was for planned surgery for nasal septum defect, and during that very surgery there was some complication and patient died on the table, and case was filed. Lower court and high court awarded punishment to doctor, and he was held criminally liable, and Suresh Gupta preferred appeal in Supreme Court, and in Supreme Court this case was decided at length. So allegation in that very case was, on investigation the cause of death was found to be not introducing cuff endotracheal tube of proper size at proper place in proper time as to prevent aspiration of blood from wound in respiratory passage. It was the allegation for that very case. So at the time of deciding this case, just I mentioned, magistrate and high court declared doctor negligent, but in Supreme Court was very clear, and that case was quashed. And why that case was quashed and what was the observation on part of Supreme Court? In present case, even if argument of prosecution that aspiration occurred because cuff endotracheal tube was not put in proper time and proper place and proper size was accepted to be true, then also he may be considered liable in civil suit, but not in criminal negligence, because to charge anybody criminally liable, it should be gross negligence and reckless standard of care should be considered. Then only one can be prosecuted under criminal liability. It was inference held on part of Supreme Court. And to charge criminal liability, magnitude of negligence should be very gross and reckless standard of care. Otherwise, one can be tried in tort or civil liability. It was consideration on part of Supreme Court in this very particular case. So, court held that for act of negligence, he may be liable in tort, but his carelessness or want of due attention and skill cannot be described to be so reckless or grossly negligent as to make him criminally liable. So in this case, Supreme Court came up with some guideline, and before that it was very specifically mentioned, because after this case there was misinterpretation in medical fraternity that after some decision from Supreme Court, there are many misconceptions in medical profession that they cannot be arrested or they cannot be criminally liable. So it is not like that. So with this background of this Suresh Gupta case, in this Jacob Matthews case, Supreme Court came up with guideline. In that very case, fact of the case was, patient was terminally ill patient as far as malignancy is concerned, and patient was offered only palliative treatment or nursing care. But his son requested hospital to get him admitted because to give nursing care at home was not possible. So he was admitted, and during course of this treatment, he was explained that we are not going to cure this patient as far as malignancy part is concerned. We are giving only treatment as far as nursing care or palliative treatment is concerned. But during this admission, patient died and case was filed by his son only, and allegation was when he suffered this cardiac arrest, oxygen cylinder were empty, and when cuff was applied, there was no oxygen in oxygen cylinder, and he succumbed and ultimately he died, was the allegation in this case against Jacob Matthews. So again in this case also, lower court and high court awarded punishment to doctor, but in Supreme Court quashed this complaint and judgment was in favor of doctor. So in this particular case, court was very clear that is there any difference in civil and criminal law in medical negligence cases. So while dealing with cases of negligence in professionals, is there a need for judgment with a difference? So to this question were in mind of Supreme Court at the time of deciding this case of Jacob Matthews versus State of Punjab. So jurisprudential concept of negligence differs in civil and criminal law. What may be negligent in civil law may not be negligent in criminal law, and simple lack of care is enough to prove civil negligence. It was inference held by Supreme Court only. Sufficient to prove negligent of duty by probability of case in civil suit, but in criminal case it should be proved beyond reasonable doubt. Then only criminally one can be held liable, and causa sine qua was applied in that very case, and relief is compensation. So in civil suit under CPA or in civil court, if at all case is lost, then compensation is to be paid. But as far as criminal part is concerned, then in that very situation, there was comparison at the time of discussing. Civil suit compensation depends upon the amount of damage suffered by patient. But as far as criminal part is concerned, punishment depends upon the degree of negligence. And I mentioned in the prior that there should be gross negligence and high reckless standard of carelessness, then only one can be held criminally liable. And principle of vicarious liability is not applied in criminal liability. In civil suit, any fault of your staff, you can be held responsible. But in criminal negligence, vicarious liability is not applied. And two words were discussed at the time of deciding this particular case. Negligence has to be gross and high degree, and this is to be read with qualified with gross negligence. So treatment with a difference. One important question is asked to prove criminal negligence. Does he possess skill he claims to possess? So court expect only ordinary skill, not extraordinary skill. In this Jacob Matthews versus State of Punjab, Supreme Court was very clear, doctors should have ordinary skill, and it can be proved by your degree, whether you are diploma, postgraduate degree holder, and then in that very subject, it is presumed by law that you are expert of that very subject. So you should have ordinary skill, and if you have ordinary skill, that standard requirement is that doctor needs to exercise ordinary skill in profession, and he is not expected to have high skill in branch. In Bolam test, it was decided. So Supreme Court of opinion in that very case of Jacob Matthews at the time of deciding this case. And one more part was discussed. Did he exercise skill with reasonable competence? So if one has applied reasonable or ordinary skill and reasonable care, way in which any prudent doctor would have given that very care in that very given situation, then you are not held responsible criminally. And Supreme Court came up with 3 guidelines. So guideline number 1, private complaint may not be entertained unless complainant has produced prima facie evidence before court in form of credible opinion given by another competent doctor to support charges of rashness or negligence against accused doctor. So who will give opinion that there was prima facie negligence on part of treating doctor? Police is not medical person, relative are also not medical person. So in this situation, case will be referred to medical board, and if medical board is of opinion that it seems to be prima facie negligence on part of treating doctor, then only further investigation or interrogation will be done. So Supreme Court came up with one more guideline. Before proceeding against doctor accused of rash and negligent act of omission, investigating officer should obtain an independent and competent medical opinion, preferably from respective department in government hospital, who is expected to be impartial and unbiased, and who applies principles of Bolam test in that very incident. So all this paper of treatment given will be referred to medical board. Medical board can invite that doctor for personal interrogation also, and then medical board will come up with opinion. But Supreme Court also gave one more guideline also. A doctor accused of rashness or negligence may not be arrested in routine manner. Say for example, applying handcuff. Doctor cannot be arrested that way. It was guideline from Supreme Court, not in routine manner, unless his arrest is necessary for furthering the investigation or collecting evidences, or officer feels that doctor may not make himself available to face the prosecution. So these 3 guidelines were given by Honorable Supreme Court in that very case. And one more case came with Martin D'Souza versus Mohammad Ishfaq. In that very case, Justice Kaju had given all these guidelines, all these 3 guidelines, and Justice Kaju was very clear that at the admission of case only, there should be non-biased opinion from competent authority that there was prima facie negligence on part of treating doctor. So in this case, Mohammad Ishfaq, it was case of urinary tract infection, and with sensitivity to amikacin and methenamide mandate. So patient was treated, and mandate was not used because patient had a renal failure. Amikacin was given, and at the time of discharge, patient was said that now he has to stop amikacin. But patient didn't stop. Patient continued taking amikacin after discharge also, and he ended into hearing loss, and case was filed. So opinion on part of AIMS doctor was also, AIMS doctor were called in court for expert opinion, and they give opinion that amikacin was life-saving and cannot alone cause hearing problem. So there could be some other reasons also for hearing loss, and amikacin cannot be held responsible for hearing loss, was the inference by expert witness from doctor from AIMS, and maybe some other causes. And so doctor was not held negligent in this particular case also in Supreme Court. So in this particular case, Justice Kaju came up with all this observation. Patient didn't complain, took discharge from hospital, and continue amikacin in spite of verbal advice to stop, and amikacin was life-saving. So with this inference, judgment was in favor of doctor, and Justice Kaju had a very good observation that law is watchdog and not bloodhound, and if reasonable care is taken by doctor, will not be held negligent, so doctor need not to worry, and Bolam test should be used while fixing medical negligence in this type of situation. And doctor is expected to have ordinary skill, and court are not expert in medical science, so they will refer patient to, a case to medical board. And so Justice Kaju also in this case came up with all those three guidelines. I do not want to go in detail, but one more guideline he mentioned, that if police has over-exercised power, then police may also be liable for punishment. That was the observation on part of Justice Kaju at the time of deciding this case of Muhammad Ishfaq. And Dr. Dilip Walke would recollect, we were doing one a national conference, medico-legal conference in Pune before judgment of this very case. And Justice Kaju was invited as a chief guest in that very conference. And Dr. Dilip Walke was organizing secretary or chairperson. And we didn't know why Justice Kaju was so keen to discuss this type of situation with us on one table at the time of coffee. He asked us so many questions. What is negligence in this type of cases? What doctor should do when doctor fails to give certain results? And he was with abundant knowledge, I would say, about his case. We were not knowing that he is going to give judgment for that very case. And judgment of this case came after our conference which held in Pune long back. So in that very case, it was very clear that if there is any apprehension of being prosecuted criminally, because many a time we have apprehension that we may be liable criminally and we may be arrested. So in this situation, call your professional colleague, discuss your case, and tell your family friends also, and manage for bail. Because many a time, if section 304 old and now newer version of the section 106, if punishment is more than 2 years, then bail cannot be granted at police station level, and one will have to go for bail in court. So you will be taken before court and you will have to ask for bail. You can go for anticipatory bail also if court is kind enough, and if you can convince, then anticipatory bail can also be granted. But if you have little apprehension about arrest, then these are the remedies. So always insist for post-mortem examination in cases of mishap or sudden death on table, rightly mentioned by Dr. Dilip Walke. If you are sure of cause of death, you can very well give death certificate. There are two types of certificate, death declaring certificate and death certificate. In death certificate, you have to mention cause of death. In death declaring certificate, patient so-and-so, aged so-and-so, residing at, expired at, on, that is death declaring certificate. But if you have to give cause of death, if you are not sure of cause of death, you can mention one line, that to know exact cause of death, post-mortem examination is advised. So you are safe in this type of cases. So we should be very careful in this type of cases. Never succumb to demand of relative for not going for post-mortem examination. Because many times relative will ask that we are not willing to go for post-mortem examination. Walke very well mentioned, you have to simply inform police, I am not sure of cause of death, and to know exact cause of death, I advise to go for post-mortem examination. Now onus on police to take that body for post-mortem examination or so, and handle the situation very tactfully. Many times we should not be harsh. No, there is no option and we have to go for post-mortem examination only. Because sentiment of relative also we have to take into consideration, but we have to save our skin also. As far as criminal liability is concerned, one more area is MTP Act 1971. So in this very situation, your center should be registered. If you practice MTP at unregistered center, you are criminally liable. Person should be qualified. you should have enough qualification to practice termination of pregnancy and valid consent. I mentioned in my first lecture also, consent is very much mandatory to be taken in Form C. It is prescribed form, and in that very Form C, we have to take consent. So I mentioned just prior, under Indian Penal Code 1860, voluntarily terminating pregnancy is crime. Even today, you cannot terminate pregnancy, but if you have terminated pregnancy under provision of MTP Act 1971, then you are out of purview of IPC or any other law, time being in force, because under section 2, this sentence is very much important. Notwithstanding anything contained in Indian Penal Code, a registered medical practitioner shall not be guilty of any offence under that code or any other law for time being in force if pregnancy is terminated by him in accordance with provision of this Act. So, if you have terminated pregnancy in accordance with provision of MTP Act, you are not held liable. So, here word of caution. Many of our family physicians have a habit to give medical kit for termination of pregnancy. If your center is not registered, if you are not qualified, it may be troublesome for you in future. So, be aware of this type of practice. As far as PCPNDT part is concerned, again it is also criminal law, and under this Act, every offence under this Act is cognizable. Investigating officer may take cognizance of offence without permission of court. It is non-bailable. Bail cannot be granted at police station level. You have to rush to honorable court for bail, and it is non-compoundable. Once case is filed, result has to come, either in favor or against. Case cannot be withdrawn in between. Appropriate authority has also no power. Once case is filed, appropriate authority can not also withdraw the case. So, we should be very careful. One more area, never detain patient for recovering the fees, because you may invite wrongful confinement under section 340 of IPC and newer version section 127 of BNS, because there is a provision of imprisonment for 1 year and or fine of rupees 1000. So, there are another ways to recovering the fees. You can go for civil suit. Of course, it may take long time, but you cannot detain patient to recovering the fees. You may invite criminal problem. Some other criminal liabilities under our practice, that is absconding, avoiding service of summons. If you are served with a notice, you cannot abscond yourself. You have to receive that very notice. Even if you have not received, then it will be considered as a served. So, you cannot abscond for this. It is very clear. One more area, giving false evidence. It is again criminal offence. So, when you are not sure of certificate which you are issuing to the patient, never give certificate, never issue certificate in post date. That is, patient should be before you. You should have examined that very patient, and for whichever disease you are giving a certificate, you should be very sure, because to issue false certificate may invite litigation in future, and it could be a fabrication of false evidence also. So, we should be very careful in this type of situation. One more area, using as a true certificate known to be false. If you know that this certificate which you are going to give is false, and even then considering it true, if you are issuing, then also you may invite litigation under section 198 of IPC, old version, and now newer version of this BNS. So, in this type of situation, we should be very careful. One more area, act likely to spread infection and adulteration of drug. Many times, few of our friends have a habit to buy one medicine and alter some other medicine and alteration. Never indulge in this type of practice, because it is adulteration of drug, and you may invite litigation under criminal law. And just I mentioned in prior lecture also, this gentleman have so many staircases, but he doesn't know how to use them. So, it doesn't matter how many resources you have, if you do not know how to use them, they will never be enough. And I mentioned in prior also, there are so many judgments in Supreme Court, in so many judgments in Honorable High Courts also, in favor of medical fraternity, in favor of you. But if you do not use those judgments in your favor, then they will not be useful. So have some basic legal knowledge and always obtain medical legal advice in your favor. Because only two things are infinite, universe and human stupidity, and I am not so sure about the former. So wish you and me too all the best. So again, I mention, if you want to sleep like this, take tender care of your patient, comply with the provisions of law, pray Almighty God before going to sleep, and keep my visiting card below your pillow. Because accessibility is not checkbox, it is a mindset. And I am committed to be accessible always to everyone. Let us hope nobody should end up into any kind of litigation. But if at all, we are always there to assist you. Thank you, all the best. God bless you. Have a litigation-free medical practice. With regards, salute to all. Thank you very much. Please do not assume. Please ask if any query, if any question, or we can take question during panel also.
Thanks a lot, sir. We can invite 2 or 3 questions. Any questions regarding to this session?
Or we can discuss during panel also.
Okay.
To save time.
ઓકે બધાને વિનંતી છે કે આપણે રજિસ્ટ્રેશન ડેસ્ક પાસે રજિસ્ટ્રેશન અને સર્ટિફિકેટ્સ મૂકેલા છે એન્ડ દેર ઇઝ વન મોમેન્ટો ફ્રોમ શિવાલિકા ગ્રુપ ઓલ્સો ઇન દેટ બેગ સો પ્લીઝ કલેક્ટ દેટ ડોન્ટ ફર્ગેટ ટુ રજિસ્ટર યોર સેલ્ફ કલેક્ટ યોર ડેલિગેટ કિટ એન્ડ સર્ટિફિકેટ એન્ડ કલેક્ટ દેટ મોમેન્ટો ફ્રોમ શિવાલિકા ગ્રુપ being our proud sponsor for today's Medicolegal Conclave, setting new standards in premium lifestyle and heritage architecture in Kutch, Shivalika Group is actively shaping the region's landscape. From entering an agreement via Primitive Property LLP to bring Hayat to Bhuj, to crafting luxury heritage villas featuring exclusive clubhouse comforts and redefined living, their commitment to excellence plays a vital role in making this landmark event a success. So we have an audiovisual presentation by Shivalika Group for 2 minutes only. So let's have a look at the AV. I am also very much thankful to the AU Small Finance Bank. I would like to request the representative of AU Small Finance Bank to please come on the stage. We will like to felicitate you. I would like to request Dr. Sanjay Upadhyay sir to please come on the stage and do felicitation of representative of AU Small Finance Bank. They are being the associate sponsor of Medicolegal Conclave 2026 organized by Indian Medical Association, Bhuj, Dental Club Bhuj and NMO Bhuj. Representatives from the AU Small Finance Bank are requested to please come on the stage. We are very much thankful for being part of this event. They are being the associate sponsor of our Medicolegal Conclave 2026 powered by Shivalika Group. You can get more information regarding banking and their services from their counter at the entering of this hall. You can visit them at the stall. Thanks a lot, AU Small Finance Bank.
So my second talk, ladies and gentlemen, is on this topic of a legal notice served to you, what is it that you are supposed to do after a legal notice is served. And I'm sure when I start the presentation, those who are having tea there will come in the front because this is all about the legal aspects of how to conduct yourself when it comes to a legal notice being served to you. So basically, a legal notice can be given by a patient. वो यहाँ नहीं दिख रहा है. Okay. So basically, a notice can come to you, which can be sent to you by the patient or his lawyer or a consumer activist or even an association, or the notice can come from a court, which can be a civil court, a criminal court, a consumer court, or a notice can come from the medical council, or a notice can come from the Human Rights Commission also. And there are a number of allegations that a notice can tell you about, like a wrong diagnosis, complication, death, no consent, delays, staff infrastructure problem, unnecessary investigation, overcharging. So they can complain about anything in the notice, but such notices can come to you, and we must know how to deal with that. So first of all, instead of going straight to a legal notice that comes from the court, we will talk about a letter that comes from your patient or the lawyer representing the patient or a consumer activist. This notice is not a proper legal notice, but it is just a precursor. It is a letter that has come from that, and we will consider that as a legal notice only and try to discuss what to do. Now, many experts will tell you, ignore karo, ye to kya court ka notice nahi hai. But I always, and even MC Patel will always tell you that though it is not legally mandatory to answer this notice, this letter that has come from the patient, you should always answer it and not ignore it, because if you answer it, it can later on prove in the court of law that you were careful enough to answer such a notice. Otherwise, it will be seen as if you were so lackluster that you were not bothered about any complaint that came from the patient. So basically, first thing is, do not ignore. The second thing is, the moment you get this kind of a notice means abhi aapke upar kuch na kuch legal problem hone wala hai. So search the OPD paper, search the indoor paper, search whatever investigations were done, all the receipts, the reference details, who referred the patient to you, search the certificates of yours, the WhatsApp messages that you may have shared with your patient, and the envelope of the letter. Why the envelope of the letter? Because uske upar ek stamp rahega which will prove that letter was sent on this date. Because later on in the court, डेट के ऊपर फाइट होती है कि मैंने इस तारीख को इनको लेटर भेजा था और इन्होंने मुझे इतने तारीख तक कुछ आंसर नहीं किया. So preserve all that, because that you may need in the court of law later. Spend some time. जैसे ये लेटर आता है, same time, ये पेशेंट मेरे किसी नॉन फ्रेंड ने भेजा था क्या? Which was the general practitioner who sent the patient to me? Was this patient referred to me from some old patient? What was the patient's behavior? What was the socio-economic status of the patient? ये कौन से political party के था? Though this our NMO may be affiliated to one party, लेकिन as a doctor मैं बता रहा हूँ, दोस्ती सबसे कर लो. एक ही पार्टी से दोस्ती करने से कोई मतलब नहीं, because we need to know everybody. So first of all, try to find out कौन से पार्टी से था. पुलिस के बारे में अंडरवर्ल्ड कनेक्शन है क्या इस पेशेंट का. सो ये पूरा स्टडी करना अपने को बहुत ज़रूरी है. द मोमेंट यू गेट ऑल दिस लेटर फ्रॉम योर रिलेटिव, फ्रॉम द पेशेंट और द रिलेटिव, इमीडिएटली इन्फॉर्म द इंश्योरेंस कंपनी. अभी आपके ऊपर कोई लीगल ये नहीं है, बट इन्फॉर्म करो कि मुझे ऐसा लेटर आया है, सो दैट लेटर ऑन द इंश्योरेंस कंपनी शुड नेवर क्लेम कि मुझे इन्फॉर्मेशन ही नहीं थी. एंड ऑलवेज इंश्योरेंस कंपनी को ईमेल के ऊपर ये इन्फॉर्मेशन दे दो, बिकॉज नो बडी कैन एवर डिनाई दैट आई डिड नॉट गेट एन ईमेल एंड आई डिड नॉट गेट द लेटर. लेटर के बारे में ऐसा है कि वो डिनाई कर सकते हैं. सो ईमेल के ऊपर हमारा जो गया है, that will prove in the court of law that you had informed the insurance company in time, whether they give you a claim number or they do not give you, but at least it will prove in the court that you were informed in time. Then reply to the letter. Though it is not legally mandatory, it is always better to reply to the letter, reply in a reasonable time. There is no such thing as reply within 1 month, reply within 2 months, but reasonable time. It should not be that letter aa jaye aur 6 mahine ke baad aap reply kar rahe. No, reply at a reasonable time. And I always say that you have a habit कि ये letter है ना, मैं reply कर सकता हूँ, I will reply. No. Take a help of a lawyer or take a help of a medico-legal experts if you are in Gujarat, somebody like Dr. MC Patel to reply. Because हम लोग जब reply करते हैं ना, अपने वो reply में बहुत emotion रहता है. हम लोग बोलते हैं I am sorry that you went through this complication. ये sorry वाली word है ना, उससे उनको लगता है अरे डॉक्टर sorry बोला है ने डॉक्टर negligent था. So never put that. Ask a lawyer to reply. No acceptance of any guilt. डिनाई ऑल एलिगेशन. जितने उन्होंने एलिगेशन किए उनको डिनाई करने का, बट डू नॉट ओपन ऑल योर कार्ड्स. एज डॉक्टर्स हम लोग को मालूम रहता है अरे मैंने तो नेग्लिजेंस नहीं किया, मेरे पास ये रेफरेंस है, मेरे पास वो रेफरेंस है, मेरे पास ये केस लॉ है. वी टेंड टू पुट ऑल दैट इन द लेटर. नो, this is not the time to disclose all your defenses. Your defenses have to be disclosed when you get a proper court notice. इनको क्योंकि अदरवाइज आप क्या कर रहे हैं, उनके लॉयर को एजुकेट कर रहे हैं by telling all your defense. Now उनका जो devil's lawyer है, he'll be prepared with answering to all your queries. So never disclose everything there. Just completely every point को deny करो, and hopefully by this the complainant will be dissuaded from putting a case against you in the court. There is a difference of opinion. Some people say पूरा अच्छी तरह से reply कर दो, but I maintain that complete अपना डिफेंस वहाँ ओपन मत करो. Now the notice can come from the consumer commission, and when a notice comes from a consumer commission, then you have about 30 to 45 days to respond. And here 30 to 45 days is statutory. You have to respond within these many days because the complaint has come from an authority which is the consumer quorum. Now the jurisdiction, first of all try to find out whether the jurisdiction is correct. So number one, as per the cost of the treatment. पहले ज़माने में क्या था? As per the cost of as per the amount demanded. Now as per the cost of the treatment. 50 lakhs cost of the treatment, it goes in the district forum. So which means 100% of our cases will be coming from district forum. आपका कोई किसी का treatment 50 के ऊपर गया है कभी? 50 का, मेरा तो अभी 5 के ऊपर भी नहीं गया है. So all our cases will be under in the district forum as per the territory of the commission. Now this was relevant before. Abhi relevant hai kya? For example, I operated a patient in Pune. Can the patient put a case against me in Bhuj district forum? Can he or can he not? She can. But there was a time when it was not allowed. It was only allowed at the time, at the place where the cause of action arose. And ये जो बोला ना डॉक्टर MC पटेल ने बोला ना, when we were formulating the uniform foxy consent, मेरा और उसका झगड़ा हुआ था, तो मेरा और उसका झगड़ा इसी पॉइंट पे हुआ था. I had told MC Patel and the team कि हम लोग consent पे ये लिख के लेंगे ना, for the jurisdiction. Supposing I am operating the patient in Pune, why not write in the consent for the Pune jurisdiction only? क्यों नहीं लिखने का? After all, consent is a commercial agreement between me and the patient, no? Why not write that? माना नहीं. MC Patel said no, and the others said no, so we deleted that from the consent. But I feel I have started doing it in my practice. मैं लिखता हूँ, it is only for Maharashtra jurisdiction. Who knows, this case may go in the court of law, and who knows, the judge might accept my writing there that for only for Maharashtra jurisdiction. अगर वो accept हो गया, तो it will be a case law which will be applicable for. See, basically this that they can put a case against us in any forum is for these multinational companies जिनका ऑफिस बम्बे में रहता है और जिनके रीजनल ऑफिस ऑल ओवर द कंट्री रहते हैं. फॉर अ डॉक्टर हु इज प्रैक्टिसिंग इन अ सिटी लाइक भुज, उनके ऑफिस कहाँ है बम्बई में? अगर आपको बम्बई का पेशेंट आया, यू ऑपरेटेड एंड ही पुट्स अ केस अगेंस्ट यू इन बॉम्बे, यू विल हैव टू गो एंड फाइट द केस इन बॉम्बे. बट नाउ द प्रॉब्लम इज स्टिल देयर एंड वी विल हैव टू फाइट इट, स्पेशली फॉर डॉक्टर्स. दिस पर्टिकुलर क्लॉज शुड नॉट बी देयर. Then try to choose a good lawyer. So when you're choosing a good lawyer, should you go for a celebrity lawyer? Never go for celebrity. इनको एक तो उनको टाइम नहीं रहता, दूसरा उनको मेडिको लीगल का नॉलेज नहीं रहता. बेसिकली लॉयर में भी गुड इन his own knowledge when it comes to legal matters, sir, but when it comes to a body, when it comes to a physiology, when it comes to anatomy, the knowledge may not be very good. So go for somebody who's got knowledge in medico-legal aspects and should be, the lawyer should not have this, कि नहीं नहीं मेरे को सब मालूम है मैं कर लूँगा. He should be ready to take inputs from medico-legal experts like MC Patel and others that are there. Only when he gets the input will he be able to put in a good defense. So don't go for a lawyer who is a celebrity. Go for a lawyer who is accepting to all your suggestions that you are giving to him. Search for references. Now, why I am insisting on search for references is this is search for the references which will be in your favor as if this is the last day of your life. और ये आपका last chance है जिंदगी का. Why I am saying this? Because later on when the case goes in the court of law, the judges may not allow you to put in different new references. The judges will say आपने जितना दिया है उतना ही, you cannot make any fresh submission. So that's the reason why जितने भी references आपको मिल सकते हैं about defending the case, search for all those references, confirm that the textbook and the reference journal are helpful. For example, I'll give you, I was defending a case for a friend of mine from Assam, wherein they, while doing cesarean section, there was a cut on the baby's face. The references that he had submitted said, there was a textbook which said that if proper care is not taken while opening the uterus, there can be injury to the baby's part. Now the judge said, iska matlab aapne proper care liya nahi. So when you are actually giving the references, see that the wording in the reference should be helpful in your defense rather than going against your defense. So then we search for other references which we got, and then it was not about whether if you took a care, you're not careful in opening, wo wala nahi tha. Then I gave him a reference of cesarean done for oligohydramnios, in which that it was mentioned that if you're doing cesarean where there is not much of liquor, there is a possibility of injury to the baby. Now he could defend the case better in the court that he went, the case went in appeal, and it was helpful for him. So be very careful about the references you are actually producing in the court of law. Now this is very important. Educate the lawyer. लॉयर को मेडिकल चीज़ों के बारे में एजुकेट करना ज़रूरी है. पैरावाइज आंसर, व्हाट यू डू इज़ कोर्ट नोटिस जो आया है उसका पैरावाइज आंसर आप अपनी भाषा में दे दो. लॉयर विल देन कन्वर्ट इट इन द लीगल लैंग्वेज, लेकिन अपनी भाषा में उसका आंसर दे दो. डॉक्यूमेंट्स प्रोवाइड करो, ओपीडी पेपर, डिस्चार्ज कार्ड, इन्वेस्टिगेशन रिसीट्स, एवरीथिंग. एक्सप्लेन द मेडिकल टर्म्स एंड शॉर्ट फॉर्म. अपने को है ना डामा, हम लोग क्या क्या शॉर्ट फॉर्म यूज़ करते हैं, और जैसे जेनजी आते हैं, जेन अल्फा आते हैं, और भी शॉर्ट फॉर्म आते हैं. सो दिस शॉर्ट फॉर्म इज़ डिफ़िकल्ट फॉर अ डॉक्टर टू अंडरस्टैंड. लॉयर का क्या हालत हो जाएगा. सो दैट्स वाई यू गिव, एक्सप्लेन ऑल द मेडिकल टर्म्स, एक्सप्लेन ऑल द शॉर्ट फॉर्म, डिकोड आवर बैड हैंड राइटिंग. जो अपन लिखते हैं ना, अपना हैंड राइटिंग, डॉक्टर का हैंड राइटिंग कैसा रहता है, एवरीबडी नो, देयर आर मैनी जोक्स ऑन दैट, बट देन डिकोड दैट एंड गिव इट टू द लॉयर. Whatever acts you know, whichever case laws you know, whichever textbook references you know, whatever journal references you know, give it to the lawyer. Also give him all the inputs about your qualification, about your training experience, about the fact that you attended a medico-legal conference, uska certificate bhi usko de do. About your hospital, about the infrastructure in your hospital, about the different faculties that come to your hospital to prove that you have a multi-speciality approach. Tell him about the backup support that your hospital has. Tell him about all the awards and social standing. अभी मुझे, मैं और MC पटेल ने हमारा फ़ोटो ले लिया as a faculty. क्यों लिया है? I can prove it in the court of law that मुझे तो लोग बुलाते हैं लेक्चर देने के लिए. तो लोग अगर मेरे को लेक्चर देने के लिए बुलाते तो मैं कितना नॉलेजेबल होऊंगा. Right? So that all that proves in the court of law that you are indeed knowledgeable. So ये सारी चीज़ें आप रखो, फ़ोटो ले लो, और वो फ़ोटो सिर्फ सोशल मीडिया के लिए नहीं रहता. ये फ़ोटो not just for Facebook. This photograph can help you in your court of law also. And all that communication with the lawyer, can you do it orally? Can you do it with just a letter? देखो वो लॉयर हमसे भी स्मार्ट रहते हैं. कल उठ के वो बोलेंगे तो ये मेरे को तूने बताया ही नहीं. अगर वो ऐसा बोलने लगे तो वी शुड बी स्मार्ट इनफ टू सेंड एवरीथिंग दैट आई एम टेलिंग यू ऑन एन ईमेल. ईमेल को वो लॉयर डिनाई नहीं कर सकते. सो एवरीथिंग दैट यू आर सेंडिंग शुड बी सेंड ऑन एन ईमेल. Then the next point is show urgency to the lawyer, because for the lawyer it is just a matter. लॉयर लोग बोलते हैं ना मेरा एक मैटर है, एक डॉक्टर का मैटर है मेरा, उनके लिए सिर्फ एक मैटर है, और हमारे लिए it's a matter of my credibility and my existence. So for them it is just one of the case. For us it is a matter of existence and credibility. So show some urgency to the lawyer. Raise all your arguments if first written statement itself. So lawyer को आपको जितना भी argument देना है तो it has to be raised in the first written statement itself, because the court may not allow any rejoinder. So if there is may allow a complainant to submit a rejoinder, and if the complainant ने rejoinder दिया तो फिर आपको fresh submission देने के लिए allow रहता है. So always जितना भी information you can give it to the lawyer. Give it not in a meeting. Whatever meeting आपका हो जाने के बाद में उनको बोलने का सर जो भी हम लोगों ने डिस्कस किया ना मैं उनका ईमेल आपको भेजती हूँ. So that will be there as a document to prove later on that I had given you all the information. Collect affidavits from the experts. Now I always say experts are plenty, but affidavits are scarce. The reason is why the affidavits are scarce is because सीनियर्स लाइक मी विल से वो झंझट में कौन पड़ेगा, अगर मैंने आज एफिडेविट दिया और मुझे कोर्ट में बुलाया तो इस उम्र में मैं किधर कोर्ट में जाने वाला हूँ. नो, द कोर्ट्स यूजुअली द कंज्यूमर कोर्ट, the expert who has given an affidavit, the consumer court will not call that person in the court of law. They will just give you a questionnaire and questions के answer आप लिख के देंगे तो भी चलेगा in the court of law. So it is a duty of all the seniors sitting here. If a junior is in trouble and he comes to you to ask for an affidavit, especially those who are medical college teachers, they should give the affidavits to help the doctor in the court of law. Sample of some defenses. These are some of them are technical defenses. Totally free service. So free service रहेगा तो it cannot go in the consumer forum. But if your hospital is such that only 80% of patients are giving free, but there is a special room जहाँ पे charge होता है, then this hospital will come under consumer forum. Or civil suit pending. If there is, see, a patient can put a case against me in the criminal court plus the consumer court plus the human right commission, plus he can put a case against me in all the different forum. But हर जगह पे वो अलग अलग चीज़ पूछ रहा है. एक जगह पे वो कॉम्पेंसेशन मांग रहा है, एक जगह पे वो अरेस्ट मांग रहा है, एक जगह पे वो बोल रहा है कि मेरे whatever are my licenses to practice, they should be either suspended or cancelled. But if he puts a case against me in the consumer forum, in the civil suit, in the civil court, he is asking for compensation. Now he cannot put a case in the consumer forum because in both the forum he is asking for compensation. So अगर उसने criminal किया है तो वो civil कर सकता है, criminal किया है तो consumer कर सकता है, लेकिन consumer and civil together he cannot put. So if he has put a case in the civil court, then you can always say कि already वो compensation वहाँ मांग रहा है, दो जगह से compensation मिल नहीं सकता. Wrong jurisdiction, time barred. More than 2 years have passed. So what is the meaning of this time barred case? Supposing मैंने आज की तारीख में, आज तारीख क्या है, 23 अगस्त को मैंने 2026 में मैंने एक सर्जरी की और वो सर्जरी के बाद में उसको PPH हुआ और वो पेशेंट, या फिर एक मैंने मॉब छोड़ा था अंदर और 3 महीने के बाद में उसे पता चला कि वो अंदर मॉब था. So what is the time gap in between which the patient has to make a complaint against me? Is it 23rd of August 2028? 23rd August 2028 के पहले करना चाहिए क्या उसने? Exactly. So from the time that she came to know that the surgery caused this, so कभी उसको पता कब चला? 3 महीने के बाद. So it is 2 years from the time that the patient came to know that the complication occurred because of this surgery. So this is one thing that you have to remember, that 2 years may be the limitation period, but that limitation period may not be 2 years from a particular treatment, 2 years from the cause of action, and sometimes even the courts condone this limitation period also. Lack of experts witness, death of the respondent. अगर मेरे ऊपर केस हो गया और जजमेंट आने के पहले ही मैं गया तो कंपनसेशन देना पड़ेगा क्या? I died before the judgment came, so should I be giving the compensation? No. But मेरे ऊपर केस हो गई और मुझे compensation award हो गया, 10 लाख का कॉम्पेंसेशन अवार्ड हो गया और ये सुन के मैं मर गया, तो कॉम्पेंसेशन किसको देना पड़ेगा? मेरी बेटी को देना पड़ेगा. So the legal heir has to give. But now a new judgment has come in which now even after the death, इसके बाद में भी compensation दिया तो भी legal heir को देना पड़ता है, because this the argument is that if it is a civil matter, then civil matter the legal heir will have to give the compensation. So the new case has come, and I am aware of that case, that now the compensation, whether you die before the judgment or you die after the judgment, the legal heir will have to give the compensation. So the moral of the story after having seen this case is, अपने मरने के बाद भी अपना indemnity चालू रखने को बोलो अपने बच्चों को, right? So that at least that will be covered through the indemnity. Huh? Correct, right. So so our, हम लोग डॉक्टर बन गए ना, हम लोग अपने आप को तो डेंजर में डाल ही रहे, अपने बच्चों को भी डेंजर में डाल रहे हैं एक्चुअली. So that you have to understand. और with pride we tell us, say ना कि मेरा बच्चा तो क्या वो डॉक्टर होने वाला नहीं है. My daughter is a filmmaker, so she is not interested in being a doctor. But then I told her, though you are a filmmaker, but your father and mother are doctors, so ये तुझे भुगतना पड़ेगा. जो गलती मैंने की है तेरे को उसको भुगतना पड़ेगा, right? Factual defenses can be complicated case, so it has to be fought in the civil court and not in a consumer court. Complaint not with clean hands, frivolous complaint, suppression of facts. ये आपको आपके smart lawyer will put all that. उसने ये मुझे बताया ही नहीं कि इसको वोवेरान की एलर्जी है. All these things ना अगर आपको पता चले तो वो डालते रहो अपने आपके डिफेंस में, that he did not tell me, she did not tell me that, या contributory negligence. I told the patient कि आपकी सर्जरी हो गई, अभी आपको रिच फूड नहीं खाना है, आपको ये वाली चीज़ें, बहुत शुगर वाली चीज़ें या घी वाली चीज़ें खानी नहीं है अगले 15 दिन. पेशेंट ने खाई और उसको ये हो गया, बर्स्ट एब्डोमेन हो गया, तो राइट इट डाउन ऑन द पेपर. आई हैड टोल्ड द पेशेंट नॉट टू ईट रिच फूड, डिस्पाइट दैट द पेशेंट एट रिच फूड. सो उसके बर्स्ट एब्डोमेन का कारण मैं हो सकता हूँ, लेकिन मेरे साथ में वो भी है. So this is what you prove in the court of law about, this is the, in legal parlance we call this contributory negligence. Life-saving situation, locality, time of treatment, error of judgment. Locality meaning you cannot judge a gynecologist sitting in a rural area like a Bid, which is a very rural area in Maharashtra. You cannot compare the treatment given in Bid with the treatment given in Fortis Hospital, Bombay, the Bombay Hospital. या रूबी हॉल इन पुणे. You cannot compare that. So there is a problem of locality that you have to put in the written statement that you have given. An error of judgment. See, error of judgment और negligence का lining बहुत thin है. But that is a topic in itself, and we can discuss about error of judgment versus negligence for hours together. The lawyers are here. We can take that question during the panel discussion, because मेरे लिए वो बहुत difficult है. So आप लोग उसके बारे में बात कर सकते हैं. Then understand the proceedings of the Consumer Commission. It is a fast track court where documents speak, and that is the reason why all medico-legal experts will come here and tell you document, right? Document everything that you are telling, communicating with it. So communication of documents and documentation of communication. Examine and cross-examination on affidavits and questionnaires. हमें क्या लगता है कि वो हिंदी फिल्म में दिखा दे ना, मिलॉर्ड, वो जज, वो लॉयर खड़ा रहता है और वो एक कटघरा रहता है, ऐसा कुछ नहीं होता. कंज्यूमर को, एनीबडी हैज़ विजिटेड अ कंज्यूमर डिस्ट्रिक्ट कंज्यूमर फोरम? ही हैज़. कैसा है वो? अपना बाथरूम भी अच्छा रहता है ना, अपने घर का बाथरूम भी क्लीन एंड टाइडी रहता है. वो कंज्यूमर कोर्ट इज अ मेस. आई वेंट टू नॉट अ डिस्ट्रिक्ट फोरम, बट आई वेंट टू द महाराष्ट्र स्टेट कंज्यूमर फोरम, जहाँ पे जज बैठता है, उसके बाजू में बाथरूम है, उसका स्टिंक आता है inside the courtroom. So you can imagine the kind of things जो फिल्मों में दिखाते हैं, वैसा कोर्ट आज तक मैंने देखा नहीं. ओनली हाई कोर्ट में होता होगा, पता नहीं सर. हाई कोर्ट में भी गुड, बट आई डोंट थिंक फिल्मों में दिखाया हुआ कोर्ट कभी जिंदगी में है. क्या भुज में है ऐसा कोर्ट? अभी है. गुड. In some places it is there, but generally I have not seen one good district forum in Maharashtra. Judgment copy you will get by courier or by application free of cost. If it is in favor, will you celebrate? डिस्ट्रिक्ट फोरम में से एक जजमेंट आया आपके फेवर में, आप सेलिब्रेट करेंगे क्या? नेवर सेलिब्रेट, बिकॉज हो सकता है वो आपके अगेंस्ट अपील में जाएगा. तो कंप्लेनेंट कैन गो इन अपील. सो अगर आपके फेवर में है तो आपको सेलिब्रेट नहीं करना है. अगर आपके अगेंस्ट में है देन यू हैव टू पे 50% ऑफ द कॉम्पेंसेशन दैट हैज बीन अवॉर्डेड एंड देन यू कैन गो इन द अपील. But in appeal also, now things have changed after the new amended Consumer Protection Act. The appeal can go from district forum to the state forum, from state forum to the national commission, from the national commission to the Supreme Court. But now they are usually allowing only facts of law. There is a difference between facts of law and facts of case. You cannot say that जो केस की जितनी जो फैक्ट्स है दैट विल बी दे विल प्रिज्यूम दैट हैव बीन जज इन द डिस्ट्रिक्ट फोरम इटसेल्फ. अगर आपको लगता है कि आपके जजमेंट में लॉ को रॉन्गली इंटरप्रेट किया गया है देन यू कैन गो इन द अपील. सो थिंग्स आर चेंजिंग एंड अ लॉट ऑफ ओनस हैज बीन पुट on the district commission now, and you have to be very careful while fighting your case in the district forum itself, because आगे सिर्फ facts of law पे ऊपर जाएगा, which if you have that fact of law in your hand then it may be an easy appeal, but otherwise it becomes a very difficult appeal to go in the court. Then when there is an allegation, if the lawyers and your fraternity who are practicing law, because there are some medical legal experts who charge you for the services that they give you. So fortunately वो सोया है, इसके लिए मैं ये बोल सकता हूँ. So they charge you for the services that they give you. So these friends will tell you, keep fighting a court case and never settle down. This is what they tell you, ना? The lawyers will tell, क्योंकि ये उनका धंधा है, तो वो बोलेंगे ना आपको fight करो. But what I tell you is, don't be fooled by them. You can look for a chance to settle the case always, because ये जो बोलना है ना लॉयर, आप केस डालो, हम केस करेंगे, हम जीतेंगे, तू ये मत कर, सेटल मत कर, ये सब उनके बिजनेस के लिए. अपना काम क्या है कि उसमें से सही सलामत छूट जाने का. सो समटाइम्स इट इज़ बेटर टू सेटल द केस आउटसाइड द कोर्ट. एंड हाउ डू यू सेटल दैट? Why is it that you should settle cases outside? Because court matters are time consuming, court matters are frustrating, and court matters are costly. Lawyers sometimes charge heavily. Sorry sir, आपके सामने बता रहा हूँ. like doctors. चलो मैंने यहाँ से वहाँ मारा, उन्होंने वहाँ से यहाँ मारा. Fine. So but they are costly, and the court matters are very time consuming and frustrating. And let me tell you, 9 out of 10 cases are actually settled outside, because non-criminal and compoundable cases are actually settled outside. ये जो यहाँ पे दिखाए जाते हैं ना cases, वो 1 out of 9 है. उसके वो जो बाकी के 9 cases है ना, वो हम लोग जुगाड़ से मैनेज करते हैं, और जुगाड़ के लिए हम लोग की कभी कभी लोग मदद करते हैं. लेकिन बिकॉज इट इज़ वेरी नाइस टू से कि अरे यार ये पेशेंट को तू पीएम के लिए भेज दे. और मैंने आपको क्या बोला, इफ़ यू नो द कॉज ऑफ डेथ देन यू गिव द कॉज ऑफ डेथ ऑन अ टेबल डेथ केस. मैनी अ टाइम्स आई विल टेल यू ऑफ द डायस दैट मैं बोलता हूँ दे, क्योंकि नहीं दिया ना तो मॉब वायलेंस होता है बहुत बार. इफ़ यू, बिकॉज इन इंडिया इट इज़ पोस्टमार्टम करना अपने पेशेंट के बॉडी के ऊपर, देयर आर मेनी इमोशनल थिंग्स अटैच. तो मैं क्या बोलता हूँ, कॉज ऑफ डेथ दे, लेकिन all your notes should be such that you should be able to defend the cause of death in the court of law. So there are some jugards that we have to do. We have to settle cases outside and see to it that the cases don't go in the court of law. Amended CPA encourages mediation for non-grievous hurt cases. So mediation there is a provision for mediation now in the so how to settle? मैंने बोला कि settle करो, लेकिन settle कैसा करने का? The wrong way is to give extortion cash upfront under coercion of mob, musclemen and politicians. वो लोग immediately death होने के बाद चलो सर 10 लाख दे दो, केस रफा दफा. Don't give such, don't fall prey to such extortions. Is there any other way? There are legal ways of doing it. The legal ways of doing it, ADR, mediator help to create settlement terms which are filed in the court for a decree. I know ये मैंने लिखा है, लेकिन I don't know of any case that has happened this way, wherein both of them, we will have an opinion from you. Sir, ऐसा मैं कर सकता हूँ क्या? Let's have, I'll give the mic to him, मैं question पूछता हूँ. ऐसा मैं कर सकता हूँ क्या कि मैं और पेशेंट, हम लोग दोनों ने उसको कॉम्प्लिकेशन हुआ है, वो कॉम्पेंसेशन मांग रहा है, हम लोग दोनों बैठ के डिसाइड करते हैं कि दिस इज़ द कॉम्पेंसेशन आई एम रेडी टू गिव टू हिम. नाउ मैंने सिर्फ इतना ही किया और उसको रजिस्टर किया तो उसको कोई वैल्यू नहीं। मैंने बोला लेट्स गो टू अ कोर्ट एंड गेट अ कोर्ट डिक्री ऑन इट कि इन दोनों ने ये मीडिएशन किया है एंड कॉम्पेंसेट। तो इज इट पॉसिबल टू डू दैट? Everybody should know that. That's why I am giving the.
In every district, there is a mediation center so far as the civil court are concerned. Now in CP Act, Consumer Protection Act 2019, there is a proviso in the Act that the court should be established the mediation center after filing of the complaint. That complaint should be go to the mediation center first. If settlement is not occurred, then it go to the trial. This is the basic principle.
Fantastic. So now we should take help of the new amended CPA, and every case you try to settle it there in the mediation cell itself, because वो trial में जाने के बाद में it's a very long procedure later on. So better to settle it down, get a decree, or if there is a lok adalat which is likely to be sitting in your locality, then you go to the lok adalat and get a decree or that. And during the pendency of the case, sir, again, supposing मेरा केस हो गया है, कंज्यूमर कोर्ट में केस चल रहा है, और बीच में हम लोग दोनों ने डिसाइड किया चलो 10 लाख में सेटल करते, कैन आई टेल द जज कि सर आप झंझट मत करो ये केस के पीछे लगने का, हम लोग दोनों ने सेटल करने का डिसाइड किया है, मुझे डिक्री दे दो?
But it is not worthy, because if you are doing out of the court without decree or without settlement process filing before the court, the question is just like an हम कहते हैं वो लटका हुआ है।
नहीं, मैं जज को क्या बोल रहा हूँ, जज को अदरवाइज वो केस पढ़ना पड़ेगा, उसके पीछे जाना पड़ेगा। जज को बोल रहा हूँ कि मैं ये जो केस है हम लोग दोनों ने डिसाइड किया है सेटल करने का, 10 लाख में सेटल कर रहे हैं फॉर एग्जांपल, तो आप उसके ऊपर एक स्टैंप लगा दो ना कि दिस केस हैज बीन सेटल्ड।
You have to file this settlement in writing before the court.
Okay.
On that they will pass the decree or order. Decree is passed in the civil court and order passed in the consumer court.
So fantastic. So now we know that there is a possibility of actually settling the case without going into all the nitty-gritties of the court, whether the case is pending or whether the case is not yet filed, but you can do it through the mediation cell and even while the case is pending. Right. So this is a very important input that I have got today, because everybody should know this, because when the case goes in the court of law, it's not a very easy thing for the doctors to manage. So some message to conclude is, treat your practice like a business between service provider and consumer. Let your medical legal issues be handled by appropriate team. Just like, see, आप अपने पैसे का इशू हम लोग किसको देते हैं, CA को देते हैं ना, तो वैसे अपना मेडिको लीगल प्रॉब्लम लॉयर्स को दे दो बिंदास। So let's not bother about all the medico-legal issues. The moment there is a medico-legal issue, hand it over to the lawyer and let the lawyer manage it. Look for option in your branch which gives you academic satisfaction, financial reward, and is less litigation proof. So आप अपने सारे practices में try to find out that branch in the practice, that vertical in the practice जिसमें litigation कम हो, जिसमें finance ज़्यादा हो, और जिसमें satisfaction भी हो. So if you are a gynecologist and if you are interested in cosmetic gynecology or if you are interested in ART practice, मेरा नंबर लिख लो, मेरे से बात करो, I can help you. Like I have helped Deven Jogal to start up his IVF practice here in Bhuj. I can help you all also to establish your IVF practice, because that is a kind of a, IVF में ART Act है, and ART Act is in fact helping the doctor to do their practice. So practice is becoming more organized because of ART Act. It is not like PCPNDT. PCPNDT में radiologist को तकलीफ है, ART में gynecologist को फ़ायदा है. So you start doing that. It's a lot of money. क्या लगता है, ovum pickup and embryo transfer DNC से भी easy है वो चीज़. सिर्फ, और don't get carried away by all these people who come here and talk about gonadotropins. वो इतना डिफिकल्ट नहीं है, बहुत सिंपल है. डिलीवरी वजाइनल डिलीवरी करना डिफिकल्ट है सर, IVF बहुत सिंपल है. थैंक यू वेरी मच फॉर अ पेशेंट लिसन.
Thank you so much, sir. It was so guiding to us. Now we will move towards felicitation ceremony. I would like to request Dr. Vishal Joshi and Dr. Samir Shah to please come on the stage. I would like to request Dr. MC Patel sir to please come on the stage. Dr. Vishal Joshi and Dr. Samir Shah will felicitate Dr. MC Patel sir for coming all the way from Bangalore to Mumbai and Mumbai to Bhuj and delivering 2 nice lectures.
Big round of applause
તાળીઓના
for
ગડગડાટથી
sir.
વધાવીએ આપણે MC પટેલ સાહેબને. Next, I would like to request Dr. Nirmala Sharma, President BOGS, and past President SOGOK, Dr. Gopal Hirani, to please come and felicitate Dr. MC Patel, sir. As a fact of matter, 10મી ઓગસ્ટે સાહેબ નેશનલ પ્રેસિડેન્ટ ફોક્સીના છે. સો amongst us is the national faculty of Foxy. So we are delighted to have you, sir. તાળીઓના ગડગડાટથી વધાવીએ ડૉક્ટર MC પટેલ સાહેબને. Next, I would like to request Dr. Anand Hirani and Dr. Diviraj Jadeja. Please, તાળીઓ વગાડો.
Federation of Obstetric and Gynecological Society of India. There are 295 societies all over India, and 47,000 gynecologists are included in society. And he got the first time the 50% votes, so 8,140 votes. So very huge votes, and all good. I say to proud that Gujarat is 100% supported. And we showed our unity. So, MC Patel, now I also on this stage, on 2018, we want some good conference of Bhuj Society for BOGS. So, what we performed in the 2021, better than we do for the Foxy. Thank you.
Add to what Dr. Hirani sir told, he is our legend in white, our statue of unity of Gujarat for us.
Thanks a lot, sir.
MC Patel, I cannot stop myself by giving a comment. See, आज तक जितने भी फॉक्सी प्रेसिडेंट हो गए हैं, हम लोग को उस प्रेसिडेंट से बात करने को भी झिझक होती है ना. जो भी बड़े बड़े बम्बई वाले या पुणे वाले उनसे बात करें, वो उनका ऑरा ऐसा रखते हैं वो लोग कि हम लोग उनसे बात करने के भी झिझकते हैं. ही इज़ वन मैन who has reached to all the tier 2 and tier 3 and tier 4 cities of the country, and nobody, the youngest of the person who may have joined MD and the first year student will have no problem, no inhibition to talking to him. So I think Foxy में एक नया trend शुरू हो गया है, and from now on Foxy is going to be a little different because of person like MC Patel. Now we are going to reach out to each member of Foxy, and I am looking forward to you, sir, for doing the same. And when somebody said, "अरे Dr. MC Patel president बन गया," मैंने बोला MC Patel president नहीं बन गया, मैं बन गया. आप ही बोल रहे थे ना, सुबह चाय पी रहा था तभी उन्होंने बोला आपका फ्रेंड प्रेसिडेंट फॉक्सी बन गया. मैंने बोला आप मेरा फ्रेंड नहीं बन गया, मैं बन गया. So I have got that feeling, and I think everybody sitting here must have got that feeling. Right?
સાહેબની લોક ચાહના જેટલી છે કે એમને દર વખતે આટલું સરસ પ્રતિસાદ મળતો હોય છે. નેક્સ્ટ આઈ વુડ લાઈક ટુ રિક્વેસ્ટ ડૉક્ટર આનંદ હિરાણી એન્ડ ડૉક્ટર દિવ્યરાજ સિંહ જાડેજા ટુ પ્લીઝ કમ ઓન ધ સ્ટેજ એન્ડ ફેલિસિટેટ ડૉક્ટર દિલીપ વાલ્કે સર. સર પ્લીઝ કમ. Say sir, we learned a lot from you today. Next, I would like to request Dr. Kripal C. Jadeja and Dr. Panna Rudani Madam to please come on the stage and felicitate Mr. M.J. Christian sir, DYSP. M.J. Christian sir, please come on the stage. M.J. Christian sir has joined the police department as a police sub-inspector in 2001, promoted to police inspector in 2010, promoted to DYSP in 2018, and served in various agencies, departments, including police stations, crime branches, SOG, ATS, ACB, State Monitoring Cell, and State Traffic Branch. He is serving in Kutch district since last 3.5 years. So I would like to request sir to please. Next, I would like to request Dr. Narendra Hirani and Dr. Kashyap Bhuj to please come on the stage and felicitate Mr. H.R. Jethi sir. Dr. Narendra Hirani and Dr. Kashyap Bhuj sir, please come on the stage. H.R. Jethi sir is a PSI in local crime branch, West Kutch, Bhuj. He is basically BA LLB and giving service in ACB and CID, and now he is in LCB. Next, I would like to request come on the stage and felicitate Mr. Hemsi Chaudhary, sir. Dr. Jigar Patel and Dr. Himanshu Morabia, sir. Hemsi Chaudhary, sir, we all know him. He is advocate since he has done BLLB in 1991, elected as the youngest president of Bhuj Bar Association in 2002, recorded 5 terms as a president and the highest and longest serving president of Bhuj Bar Council. Next, I would like to request Dr. Monil Shah and Dr. Ghanshyam Parmar to please come on the stage and felicitate Mr. Rajesh Thakkar, sir. Dr. Ghanshyam Parmar and Dr. Monil Shah, sir. I think Monil sir is not present. So I would like to request Dr. Chandu Limani, sir, to please come on the stage and felicitate Mr. Rajesh Thakkar, sir. Rajesh Thakkar, sir, has done BSc with chemistry and LLB, practicing as a lawyer in Bhuj since 1983. He is expert in insurance subject, medico-legal and negligence cases pertaining to consumer jurisdiction against medical persons. We welcome you, sir. Next, I would like to request Dr. Deepak Suthar, sir, to please come on the stage. Along with that, I would like to request Dr. Mahesh Thakkar, sir, to please come on the stage and felicitate Dr. Samir Shah, sir. As we know, Samir Shah, sir, is a BDS, president of Dental Club and NMO Bhuj. Wait a moment. Next, I would like to request Dr. Hitesh Patel, sir, and Dr. Nisarg Desai, sir, to please come on the stage and felicitate Dr. Suresh Rudani, sir. Milind Joshi and Dr. Jigar Thakkar to please come on. Is now felicitating Dr. Vishal Desai, sir. Next, I would like to request Dr. Dhruti Shah and Dr. Urmila Madam and Dhruti Shah to please come on the stage and felicitate Dr. Nirmala Sharma Madam. Now the most interesting part of our today's conference is going to be sir as a moderator.
So our aim to this panel discussion, minimizing litigation with little vigilance and from clinic to courtroom. So warm welcome all the panelists. Usually I start off my panel with this. I never learn from someone who agreed with me, and if 2 people agree on everything, then one of them is not required. So let us see in this panel discussion how our panelists differ from each other, and let us see the cases. So my first question, is it worth discussing minimizing litigation with little vigilance? Is this type of discussion is needed nowadays in medical practice? My first question. Any panelist can take.
Yes, sir, definitely.
Definitely, then why?
Because, sir, this is the subject we don't study during our medical studies, but it is during our private practice. It is the most needed subject to know and do your practice in an authentic way.
Yes. And just I mentioned during my lecture also, medical litigations are increasing in number constantly and steadily, and that is why it is very much required. And just I mentioned that also, that ignorance of law can never be an excuse. Because as soon as any act, any law, any ordinance passes in government gazette, it is presumed by law that each and every citizen of India knows that law, and that is why we have to learn. Yes, Nirma?
What happens when you read the law, you won't understand. But what happens when we
Yes.
decide in your brain, okay, this thing has to be done, rather than just going through papers.
Let us discuss one situation. 16 years old girl brought by her mother with complaint of vulvovaginitis and discharge per vagina. Patient is brought to family physician. On examination, it is found to be a case of sexually transmitted diseases. And on further interrogation, our family physician friend asked, and she revealed history of sexual exposure with her boyfriend. How will you manage? How will you manage this case? I do not want medical part. Medical part you will manage. How to give treatment as far as vulvovaginitis is concerned, discharge per vagina is concerned, and this STD part is concerned. But she is 16 years and she has revealed history of exposure with her boyfriend. How will you manage this case? Any doctor can take. So this is in our routine practice. This type of cases happen, and many times we fail to do something which is very much mandatory by legal provisions, and that is why we have put this case for discussion. Mike, chalu.
Hello.
Hello.
Yes, chalu.
Whenever such patient has come, she's 16 years old, first age, 16 years, brought by whom, the date, everything, the clinical symptoms, signs, everything has to be noted down and jotted down, and whatever your findings has to be jotted down on the paper, and treatment has to be given. That is right. Everything has to be mentioned on it, and but since
proper documentation.
Proper documentation,
Fine,
history,
fine. Then
it was that she has got a boyfriend, consensual sexual relations has to be maintained. But since she is 16 years, you should maintain the confidentiality of the patient, but you need to inform the special police unit, I think
yes.
so.
So it becomes a case of POXO, and you have to treat patient, because when patient is brought to you for treatment, you are under obligation to treat. But at the same time, you will have to inform police or CWC, that is Child Welfare Committee. Because under section 19 of POXO Act, any citizen of India, here in that section 19 it is very nicely mentioned, being a responsible citizen of India, when you come to know that it becomes a case of sexual assault, you are under obligation to inform police or CWC. So you have to inform police. Of course, you have to treat that very patient. How to treat, that is up to you. You are best medical person, but you will inform police. And if you fail to inform, then under section 21, there is a provision of 6 months of imprisonment and fine. And you cannot afford that. That is why you have to inform. You treat that very patient, but you inform police. Because in the same type of cases which happened in city of Mumbai, patient had been to general practitioner by her mother, and she had complained of lump in abdomen. So general practitioner examined, but he couldn't come to conclusion. He advised sonography. So patient went to sonologist, and on sonography finding, she was diagnosed as a pregnancy with 24 weeks of pregnancy, and sonologist declared that she is pregnant by 24 weeks. So mother took her to gynecologist. They didn't come to family physician. They straightway go to this gynecologist. Gynecologist informed police. Police came to sonologist. Why you didn't inform police? General practitioner was not knowing she is pregnant, because they didn't come to general practitioner back. So in this type of situation, not to end up into any problem, it is always advisable to inform police. Any other comments? Yes, Walke.
I don't have a comment, but since there are such legal people sitting here and there's a police also, I want to ask one question which comes from Pune. In Pune, we are proud of asking Puneri questions. Puneri questions are all the Jugadu questions. So my question to you is, and this is a real case that has happened, a 15-year-old girl and a 17-year-old boy, they were in relationship. this 17-year-old boy made this 15-year girl pregnant. Now this has come to you under POXO. Now either you are representing the woman, the girl or the boy. Now is it who's the victim and who's the criminal? Is it that the boy is a victim, that the girl seduced him to get into a sexual act, or is it that the girl is a victim, that the boy made her pregnant? This is one googly that I want you to answer.
कितनी उम्र बोली बच्ची की? The pure POXO, under section POXO, it offense. Because minor girl, age of the 18, is under POXO Act, is made offense. Age of the boy, under above 16, is accused and the offense registered against him.
POXO Act is gender equal. It addresses both male and female.
Yes.
If girl is harassed to the boy, then the girl.
Yes.
So what I am saying is, if I am the lawyer representing the boy, I would say that ये girl ने मेरे बच्चे को seduce किया into getting into a sexual act. So when you are actually looking at POXO Act is a gender neutral act.
Yes, gender equal.
जेल में किसको जाना चाहिए? वो boy को जाना चाहिए because he made the girl pregnant, या वो girl को जाना चाहिए because she seduced the boy to get into a sexual act? This is my question. And unfortunately, sir, in Pune, the boy was put behind the bars in the remand. I mean, वो क्या वो जो juvenile इस पे गया वो. But this is so unfair to the males. This is what I would say.
Yes.
I want to take advantage of this stage to make a statement that all laws in our country are fair to women. जब women बोलते हैं ना हमारे ऊपर अत्याचार होता है तो law हमारे ऊपर अत्याचार करती है. This is what I want.
There are so many lacunas in POXO Act also.
Sir, times are changing. नहीं sir, times are changing. झगड़ा नहीं है.
There are so many lacunas in POXO Act. POXO Act made only the girls, not boys. That's the reality.
No, sir. It is gender equal and both could be considered as the accused. Both. Girl as well as boy. If a prosecution on part of boy can prove that she instigated her to commit this crime, then girl will be accused.
Sir, not a single case registered against the girl till today in all over India.
That is another story of the situation.
सर को पूछेंगे आप किसको अरेस्ट करेंगे? बॉय को अरेस्ट करेंगे या बोलेंगे कि गर्ल की डिलीवरी होने दो उसके बाद मैं गर्ल को अरेस्ट करूंगा?
First of all, I would like to congratulate IMA Bhuj, NMA Bhuj and Dental Club of Bhuj for organizing such a wonderful and need of the hour conclave. I'll address your question, but in my 25 years of experience, I have had so many cases I have resolved, and out of those cases, 75% of cases I have had the clinical or medical intervention, but not in this manner. It was a procedural. But this is for the first time in my life I am attending such kind of a dialogue between police, judiciary and medical fraternity. So I congratulate on the behalf of SP sir. Now addressing to this question, we have jumped directly to the trial base. But let first the offense get registered, let police investigate and let police submit the charge sheet in the court. Police will submit the charge sheet on the basis of the factual things as well as the evidences, whether the boy is culprit or the girl is culprit. This kind of discussion to decide whether the law is for boys or girl, we will need to call that bada bhai.
सर को पॉलिटिशियन होना चाहिए था.
मैं सर
ने
इसमें
आंसर तो दिया ही नहीं, लेकिन गोल गोल घुमा दिया.
सर मैं इसमें थोड़ा ऐड करना चाहूँगा. एक्चुअली सर
So if FIR is filed on part of that boy, and on investigation, if it is proved that she instigated him to constitute this crime of POXO, entering into intercourse, then boy will be accused. I mean, girl will be accused, and boy will
बॉय
be
तो यही
victim.
बोलेगा ना सर, मुझे तो ये सब कुछ मालूम ही नहीं था, उसने मुझे बुलाया घर पे और उसने सिड्यूस किया, तो यही बोलेगा. तो आप द FIR विल बी अगेंस्ट द गर्ल ना इन दैट केस.
So, to instigate, to help, to provide aids, to constitute crime is equally punishable. Anybody instigate anybody to constitute crime, anybody helps anybody to constitute crime, anybody gives aids to constitute anybody to constitute crime, it is equal. So in this case, if file is complaint on part of boy, and if it is proved that she instigated him to constitute this crime, she will also be accused.
Ultimately, the conclusion is law is an ass, that you have to know, and there is a lot of advocacy required to be done when it comes to POXO. POXO is an act जो घाई में किया गया after the Nirbhaya case. So बहुत जल्दी में किया हुआ act है, and that act needs a lot of advocacy, and even at the level of FOXY we'll have to do a lot, because we sometimes get husband and wives who are underage. I mean, they are married at a very young age. A 16-year-old girl gets married, and फिर इनको जो उनकी marriage है उसको हम लोगों ने null and void करने का क्या? So there are certain things that such forum में जब ये इसका I have not raised this question just for the fun of it, but the reason of having such discussion is to make people understand that POXO is not a very easy act as it sounds, and there is a lot of problems that even the police officers, the lawyers and the doctors can face. We need to have a relook at the act, and a lot of advocacy is needed on that act.
Because many a time, particularly gynecologist friends are facing this situation. Patient is brought for antenatal checkup and she is minor. They are happily enjoying their marriage life. They have no complaint against anybody. But even then, under this provision, gynecologist is under obligation to inform police. So, police will have to be informed, and under section 19, I mentioned prior also, it is very much mandatory to inform. And if he fails, then under section 21, there is a provision of imprisonment for 6 months. But in very recent case in Supreme Court has very good observation. When they are happily enjoying their marriage life, though they are minor, they have no complaint against anybody. And if doctor fails to inform, there should be lenient view on part of investigating officer and on part of court not to punish doctor. But we are waiting for that judgment exactly in which word Supreme Court has mentioned. But till then, we have to abide by law and we have to inform police. Let us see one more situation. Place is approved for termination of pregnancy. Clinic and hospital is to be registered if MTP practice is to be done. So in this case, place is approved. Person is qualified. Either he should be postgraduate degree, diploma, DNB in OBGYN, or MBBS having experience and in panel of surgeon as far as practice of MTP is concerned. Pregnancy is less than 12 weeks. Patient had been to that clinic, pregnancy less than 12 weeks. But patient was major, but patient was unmarried. My question, can one terminate pregnancy? Yes, no. Can one person is qualified, center is registered, pregnancy less than 12 weeks, indication is also there to terminate pregnancy. She is major but unmarried. Can one terminate pregnancy? Yes? No? Yes. So one can, because she is major, she can take decision to terminate pregnancy. One more question. Should one inform police? No.
No.
Because she is major. So no need to inform police. But now tricky situation comes here, because this is real happen case in South Gujarat only. In this type of situation, pregnancy was terminated with all the formality. Consent taken in Form C, opinion formed in Form 1. So everything was as per provision of MTP Act. But after 1 month, police comes to that very clinic that she has lodged complaint of rape against that boy because she had given consent of coitus against promise of marriage. He had given promise that I will get married. But now he is declined with her promise and she has lodged a complaint of rape against that very boy. And now question on part of police to gynecologist was there, why you didn't inform police? Now open for discussion. What gynecologist should have been doing in this type of situation, not to end up into any problem?
Sir,
Yes.
2 points are in favor of gynec. That patient is 18.
Yes.
Major. Consent given. All papers, documents, that is less than
Yes.
12 weeks. So the MTP Act, as per you, 1971, has given the this thing that termination can be done. And regarding that,
That part is okay. Termination, everything is fine. Question only, why you didn't inform police? That is the question. And how you can be out of this situation and which kind of special precaution you should take at the time of dealing with this type of cases. This is the central idea for discussion.
that time the patient, when she had visited, she did not give the history of this thing, rape or anything. She has given a history of consensual.
Yes, fine.
So the two adults can have a consensual relationship. So the law doesn't have any obligation on that. It has been mentioned. So the gynec doesn't have any say in this. So whatever the paper and document is there. So any
So-
female can change any time that
So, word
thing.
of caution in this, rightly mentioned by Dr. Nirmala, we should take, naturally we will take consent before going for termination of pregnancy, but in that very consent, we will add 3 lines. Consent in her own handwriting that it is a result of consensual sex, because at that point of time there was no dispute between them and she had given fair consent. No complaint against anybody. At that point of time, she had no complaint against that very boy or anybody. And at that point of time, she didn't want to inform police. So how any gynecologist or any doctor dealing with this type of situation can presume that she may go against complaint in that very boy and he should inform police? So in this situation, if patient has given consent like this, and if you have not informed police, you are not at all at fault, you are not at all liable for any legal proceeding, because at that point of time, both were major, they can take decision, and they were having consensual sex. So this is the carry home message. Anybody has to take anything? Pardon?
If the MTP was done less than 12,
Ah.
if the MTP was done by the doctor within the prescribed time, whether it's an offense, whether it's an offense under any law?
No.
So then why? Why the question is there?
No. Question arise after MTP, she filed a complaint
I understood.
against that very boy that it was rape.
But it is a part of the investigating officer. He just come and record the statement, nothing else.
Agreed.
So,
but
so what happens
when-
is,
yes.
what happens is, ये कंप्लेन एज पर दी एमटीपी एक्ट उसने एकदम सही किया, कुछ भी गलत नहीं किया है, और ये उन्होंने सपोज सेंटेंस नहीं लिया. होता क्या है, 3-4 साल के बाद में व्हेन शी मेक्स अ कंप्लेन अगेंस्ट दिस बॉय एंड शी मेक्स द डॉक्टर अ पार्टी, मुझे लॉयर को अपॉइंट करना पड़ता है, मुझे उसको पैसे देने पड़ते हैं, आई हैव टू गो टू द पुलिस स्टेशन में जाके एक्सप्लेन करना पड़ता है. इस झंझट से दूर होने के लिए सिंपल लाइन which says that whenever an unmarried girl comes to you for an MTP, a simple one-liner in the consent that this is out of consensual sex. The moment you police complaint करेगी, मेरे पास आएगी, मैं जाके पुलिस को ये दिखाऊंगा कि बाबा उसी वक्त उसने लिख के दिया था कि this is out of consensual sex. Police will not even put a case against me, right, sir? if this line is there?
उस टाइम पे एमएलसी केस नहीं, एमएलसी केस लगता डॉक्टर को तो वो इन्फॉर्म करता है, एमएलसी केस नहीं था, सीधी सी बात है.
Simple. So let us discuss one more interesting case. How to manage this type of situation? Let us see.
In the previous case, one more aspect is required: perfect documentation. When that lady came for the first time to doctor, at that time, perfect documentation should be done that this was consensual, the thing was consensual, and she does not want to file any complaint of rape.
Yes.
When she comes for the second time and she wants to file a complaint of rape, that will not fall into the category of rape. It will fall into the category of BNS 69. That the person has promised her to get married and get that things done, and then he did not kept his promise. So in that case, there won't be any problem to doctors, but doctors will be there as a witness, the main witness, because the first incident, the documentation of first incident would be considered as the biggest evidence.
Yes. So let us see one more situation. Rickshaw driver approaches family physician's clinic at 8 p.m. with gasping patient. Immediately family physician examining that very patient send him in nearby general hospital because he is sinking and nothing can be done, and better you ship this patient to nearby hospital. At general hospital, patient was found dead. So patient expired on the way and dead body was received by general hospital. Notice was served against family physician for negligence. Yes, matter for discussion. What that family physician should have done in this situation not to end up into this kind of litigation. Yes, Rudani said. These are real happened cases with some of our friends, and that is why we have put for discussion.
Family physician sent to patient general hospital or government hospital. Then family physician, there is no need of any, because he referred to direct and not seen the patient, only seen in the OPD and sent the patient referred to.
Even in rickshaw or even on your examination table, when you saw patient sinking or gasping, straightway without doing anything, would you refer that patient to nearby hospital? And is it correct way?
It is not correct way. If there is any notice came from patient or anybody, so first we consult the advocate and take the advice.
Resuscitation should be done.
Yes.
First and
At
foremost thing,
least
resuscitation.
He should have done something to save life of that very patient. He should have resuscitated that very patient. Whomsoever this patient is brought by, he should have explained that this is gasping patient. I am giving my first aid treatment only. I am not expert of this, and we are referring this patient to nearby hospital with resuscitation on in the rickshaw only. Then something he should have done. Then he was out of a problem. So without doing anything, straightway if you refer patient to nearby hospital, you may be put into trouble in this type of situation. Yes, Walke.
MC sir, see, it's a utopic word. It is really a utopic word to expect a family physician to do resuscitation on a gasping patient. ये बोलने के लिए बहुत आसान है सर. It is very difficult. My brother is a family physician. वहाँ पे कुछ नहीं रहता. So it is very nice for the Supreme Court to say in the Paramananda Katara case that every road traffic accident जो आपके पास आता है, आपको first aid देना पड़ता है. What is the definition of first aid? They have not defined first aid. They have not defined what is stabilization of the patient. Is there a definition of stabilization of patient given in the Supreme Court judgment? Nothing has been given. So first aid म्हणजे Voveron देना है क्या? First aid यानी TT देना है क्या? First aid यानी bandage करना है? Nobody knows that. मैंने Voveron दिया and the patient dies on the way. I will be accused that तेरे Voveron के कारण patient मर गया या TT के कारण patient मर गया या तूने dressing किया है इसके लिए मर गया. So in India, the courts only pass orders without going into the details of what is the situation in our country. Now even the Clinical Establishment Act is coming, and they are saying every clinic should resuscitate. अगर आपको लगता है एक डर्मेटोलॉजी का क्लिनिक बैठा है, वो स्किन स्पेशलिस्ट है, वो क्या अगर गायनेक पेशेंट उसके पास आएगी तो वो क्या ट्रीटमेंट दे सकेगा? इट इज़ वेरी इजी टू से फॉर समबडी सिटिंग इन द सुप्रीम कोर्ट पास अ जजमेंट लाइक दैट. So I did a little bit of research when it came to road traffic accident and when it came to such similar situation. In UK and USA, there are paramedical team which comes, एक helicopter से आते हैं sir, which will come within 5 to 10 minutes at the place, and they are trained in resuscitation. They will resuscitate the patient and take the patient to the tertiary care hospital. Even in UK and USA, family physicians are not expected to give this kind of a treatment which the Supreme Court is expecting from us. So again, this question that you have raised, sir, needs a lot of advocacy, and that is the reason that people like us are sitting together and discussing such cases. When such cases come to you, you will realize that ये बोलना बहुत आसान है सर कि आप कुछ तो करो. So what I nowadays say is, do something, be seen to have done something. आपने कुछ किया ऐसा दिखाओ. नंबर 1 यानी कुछ तो करो, ड्रेसिंग करो. एंड सबसे बेस्ट थिंग क्या है मालूम है? उस एरिया के जो कॉरपोरेटर है उसको फ़ोन करो और उनको बोलो, साहब अपने पास ऐसी केस आई है, आप आ जाओ, हम मिलके उसको टर्शरी केयर हॉस्पिटल में लेके जाए. सर ये आपकी वोट बैंक है, तो वो भी आएगा आपके साथ क्योंकि उसको मिलेगा ना भाव बाद में. सो दिस इज़ वन जुगाड़ दैट आई डू इन माई प्रैक्टिस. इमीडिएटली मैं कॉरपोरेटर को फ़ोन करता हूँ, उसको बुला, वो तो आ ही जाएगा और उसको बोलता है चलो अपन एम्बुलेंस अरेंज करेंगे, लेके जाएंगे.
सर आप फेमस है, इसके लिए आपका फ़ोन उठा लेंगे. हमारा जैसा का क्या होगा?
मैडम मैं आपको बोलता हूँ, मैं आपको एक बात बोलता हूँ, आपको पुलिस को फ़ोन करना है ना, आपके मेल रेजिडेंट को फ़ोन करने को मत बोलो. एक मिनट, आपको फ़ोन करना है पुलिस को, फीमेल को बोलो. जैसे ही फीमेल का फोन आता है ना, मेल ना, हाँ आता हूँ, अभी आता हूँ. फीमेल इन डिस्ट्रेस, वो मेल है ना अल्टीमेटली. मुझे भी किसी फीमेल का फोन आएगा तो मैं भाग के जाऊँगा. तो टेक एडवांटेज ऑफ दिस फैक्ट कि अल्टीमेटली पुलिस भी इंसान है, वो भी मेल है. फीमेल का फोन उठाएंगे, फौरन आएंगे. सो ये ट्रिक आप याद रखो. और रो थोड़ा सा रोने का, थोड़ा रोने का फोन क्यों.
सो कैरी होम मैसेज राइटली rightly mentioned by Dilip Walke, you will have to show that you had done something to save life of patient. That's all. You cannot save patient every time, but your efforts to save life of patient should be shown, and you should be in a position to show it. Yes.
One point is you have to do something to stabilize whatever you say. Other important aspect is to transport in proper way.
Agreed, but you have no time. When patient is simple,
Sir,
of course it is in
politician का ambulance service रहता है.
But patient is gasping. You have no time to arrange for ambulance. Would you like to wait for ambulance?
No.
Or in the same rickshaw during resuscitation you will refer that very patient to nearby hospital? Naturally. So in any case, at the time of case, how court interprets in that very situation, that patient was not with you and that patient would have been to me, what I would have done, that way court interprets. If any prudent doctor in that very given situation, what he will do, whatever measures he would have taken, if you have taken, you are out of problem, irrespective of ultimate outcome of treatment.
Sir, one point is missing. Patient comes to the doctor, female physician. And then second point is doctor has been summoned by notice. But in between, if that family physician, see, patient has died, so who has registered a case? His or her relatives. So when patient comes, somebody would have brought that patient. So it is the first thing that doctor should do is inform the relatives about the condition of that patient. कि ऐसा है, मेरे बस की बात नहीं है, मैं थोड़ा ये प्राइमरी करता हूँ, बाद में इसको ये जगह पे रिफर करना पड़ेगा, and document that. So irrespective of the doctor, that person is male or female, police will also come as well as.
Sir.
Yes.
Sir,
Yeah.
I fully support Christian sir
I am here for last more than 45 years. And as sir told, many times patient came in rickshaw or some khulli jeep માં આવે અને there are relatives with their patient is gasping, હું એને અંદર રૂમમાં લઉં ને કંઈ કરું તો એ પહેલાં કદાચ ગુજરી બી જાય. તો we used to send them at that time general hospital was the only hospital. તો અમે મોકલીએ પણ what I was doing, what Christian sir told, હું રિલેટિવ્સને બોલાવું કહું જો ભાઈ બહુ સિરિયસ છે આપણે અહીંયા ઉતારશું તો બચવાના ચાન્સીસ નથી પણ ત્યાં લઈ જાઓ ને ટાઈમસર પહોંચશો તો કદાચ હેલ્પ થશે. એન્ડ મોસ્ટ ઓફ ધ ટાઈમ વી નેવર હેડ એની પ્રોબ્લેમ.
બરાબર. એટલે પ્રોપર કાઉન્સેલિંગ ઇન ધીસ ટાઈપ ઓફ સિચ્યુએશન વિથ રિલેટિવ or person who has brought that very patient. Many times he might not be her relative also, because in roadside situation, one patient is brought in rickshaw by some social worker, I would say. So in this situation, if you explain, then you could be out of problem. Yes, sir.
Sir, I am Dr. Bhuj. I am basically a government servant, worked for 33 years in government, retired as a civil surgeon. Government has already declared Good Samaritan ward.
Yes.
So not only a doctor, even a citizen of the India should also know how to help the patient. So basic life support system and advanced cardiovascular life support system is also taught to the truck drivers and rickshaw people. So he should try actually. The rickshawala is first important. And another thing, that he should know where to send the patient. Instead of going to the physician, he should know where the secondary or tertiary center is. The government has already developed various programs. So as a part of the Good Samaritan Award, Device P3 and Jetty sir will agree with me, he should try to rescue the patient and to help the patient as much as possible to survive the patient.
Is any question or should we proceed further? Now, very important part and to Christian sir only. Patient develop complication during treatment or in few of the cases patient expired. An aggrieved relative rush to police station and demand arrest of doctor. What will you do?
First of all, my message, not from the district police, but from the whole police department, that police is not here to threaten, harass or arrest the doctors. Police is here to protect the rights of patient as well as protect the doctors from illegal harassment or any kind of violence. I still remember one incident. I have completed 25 years in my job, and by the grace of God, there has not been a single incident where a doctor or any person from medical fraternity has been victimized because of any police procedure, so far as my career is concerned. And I still remember one incident. When I was as a probational PSI in my initial phase of my career, I was very fresh. And I was working, serving in Vadodara city, and one case came to me. One pediatrician was assaulted by the relatives of that boy who was deceased. And I had to rush to that hospital. Before I rushed, there was damage done to the hospital. Glasses were broken, and I immediately protected that pediatrician. And after that, I did not allow anything happen to that pediatrician or that hospital. But what I did, I protected that pediatrician, but simultaneously, I took the relatives of that deceased boy into loop, into confidence. I showed them each and everything. I did the investigation in a thorough way, in perfect way. And since there was no negligence or nothing against that pediatrician, I gave him clean sheet, but I protected him in the very beginning of my career. But simultaneously, I took the relatives of the boy in the loop, in the confidence. So this is very clear. Of course, police is not here to threaten or harass or assault the doctor. Police will never ever arrest the doctor on the demand of relatives, provided that doctor is innocent. police has to conduct the investigation in a proper way. If only the doctor is found having that kind of criminal negligence, then only, and that too, having a proper report from a doctor, an authority, that this doctor is found to have that kind of criminal negligence. After that only police will arrest the doctor, not on the basis of any kind of pressure of this relative of the deceased person.
So Christian sir is kind enough, उन्होंने अरेस्ट नहीं किया, लेकिन yes sir.
हेलो सर, इसमें मैं थोड़ा मेंशन करना चाहूँगा जो क्रिश्चियन सर ने बोला ना, मेरी 28 इयर्स की सर्विस हुई कांस्टेबल से एज अ PSI। सर जब अभी हम 3 बैठे हैं, डॉक्टर, पुलिस, एडवोकेट। सोसाइटी में किसी को भी कुछ भी प्रॉब्लम होता है ना, तो वो सबसे पहले पुलिस के पास जाएगा। उसको फिजिकली कुछ हुआ ना तो डॉक्टर के पास जाएगा, और पुलिस वाले ने कंप्लेंट रजिस्टर कर दी तो वो एडवोकेट के पास जाएगा। हम जो उसको बोलेंगे ना वही सच होगा। अभी आपने जो बोला कि उसका पेशेंट डेथ हो गया, तो उसका जो भी रिलेटिव है सर, वो इतने एग्रेसिव हो जाएंगे कि भाई डॉक्टर ने ही उसको मार डाला है। तो जैसे पुलिस को तो जाने का होता है, पुलिस को तो हमको मालूम है कि भाई डॉक्टर ने नहीं मारा है, लेकिन उसको समझाना पड़ता है मॉब को कि भाई डॉक्टर ने नहीं मारा है, हम डॉक्टर के खिलाफ इंक्वायरी करेंगे, उसकी गलती हुई तो उसको अरेस्ट करेंगे। ऐसा करके ये रियल टाइम सिचुएशन जो होती है उसको संभाल के, उसको शांत करके, वो क्योंकि जब मॉब होता है ना तो मॉब में कोई अक्ल नहीं होती है। 5 आदमी होगा तो एक पुलिस वाला होगा, और 500 आदमी होंगे ना तो भी एक ही पुलिस वाला होगा। तो वो एक पुलिस वाला जब 500 आदमी को संभालने जाएगा तो उस टाइम वो बोलेगा कि भाई डॉक्टर की नेग्लिजेंसी है, तो पक्का पुलिस उसके खिलाफ FIR रजिस्टर करेगी, उसको अरेस्ट करेगी, कोर्ट में भी प्रोड्यूस करेगी। ऐसा सिचुएशन संभाल के मॉब को हम कंट्रोल करते हैं। तो उस टाइम पे लॉ ने, जैसे आपने सर वो 2005 का जो जैकब मैथ्यू का जो जजमेंट नामदार सुप्रीम कोर्ट ने दिया है, उसमें पूरा मेडिकल को कवर कर लिया है, पूरा कवर कर लिया है कि भाई कोई भी FIR, इवन कोर्ट को भी बोल दिया है कि आप प्राइवेट कंप्लेंट डायरेक्ट रजिस्टर नहीं करेंगे। पुलिस को भी बोल दिया है। 2030 में ललिता कुमारी वर्सेस यूपी का जजमेंट आया कि कॉग्निजिबल ऑफेंस हो तो पुलिस को रजिस्टर करना ही है, इट इज़ मैंडेटरी। लेकिन उसमें भी एक्सेप्शन दिए हैं कि भाई मेडिकल या नेग्लिजेंस का हो तो आप इंक्वायरी कर सकते हैं। अभी BNSS 2023 आया तो उसमें 170 थ्रू पैरा 3 में भी दिया है कि भाई प्रिलिमिनरी इंक्वायरी आप इट इज़ मैंडेटरी। तो जैसे सर आपने बोला, तो वो मॉब में भी नेता होते हैं, वो भी हमको जजमेंट दिखाते हैं कि भाई इट इज़ मैंडेटरी, आप पहले कंप्लेंट रजिस्टर करो उसके बाद करो। लेकिन वो सिचुएशन को संभाल के करना पड़ता है। डॉक्टर को अरेस्ट नहीं करना है। इवन FIR हैज़ बीन रजिस्टर्ड, 7 साल की सज़ा होती है। तो BNSS 2023 35(1)B में जो कंडीशन है, वो कंडीशन के तहत ही हम 7 साल से कम उम्र जो सज़ा है उसमें अरेस्ट कर सकते हैं। अदरवाइज नोटिस दे के हम उसको जाने देते हैं। तो जैकब मैथ्यूज में भी बोला है कि इट इज़ नॉट रूटीन मैनर आप अरेस्ट करो। अरेस्ट करना है तो उसके लिए ऐसा लगता है कि भाई प्रोसिक्यूशन के सामने वो कोर्ट में पेश नहीं हो सकते हैं, भाग जाएंगे कि ऐसा कुछ है तो ही अरेस्ट कर सकते हैं। तो मेडिकल है वो पूरा प्रोटेक्टेड ही है। और नेग्लिजेंसी प्रूव करने के लिए जो 4 होता है कि मेंस रिया, एक्टिव्स रियूस, यानी उसका गिल्टी एक्ट है या नहीं है, उसने किस तरह का इंजरी या हार्म किया है, वो सब प्रूव करना पड़ता है। तो इन्वेस्टिगेशन में प्रूव करने के लिए एविडेंस चाहिए, और एविडेंस होता है तो ही अरेस्ट कर सकते हैं। हाँ, कभी कभी सिचुएशन को संभालने के लिए पुलिस को एफआईआर रजिस्टर करनी पड़ती है, लेकिन एफआईआर रजिस्टर करने का मतलब ये नहीं होता है कि हम एक्यूज को अरेस्ट करेंगे, क्योंकि उसमें भी लॉ में भी प्रोवाइड दिया हुआ है कि पूरा एविडेंस नहीं होता है तो हम फाइनल भरते हैं कि भाई गलत उसकी एफआईआर हुई है या तो उसके खिलाफ एविडेंस नहीं है, कुछ भी ऐसा करके कर सकते हैं। तो मेरा एक या इसका पर्पस ऐसा है कि आपके खिलाफ एफआईआर हो गई तो ऐसा मत समझो कि आपको पुलिस अरेस्ट करेगी।
So, but अब now, चलो, both police officers are kind enough towards medical fraternity, but relative has apprehension कि भाई डॉक्टर को के सामने एफआईआर हुआ है और दे अप्रोचेज आवर एडवोकेट फ्रेंड्स, हाउ विल यू डिफेंड इन दिस सिचुएशन? रिलेटिव आपके पास आ गया कि सर जी शायद उनका अरेस्ट हो सकता है, एफआईआर लॉन्च हुई है, and you have to guide them, you have to assist them, you have to help them.
इंक्वायरी होने के बाद ही वो उसके बाद में एक्शन लेने की बात आएगी। 304
नहीं, दे हैव एप्रीहेंशन कि शायद उनको अरेस्ट कर सकते हैं। व्हाट वुड यू एडवाइज टू रिलेटिव? डॉक्टर नहीं, आपके डॉक्टर मानो के पुलिस स्टेशन गए हैं, कई बार क्या है सर जी ने जैसे बताया कि मॉब को कंट्रोल करने के लिए भी ऐसे शो भी करना पड़े, चलो डॉक्टर को पुलिस स्टेशन ले जाते हैं ताकि मॉब क्वाइट हो जाए, फिर एफआईआर करना, आगे इन्वेस्टिगेशन करना, इट इज़ ए प्रोसेस। बट इन दिस सिचुएशन देयर विल बी एप्रीहेंशन ऑन पार्ट ऑफ रिलेटिव ऑफ डॉक्टर, या तो डॉक्टर फ्रेटर्निटी में हमारे दूसरे डॉक्टर मित्र आ गए साथ में कि भाई चलो एडवोकेट के साथ जाते हैं, डिस्कस करते हैं ये डॉक्टर को कैसे इसमें से बाहर निकालना है। तो ऐसे करके मानो कि आपके पास डॉक्टर फ्रेंड्स आए कि डॉक्टर के रिलेटिव आए, हाउ यू विल असिस्ट देम, कि आप उनको कैसे मदद करोगे, ये मेरा क्वेश्चन है।
हम तो उसी टाइम बोलेंगे कि पहले इंक्वायरी हो जाने दो, इंक्वायरी होने के बाद एविडेंस आएगा कि इनकी नेग्लिजेंसी है, क्रिमिनल नेग्लिजेंसी, उसके बाद ही अरेस्ट होने की बात आएगी। और 304 पार्ट 2 है तो इट बेलेबल ऑफेंस, बराबर, पुलिस उसी टाइम पुलिस स्टेशन में बुलाएगी और छोड़ देगी।
पर 304 मानो की लगाया नॉन बेलेबल है।
हाँ। कोई बात नहीं, मेरे पास अब दो इट इज़ अगेंस्ट आवर सिस्टम और एथिक्स, मैं आपको बताना चाहूँगा कि इस केस में व्हेन ए डॉक्टर हैज़ एन एप्रीहेंशन ऑफ गेटिंग अरेस्टेड, तो उनके पास नंबर 1 सबसे पहला जब डॉक्टर कन्विंस्ड है, पूरा कन्विक्शन है और उनको पता है कि केस जो रजिस्टर हुआ है वो गलत है, तो यू कैन डायरेक्टली अप्रोच टू द ऑनरेबल हाई कोर्ट फॉर क्वॉशिंग द एफआईआर। एफआईआर को कॉस्ट साइड पुट साइड, नंबर 1 वो है। नंबर 2, अगर आपको ऐसा है कि नहीं मेरा थोड़ा सा इन्वॉल्वमेंट है एंड आई कैन बी अरेस्टेड, सो यू कैन गो फॉर एंटीसिपेटरी बेल। These are the 2 remedies.
So I was expecting that also. So you can advise anticipatory bail also, or if he is already arrested, then you can go for regular bail also. So these are. Yes, naturally. So either in lower court discharge application or in high court quashing of that very case. Yes, yes, Walke.
नहीं, हमें ना कभी कभी एक्सपर्ट्स बोलते हैं कि तेरे को अरेस्ट करने वाले फ्राइडे है, भाग जा। फ्राइडे है, सैटरडे संडे छुट्टी रहती है, 2 दिन तेरे को अंदर रखना पड़ेगा। तो ये बोलते हैं, ये करेक्ट है क्या? आई जस्ट वांटेड टू आस्क द पुलिस ऑफिसर।
सर,
फ्राइडे
एक्सपर्ट जो होता है ना वही ऐसी एडवाइस देगा। मेरे जैसे लो लेवल के एडवोकेट के पास जाएंगे ना तो वो ऐसी एडवाइस नहीं देगा। कोई आपके एक जो छोटा वाला डॉक्टर है उसके पास जाऊंगा तो वो प्रॉपर मेरी ट्रीटमेंट करके थोड़ी सी फीस में पूरा कर देगा। लेकिन चेस्ट पेन है और मैं कोई हाई लेवल के डॉक्टर में गया तो वो मुझे सुला देगा, ईसीजी करेगा, ये सब करेगा। तो जो मुझको थोड़ा सा पेन था तो भी बड़ा कर दिया। एक्चुअली ऐसा होता है सर, कि वो एक्सपर्ट ऐसा बोलता है कि भाई आज फ्राइडे है, तू भग जा और 2 दिन कोर्ट में छुट्टी है और तुझे जेल में रहना पड़ेगा। ऐसा कुछ नहीं है सर। अब मैं लो पॉइंट पे आता हूँ। यदि आप नहीं भगते और सैटरडे को पुलिस आपको अरेस्ट कर लेती है तो पुलिस को ओनली एंड ओनली 24 आवर्स इन्वेस्टिगेशन में रखने का पावर है। कोर्ट बंद है, जज साहब तो है ना, जज साहब नहीं होंगे तो उसका चार्ज होगा, तो विदिन 24 आवर्स आपको मैजिस्ट्रेट के समक्ष प्रोड्यूस करना ही पड़ेगा।
बिल्कुल।
तो बेलेबल ऑफेंस है या तो कोई ऐसा कुछ नहीं है, मेरिट के ऊपर आपको बेल मिलना चाहिए तो घर पे भी बेल मिल सकता है, उसमें भागने की ज़रूरत नहीं है। यदि आप भागते हैं तो ऐसा प्रिज्यूप्शन होता है कि आप एक्यूज है, तो ये जो आप भग गए ना तो फिर आप एंटीसेप्टिव के लिए जाएंगे या तो फिर रेगुलर बेल में जाएंगे, तो कोर्ट इसके ऊपर थोड़ा प्रिज्यूप्शन करेगी यदि प्रोसिक्यूशन ने ये रखा तो।
24 घंटे भी मुझे अरेस्ट नहीं होना है, समझो 24 घंटे आप रखेंगे ना अंदर, तो 24 घंटे भी मुझे अरेस्ट नहीं होना है, तो मैं क्या ये कर सकता हूँ? ये पॉलिटिशियंस करते हैं तो मैं क्यों नहीं करूँ कि मैं अपने दोस्त के नर्सिंग होम में, मैडम के नर्सिंग होम में जाके चेस्ट पेन के लिए एडमिट हो जाऊँगा और वो बोलेंगी हो सकता है ये मायोकार्डियल इन्फेक्शन हो, तो ये कर सकते हैं क्या?
ऐसा कोई वकील तो नहीं करता है जल्दी कोई, इतना तो मैं बोल सकता हूँ। मैं लॉ जो ही है उसके डॉक्यूमेंट सब कोर्ट में जाने वाले हैं।
MC पटेल को बोलूँगा, वो दोस्त है।
आपको डिस्चार्ज करके बात में किया, what is after discharge? There is still apprehension of
There can be a suspicion that he's got myocardial infarction. There is no need that उसको myocardial infarction होना चाहिए। मुझे पेट में दर्द है सर, myocardial
उसका जवाब मैं देता हूँ
दर्द है
कि उसी टाइम जब वो हॉस्पिटल में जाके बैठ
तो
जाएगा ना,
पॉलिटिशियंस क्या करते हैं
तो पुलिस वाला उसके पास में ही बैठा रहेगा वहाँ 24 घंटे।
वांदा नहीं, लेकिन पॉलिटिशियंस करते हैं ना, तो वो करते हैं। हम
वो पॉसिबल नहीं। पॉलिटिशियन में तो सब पॉसिबल होता है।
चलो ये भी पॉसिबल नहीं, वो भी पॉसिबल नहीं, अंदर जाना पड़ेगा।
सर ऐसा कुछ नहीं होता है कि पुलिस अरेस्ट करती है तो अंदर ही जाना पड़ता है। अभी आपने बोला कि मैं हॉस्पिटल में एडमिट हो गया और हेमसिंह सर ने भी बोला कि पुलिस वाला आके बैठ गया। अभी आपको रियल स्टोरी बताऊं कि आप हॉस्पिटल में गए, पुलिस वाला भी आ गया, 3 दिन तक आप हॉस्पिटल में रहे तो पुलिस वाला तो आपके ऊपर रहा, तो वो 3 दिन तो आपकी कस्टडी पुलिस की हो गई। उसके बाद जब भी आपको डिस्चार्ज करेंगे अंदर नहीं, पुलिस। अब यदि आपने एंटीसेप्टरी दाखिल कर दी, चलिए आपने बोला कि भाई हॉस्पिटल में मैं चला गया, डॉक्टर को बोला, डॉक्टर एंटीसेप्टरी के लिए चला गया, तो प्रोसिक्यूशन यानी कि पुलिस वो कोर्ट को ऐसा रखेगी कि सर हमको इसकी कस्टडी की इतने रीजन से ज़रूरत है, हमको इसकी इतनी इंक्वायरी करनी है, इसलिए हम इसको कस्टडी में लेना चाहते हैं। तो यदि आपका एंटीसेप्टरी नहीं हुआ तो पुलिस के पास तो 24 का ही पावर है, 24 के ऊपर तो वो रख ही नहीं सकती है। तो और पुलिस भी डॉक्टरों का मान सम्मान रखती है, हम लॉकअप में नहीं रखते हैं, रूम में रखते हैं और इंट्रोगेशन करते हैं।
વેલમાં પણ કોઈ અરેસ્ટ ન કરવાના પ્રોવિઝન નથી હોતા। એન્ટિસિપેટરી મંજૂર થઈ ગઈ હોય તેમ છતાં પોલીસ અરેસ્ટ કરી લે છે ને પાછળથી ખબર પડે એન્ટિસિપેટરી મળેલા છે, પછી પોલીસ છોડતી હોય છે। પોલીસને ન પકડવાના કોઈ એવી નથી કે પકડશે નહીં, જ્યાં સુધી કોર્ટ સ્ટે ના આપે। એટલે એન્ટિસિપેટરી પેન્ડિંગ હોય તો પણ આરોપીઓ પકડાય છે, એની કોઈ એવું નથી કે અરજી કરી દીધી તો આપણે પકડાશું નહીં।
As such, under CRPC, now newer version, police has tremendous power in presence of both our respected police officer, I say. Police has tremendous power to arrest anybody at any time from any place without giving reason. Let it me repeat and complete, without giving reason. But mentioned by sir, within 24 hours, a arrested person will be produced before honorable court and police will have to justify why they have arrested that very person. So without justification, police will also think twice whether to arrest, whether not to arrest. So as such, there is a wrong fear, I would say, in mind of people. As such, police is also under obligation to abide by law, and before honorable court they have also to justify, giving reason why we have arrested that very person.
Absolutely agreed. Adding to this, I would like to give very practical approach. एकदम practical approach कि अगर आपको इच्छा है कि मुझे सैटरडे संडे 2 दिन नहीं जाना है, तो नंबर 1 कि क्राइम होने ही ना दो. प्रैक्टिकल अप्रोच. अगर हो गया है तो हमारे में भी, पुलिस में भी एक वर्ड है, सर ऑल्सो वुड एंडोर्स के बोनाफाइड इंटेंशन, शुद्ध बुद्धि. आपने कोई भी कृत्य शुद्ध बुद्धि से किया है, जैसे पुलिस एनकाउंटर होता है, कोई क्रिमिनल को उसने पुलिस ने पाँव में मार दिया या कहीं भी मार दिया, तो that can also be justified because that work has been done by bona fide intention to protect someone. तो आपने कोई भी ऐसा कृत्य किया है जो शुद्ध बुद्धि से किया है, with bona fide intention to save somebody's life, तो that can be justified in the court of law. और रही बात 2 दिन रहने की, that solely depends upon the gravity of the offense. अगर offense ऐसा है कि 2-3 साल से नीचे या 7 साल से नीचे, पुलिस looking into the merits of the case, police will immediately release on the bail. अगर grievous offense है तो चाहे वो सैटरडे अरेस्ट किया हो या मंडे अरेस्ट किया हो, 1 महीने तक उसका छुटकारा नहीं होने वाला.
मुझे ऐसा लगता था कि फ्राइडे को सर्जरी नहीं करने का, अपना सर्जरी मंडे, ट्यूसडे, वेडनेसडे, थर्सडे, बस बाकी फिर ऑपरेटिव मत करो. लेकिन अभी मुझे पता चला कि मैंने कहीं भी सर्जरी की, कभी भी किया, मंडे को भी किया, तो अभी 24 घंटा अंदर जाना है तो जाना है.
एक
मिनट, હું સાહેબને જવાબ આપું કે સર્જરી લેફ્ટ પગની કરવાની છે અને રાઈટની કરી નાખી હોય તો એ જવું પડે સાહેબ, પછી ગમે ત્યારે કરી લેજો. પણ नेग्लिजेंसी क्या है न हो, ये जोवानो खाली.
सर मेरा क्या है ना, मैं गायनेकोलॉजिस्ट हूँ, एक ही यूट्रस है, तो वहाँ कोई प्रॉब्लम नहीं है.
नहीं, I go further. There every offense has a mens rea. If I believe that any doctor practice in this world never thought any mens rea in mind to damage his patient. Naturally. Mens rea is the basic factor of initiate the to start the crime. દુનિયાનો કોઈ ડોક્ટર નહીં હોય કે મારે મારા પેશન્ટને મારી નાખવું છે, તો પછી આપણે ઘબરાવવાની જરૂર નથી.
Chalo, let us see one more. And how much time exactly do we have? Interesting, એટલે મજા તો આવશે જ તમને લોકોને. So this is also real happened case in city of Ahmedabad only. Actually ENT surgeon, here mentioned surgeon, ENT surgeon decide to operate on compounder's nephew for tonsillectomy free of charge. It was in good faith of patient, and that compounder too, he had not to collect any charge, and operation was to be done for tonsillectomy. So no case paper were prepared, no consent was taken, nothing, because in good faith, because no charge was to be collected. But unlucky that doctor and that patient too, patient dies due to anesthesia complication on table. And notice was served, complaint was filed, case was filed. So now it is for discussion for doctors' friends only. In this type of situation, not to end up into this type of situation, what should be done? And if at all it happened, then what should be done? Even if you are going to do it totally free, even if it is a known patient, then also would you like to prepare record? Would you like to take consent? That is my question.
Yes, sir. Always. Documentation is necessary. Yes. Always, anyone, even your family members also, you need to take a consent because paperwork is very necessary nowadays.
Because we never know when patient or patient party may go hostile. So that is why even if you are going to go for free, then also all the requisite paperwork, proper consent, proper counseling, everything should be done. So carry home message in this particular case is like this. Yes, Walke?
I did my wife's cesarean section. I myself did a cesarean on her. मैंने मेरे वाइफ का कंसेंट लिया था.
So,
लेकिन प्रॉब्लम इज अभी तक बिल नहीं मिला मेरे को, यही प्रॉब्लम है.
सर बिल तो आपको भरना चाहिए ना, कंसर्न तो लेना चाहिए, बिल भी आपको भरना चाहिए.
कोई नहीं, वो पहली डिलीवरी तो मायके वालों की होती है ना. अभी वो मेरा फादर इन लॉ भी ऊपर चले गए, अभी कहाँ से मिलेगा पैसा.
ग्रेट एग्जाम्पल.
कभी कभी डोनेशन भी करता है सर कैरियर में.
So proper documentation is must, is a carry on message. Let us see one more very interesting situation, and now it will be much discussion between police officers sirs and advocate sir. It was like this: patient at 5 months of pregnancy attended doctor with complaint of forceful intoxication of complete vial of liquid mosquito repellent by her husband and in-laws, and she denied for any type of police information or complaint. Her all vitals parameters were good. She was treated accordingly and she was discharged. In simple way बताऊं, husband ने forcefully मच्छर मारने की दवा पिला दी पेशेंट को. 5 months प्रेगनेंसी थी एंड पेशेंट गायनेकोलॉजिस्ट के पास आया और ट्रीटमेंट के लिए आया था, और उसने रिक्वेस्ट की कि मुझे किसी पर कोई कंप्लेंट नहीं करनी है, ना मेरे हस्बैंड पर ना मेरे इन लॉज पर, और यू ट्रीट मी. सब अच्छा था. इन ड्यू कोर्स पेशेंट वॉज डिस्चार्ज. एक सिचुएशन. नाउ आफ्टर डिलीवरी, नाउ शी अगेन हैव कम टू द सेम डॉक्टर with her 9 months old baby, and she is asking for report of past incidents for purpose of police FIR, as her husband used to do domestic violence on her and her kid. ये डिलीवरी के बाद बच्चा जब 9 महीने का हुआ तब फिर से आई कि सर मैं जब ट्रीटमेंट के लिए आई थी ना, वो केस पेपर मुझे चाहिए, मुझे मेरे हस्बैंड के सामने केस फाइल करना है क्योंकि उनका हैरेसमेंट अभी रुका नहीं है. So now it is very tricky situation. What to do? इसको रिपोर्ट देना चाहिए, नहीं देना चाहिए. पेशेंट मांगती है कि भाई मैं ट्रीटमेंट के लिए आई थी, मुझे रिपोर्ट चाहिए.
नहीं, FIR is a right of a people of India.
नहीं, पहले तो मैं डॉक्टर की ओर से बोल रहा हूँ. डॉक्टर के पास वो पेशेंट डिमांड कर रही है कि भाई मैं जब पहली बार आपके यहाँ आई थी, इसके मुझे ट्रीटमेंट गिवन जो है इसके पेपर चाहिए. डॉक्टर को क्या करना चाहिए? FIR की बाद में बात करेंगे, पहले अभी डॉक्टर को क्या एडवाइस रहेगी आपकी?
If he seeks for documents, it is a right to.
Yes.
उनको देना ही पड़ेगा.
बिल्कुल.
Otherwise, it's a part of negligence.
Yes.
Right? Now, so far as the FIR is the situation is concerned, FIR must be there.
FIR तो अभी हुई नहीं है.
नहीं, मैं वही कह रहा हूँ कि जब वो आती है, वो कहती है कि मेरे हस्बैंड ने मुझे पिलाया है और मैं कुछ नहीं करना चाहता, और डॉक्टर कुछ एक्शन नहीं लेता है, तो इट इज फॉर देम टू एंजॉय द हॉस्पिटैलिटी ऑफ द पुलिस ऑफिसर.
Yes. So yes,
it
Nirmala
is
Ben?
must. They have to because it's a criminal offense.
Yes.
Doctor has to inform to the police.
That discussion we are going to come.
Okay.
So now, as far as record part is concerned, rightly mentioned by advocate sir, as per guideline from MCI, we are under obligation to give report of treatment given to the patient within 72 hours, and with newer guideline from NMC within 5 working days. So you cannot deny, you have to give. But now questions comes, and that you have
FIR, for so far as the FIR is concerned, FIR law after 9 years.
Yes.
You know, our law is so vast, very so vast. So late FIR has a very less value in the eye of law.
Agreed, but there is, as far as criminal case are concerned, there is no time bar. Patient may complain at any time.
That's why I
so
say.
Now my question is, was it case of attempt to murder?
No. How can?
नहीं, at that time when her husband forcefully, simple हिंदी में बताऊं, उसने forcefully मच्छर मारने की दवा पूरी की पूरी पिला दी. Was it attempt or murder?
Yeah, definitely.
सर MLC तो होगा ही ना. 5 months प्रेग्नेंट है और आए हैं तो MLC तो होगा ही.
Single murder, double murder होगा. Fetus is there.
Agreed.
Live
double murder. So my now question, patient at 5 months of pregnancy जो आया, उसने कहा कि मुझे केस नहीं करना है क्योंकि मुझे ट्रीटमेंट दो. अगर ट्रीटमेंट में she was fine and she was discharged in due course. तो ये नहीं किया है, इसीलिए अब क्वेश्चन ये आता है कि डॉक्टर को ये फाइल करना चाहिए था.
यस, करना ही चाहिए था सर. नॉन कॉग्निमेंस ऑफेंस है, एमएलसी होना चाहिए.
Serious offense where someone acts with the intention or knowledge that that action could cause death, and if those actions were not prevented, they would have resulted into murder. That is why.
I am
that is
putting
why
in a different
doctor
way.
has to inform.
I am putting in a different
Sir.
way.
Yes.
I am putting in a different way.
इसमें
अच्छा,
जब पहली बार ये लेडी आई, उसने डॉक्टर के कोई भी मेडिकल प्रैक्टिशनर जो है उसको बोला कि फोर्सफुली मेरे हस्बैंड ने मुझे ये पिलाया है और मैं कंप्लेन करना नहीं चाहती हूँ, तो पहली डॉक्टर की फर्ज है, डॉक्टर नहीं, बीएनएसएस सेक्शन 33 में ऐसा लिखा है कि कोई भी आदमी को गुनाह बना हुआ है ऐसा मालूम पड़े तो उसको पुलिस को बताने की उसकी ड्यूटी है. तो यहाँ तो उसने खुद ने हिस्ट्री लिखवाई है, तो डॉक्टर पुलिस को इन्फॉर्म करेगी, पुलिस आएगी, उसके ऊपर से वो जानवा जोग या कुछ भी है, कंप्लेन नहीं करना चाहती है तो जानवा जोग करके भी उसको करेगी, उसका स्टेटमेंट लेगी, फिर डीडी लेगी, और डॉक्टर मैजिस्ट्रेट के बुलाएगी, उसका डीडी लेगी और उसमें भी बोलेगी कि भाई मुझे कंप्लेन नहीं करनी है. तो पहली सिचुएशन में यदि डॉक्टर ने बोल दिया होता तो दूसरी सिचुएशन क्रिएट ही नहीं होती.
हाँ, बिल्कुल.
I am putting in a different way.
Yes.
I think the senior doctors over here, they all have served in the government hospital, GK General Hospital on those days. In that tenure, if such type of case came to them, what they have did? They have to inform the police.
Yes.
The why should not in private practice?
So rightly mentioned by sir, not only doctor, any responsible citizen of India. So here it is mentioned, in general citizens are obligated to inform police about any cognizable offense they witness or have information about. This includes murder, robbery, offenses against state, public tranquility, and additionally reporting accident cases also. So in this type, because why we have kept this case for discussion, because in our practice many a time this type of situation may arise, and merely not to inform police may create problem in future, because we never know how mind of that very patient may turn in future. So same happened in this case. So that is why, irrespective of request on part of patient, we have to inform police. Yes, yes, Rudani sir.
Hello. Manubhai, I am orthopedic surgeon. Day by day, each and every orthopedic surgeon having daily accidental cases. So each and every patient give history of sometimes slip and slipping down from scooty or everything bike. So every patient having accident consider or daily patient जो आते हैं daily आवे जे तो એને બધાને પોલીસને ઇન્ફોર્મ કરવું જોઈએ કે નહીં, કારણ કે ડેઈલી અમારા તો 15-20 પેશન્ટ આવે, બધા પડી ગયા હિસ્ટ્રી પણ આપે. હવે એવું જો કરવા જઈએ તો પોલીસ ઉપર બર્ડન વધી જાય. એટલે વી પ્રેક્ટિકલી એ પેશન્ટને પૂછી લઈએ ભાઈ પોલીસ કેસ કરવો છે, પેશન્ટ કે નથી કરવો તો વી રાઇટ ઇન ધ રિટન કન્સન્ટ અને રૂટીન ટ્રીટમેન્ટ આપી દઈએ.
એમાં પેશન્ટની તમે કન્સર્ન લખાવી લો કે ભાઈ મારે કોઈ પણ
પોલીસ કેસ
પ્રકારનો
કરવો.
પોલીસ કેસ કરવો નથી.
પણ સમટાઈમ્સ પછી શું થાય કે આજે મારે હમણાં જે કેસ થયો 10 વર્ષ પછી સમન્સ આવ્યો કે તમારી હોસ્પિટલમાં પેશન્ટની ટ્રીટમેન્ટ લીધી હતી અને પોલીસ ગીવ ધ સમન્સ. હવે મારી પાસે કોઈ રેકોર્ડ હોય નહીં કારણ કે પેશન્ટને મેં ઓપીડીમાં ટ્રીટમેન્ટ આપી હોય. હવે એ વખતે સમટાઈમ્સ ઘણી વખત તો પેશન્ટ ફોલ્સ હિસ્ટ્રી આપી હોય તો એ ટાઈમે સમન્સ આવે છે તો અમારી પાસે ડોક્યુમેન્ટ્સ હોતા નથી કારણ કે પોલીસે કદી હિસ્ટ્રી ફોલ્સ આપી હોય કે હું મારી રીતે પડી ગયો છું અને ટ્રીટમેન્ટ ફ્રેક્ચર હોય બધું. હવે સમન્સ આવે છે 10 years 6 years પછી, કારણ અમારી પાસે ડોક્યુમેન્ટ્સ હોતા નથી. તો એ ટાઈમે એડવોકેટને અને પોલીસ ડિપાર્ટમેન્ટ કે અમારો આ એ વખતે બહુ પ્રોબ્લેમ થતા હોય છે, શું કરવું જોઈએ?
પોલીસ પ્રોસિક્યુટર પાસે પ્રિઝર્વ છે. યુ કેન go over there as a witness. તમે કોર્ટ પાસે વિટનેસ તરીકે માંગી શકો છો. તમે પબ્લિક પોલીસ પ્રોસિક્યુટર પાસે આપણે તમે ડોક્યુમેન્ટ માંગી શકો છો. એ જોયા પછી તમને લાગે કે આ જેન્યુઇન છે તો ડિપોઝ ઓન ધેટ. એ નથી તો તમે એ રીતે ડિપોઝ.
એટલે ઓપીડી બેઝ ઉપર આવે તો ઓપીડીનું પાનું લઈને
ક્લેમ કેસની વાત નથી કરતા ને?
હા, એમએલસી
એમએલસી ને ક્લેમ કેસની વાત છે.
ક્લેમ. બીજું
ઈચ એન્ડ એવરી કોગ્નિઝેબલ ઓફેન્સ જ્યારે બનતો જણાઈ આવતો હોય તો જાણ કરવી જોઈએ.
બીજું
દિવસમાં
ધારો
10
કે-
પેશન્ટ આવે કે 25 આવે,
ધારો કે
કોગ્નિઝેબલ ગુનો બનતો હોય તો જાણ કરવી જોઈએ. કમ્પલ્સન.
વ્હીક્યુલર એક્સિડન્ટનો કેસ હોય તો ક્યાં સુધી કેટલા વર્ષ સુધી અમારે ડોક્યુમેન્ટ સાચવવાના હોય? કારણ કે મારે હમણાં 13 વર્ષ પછી સમન્સ આવ્યો, 13 યર્સ પછી.
આપને ન સાચવવાના હોય તો પોલીસ ફરિયાદ થઈ હોય તો પોલીસને આપી દેવાનો ઓરિજિનલ ડોક્યુમેન્ટ.
એમને અમુક ટાઈમ સુધી સાચવવાના ડોક્યુમેન્ટ્સ હોય, એમએલસી કે
એવી કોઈ ટાઈમ લિમિટ કાયદામાં નથી.
લાઈફ લોંગ ટૂંકમાં રેકોર્ડ રાખવાનો.
There is no limit. પણ એટલી 7-8 વર્ષ સાથે.
ઓકે, થેન્ક યુ.
Yes.
All these people are here, so I just wanted to ask a question about one patient that had come to me just about 2 days back. She was that time 32-year-old. She came with some gynec complaint और गप्पे मारते मारते उसने मुझे ये बताया कि when she was a kid, less than 18 years of age, her school teacher had molested her. अब उसने मुझे ये इन्फॉर्मेशन दी है, ये पॉक्सो के अंदर आती है इन्फॉर्मेशन. अब ये क्रिमिनल एक्ट है, क्रिमिनल एक्ट कैन बी एक्चुअली, यानी उसकी कंप्लेंट तो आज भी दे सकता हूँ. तो इज इट मैंडेटरी ऑन माई पार्ट टू इन्फॉर्म? शी हैज़ नॉट टोल्ड मी टू इन्फॉर्म द पुलिस या कुछ भी, उसको कोई कंप्लेंट नहीं, लेकिन मुझे पता चला है और मुझे मालूम है उसके स्कूल में टीचर वो कौन है, ये मुझे मालूम है. तो इज इट माई ड्यूटी टू इन्फॉर्म द पुलिस ऑन दिस इशू? अभी ये बोलना कभी कभी आसान हो जाता है, लेकिन दैट पेशेंट इज 32-year-old पेशेंट. मेरे पास वो आती है फॉर अ डिफरेंट कंप्लेंट. उसका कोई लेना देना नहीं था वो स्कूल टीचर से अब तक. उसने बाय द वे, बिकॉज मैंने उनसे बात करना शुरू की, तो बाय द वे शी ओपनड अप एंड शी स्टेड कि आई वॉज मोलेस्टेड. नाउ ये होने के बाद में मैंने पुलिस कंप्लेंट की, तो सोसाइटी में कैसे हो जाता है? आई हैड गॉन टू द डॉक्टर जस्ट फॉर माई सिंपल कंप्लेंट, और ये डॉक्टर ने मेरे टीचर के ऊपर कंप्लेंट कर दिया. तो कभी कभी है ना, एज डॉक्टर वी आर इन अ वेरी कैश 22 सिचुएशन. जैसे आप अपने प्रॉब्लम बताते हैं, हमारे ये प्रॉब्लम है.
Yes, sir. Then I will continue.
सर, वन सेंटेंस में बोलूँगा. हर एक का प्रोफेशनल इथिक्स होता है. अभी आपने जो एग्जांपल दिया तो वो कोई आपके पास कंप्लेन नहीं कर रही थी. वो जो ट्रीटमेंट के लिए आई थी, वो ट्रीटमेंट के लिए उसने आपको पूरा हिस्ट्री बताया और उसमें ऐसा निकला. ठीक है, वो 18 साल की थी तब ये क्राइम हुआ. तो एज अ प्रोफेशनल इथिक्स आपको ये कंप्लेन करने की ज़रूरत भी नहीं है और आपको पुलिस को बताने की भी ज़रूरत नहीं है. एज अ एडवोकेट मैंने मर्डर कर दिया तो मैं एडवोकेट साहब के पास जाऊंगा तो वो मुझे ऐसा ही बोलेंगे, भाई मुझको तू सच बता तो ही मैं तुमको बचा सकता हूँ. तो मैं पूरा हिस्ट्री सच ही बताऊंगा कि भाई ऐसा था उस टाइम मेरे ऊपर ये हो गया और मैंने मर्डर कर दिया है. तो मैंने जो क्राइम किया है वो भी मैंने एडवोकेट साहब को तो बताया ही, लेकिन प्रोफेशनल इथिक्स वो नहीं बता सकते. लेकिन मैं सर के पास गया कि सर ये सर मुझे बहुत परेशान कर रहे हैं, मैं इसको मारने वाला हूँ, मार दो उसके बाद मुझे आप बचाना. तो ये सर के प्रोफेशनल इथिक्स में नहीं आता है, ये पुलिस को बताना चाहिए. तो वो हो सकता है. तो आपका जो है उसने कंप्लेन किया होता कि भाई 18 साल से पहले 18 साल की थी तब ये हो गया और इसकी वजह से मुझे ये हुआ है और ये किया है, तो आपकी ड्यूटी हो सकती है कि ये क्राइम हुआ था इसके लिए. ये मेरा नॉलेज है. आप सर
चलो लेट मी पुट इन दिस वे. आपने कहा कि उसने कंप्लेन नहीं की. डॉक्टर जो पुलिस को इन्फॉर्म करता है ना, डॉक्टर इज नॉट कंप्लेनर. लेट इट बी क्लियर. डॉक्टर इज इन्फॉर्मर. दिस इज टू इन्फॉर्म यू दैट patient so and so, aged so and so, residing at. Give me history of molestation when she was minor. That way, simply you have to inform. Under section 19, it is clearly mentioned. You are under obligation to inform. Then, police has to take action whether to investigate that case further, because this is very old case, or whether not to. One thing. And second thing, let me complete. I am putting one more question to him also. आपने जैसे बताया कि उसने कंप्लेन नहीं की, तो जो केस से हमने शुरुआत की थी, 16 साल की बच्ची को इसकी माँ ट्रीटमेंट के लिए ही लाई हमारे पास। मानो कि 6 वीक प्रेग्नेंट है, बराबर, इसकी भी कोई कंप्लेन नहीं है, किसी के ये लड़के के सामने भी कंप्लेन नहीं है, और ये कहती है सर जी मुझे ट्रीटमेंट चाहिए। हम ट्रीटमेंट जरूर करेंगे, पुलिस को इन्फॉर्म करना है कि नहीं करना, तो डिफर हुए ना। पहले में आप ना बोलते नहीं करना है, दूसरे बार
ઇન્ફોર્મ કરવું જોઈએ અને પોલીસ પાસે કે એમએનસી રજિસ્ટર પણ રાખવામાં આવે છે। હોસ્પિટલમાંથી જેટલી જાણ થાય એની અલગથી નોંધ કરવાની હોય છે, એ એફઆઈઆર નથી હોતી, પણ ઇન્ફોર્મેશન રાખવામાં આવતી હોય છે।
મારો સવાલ એ હતો કે વી આર ઇન્ફોર્મ, વી આર નોટ કમ્પ્લેનર, so in this situation if we abide by law word to word, then in that case also you have to inform people.
सर तो फिर साइकेट्रिस्ट वाले के तो बहुत प्रॉब्लम होगा, वो तो रोज पुलिस स्टेशन में इन्फॉर्म करता रहेगा। किस तरह जाएंगे तो बहुत प्रॉब्लम है फिर।
जो अंडर ऑल्सो Walke, rightly mentioned by Walke also, sir. Many a time person who brought the patient could be accused. So many a time at the time of examination of patient, he or she insists to be present at the time of examination. So one question comes, should we allow a relative inside examination room? So in this situation, our advice, we have to talk separately to the patient. Are you comfortable with her presence or his presence? If patient is comfortable, fine. Otherwise, you can deny. It is not compulsory for them to allow. But if patient is comfortable and relative is insisting to be present at the time of examination, then you cannot deny. That is also provision in POCSO. So it is willingness on part of patient. If patient is comfortable, fine. Not comfortable, another thing.
Sir, if the patient is not comfortable, then call for another relative, that too female.
Yes.
But without a relative, never examine the patient.
We will have to take consent for examination
Yes.
also, but under POCSO Act only.
POCSO Act.
If patient is more than 12 years, even though she is minor, she is considered as a mature minor.
Yes.
And she can give consent for examination. So for that, even if other relative is not there, you can very well examine. But if at all you have to go for some intervention, say for example, she is bleeding, then you
Yeah.
have to go for some stitches or so,
Stitches.
and some anesthesia is required. In this situation, she cannot give consent, and for that, consent of guardian is required.
Yes.
And that is why, if that fellow is accused, probable accused, because we cannot shame accused, but if patient is not comfortable with his or her presence, then you can inform another relative, or
Yes.
any major patient in your hospital can be considered as a guardian, and he can also sign the document, and you can treat patient.
You can call a person who is from CWC or from police department or from any NGO.
Big hospital, head
Yeah.
of the institution, head
Yes.
of the department, medical superintendent, dean, anybody can sign document
Yes, yes.
as a guardian.
For your safety, for the safety of doctor, one female person guardian should be there, so that in future that victim herself don't come up with the allegation against the doctor.
This is our always advice here. Whenever you are examining any female patient,
Any female
and particularly for male doctor,
Yes.
one relative should be inside.
One lady should be there inside.
Or your female staff should be there.
Female staff, if somebody is not from that available from that society or from NGO or from government department, then only as a last resort
Last
female,
resort.
because there will be allegation that that female is the employee of that hospital, so she supports the doctor.
She can be considered as a party.
We always say no कि जब भी मेल डॉक्टर फीमेल को एग्जामिन करता है तो देयर शुड बी अ फीमेल पर्सन.
Yes.
I go one step further. I'll tell you one story of a female doctor जिसके पास एक unmarried girl आई for MTP. Now unmarried girl को MTP के लिए why she had to examine the breast I don't know. But this has happened in Pune where I practice. She examined her breast. The next day, this girl rings up this female doctor, female gynecologist, and saying that you molested her. So please be under this impression कि फीमेल डॉक्टर को ही फीमेल होना चाहिए and मेल का डॉक्टर को ही एग्जामिन करते समय फीमेल होना चाहिए, ऐसा कुछ नहीं. When you are examining, female is examining also, that time there should be a female standing there and vice versa also. So
Simple
आजकल है ना क्या हो गया है, these youngsters can put any kind of allegation on you. So and when you are examining a breast, the patient has come to you for gynec complaint and you are examining the breast, you cannot take the consent for granted. You have to take at least an express consent कि बेटी में तेरा breast examine करना जरूरी है, whatever reason, and only then do it. So don't take things for granted just because you are female gynecologist. ऐसा नहीं है.
So very simple dictum in medical profession, whatever you do, you should be in a position to justify it medically. Simple. So whenever you are going to go to examine like this, at least express consent is required. You have to explain, I am going to examine and this is necessary. And if she is willing, she is comfortable, fine. If she is not willing, you cannot. So to conclude, there is always a way in this type of situation. So how to prevent? So carry home message from each panelist, one by one. What is your carry home message to the audience, one by one? Yes, bye.
Carry a message for the doctors.
Advice to the audience.
This is the only way when patient come, first registered fully with address and contact number, make a OPD case paper first, make the observation, then advise with the accompany with their family members, and then need to admit, then make a indoor case paper day to day, just like the government doctors doing in their job in the government hospital. This is the most important things. At the time of discharge, at the admission, or at the time of indoor, if any treatment is given which is to be explained to the family member, there must be some place where the family members can call out and explain them. This is the situation when the patient came, what we have observed now, this is the treatment, and this is the outcome of treatment, positive and negative both. And it should be put into the written statement and make the sign those who are acquainted with that relative, those who are with you while explaining the treatment. This is the first step. Second, day-to-day note. It is necessary for the indoor. Outdoor, you must have a copy of your advice. Whatever you have, I have seen so many prescriptions where nobody is putting the symptoms of the disease, what you are suffering from. They just prescribe medicine. What I have said orally. Manubhai Patel phone થી પણ દવા માંગેલું હતું તો મને પડે છે પણ કોઈ પણ પેશન્ટ અનનોન છે તો એના માટે જે પણ તમે ઓબ્ઝર્વેશન કરો છો કે જે તમે એની કમ્પ્લેન લ્યો છો એ કમ્પ્લેન પણ લ્યો ટ્રીટમેન્ટ પણ લખો એની કોપી તમારી પાસે અચૂક કરાવો કોમ્પ્યુટરાઇઝ છે તો 2 કોપી કરી એનામાં એની સાઇન લઈ લો બીજી કોપી અને નોર્મલી બધા પ્રિસ્ક્રિપ્શન આપી દેતો હોય પછી એમની પાસે કંઈ નથી હોતું એવા કિસ્સાઓમાં ડૉક્ટરને થોડું સંભાળવું પડશે અને થર્ડ આઈ એમ ટોટલી ડિસએગ્રી વિથ ધી પુણે ડૉક્ટર્સ ફોર ધ સેટલમેન્ટ. When I was opposite the desk, he said settle the matter. Why I am disagree? I am a lawyer. I know my capacity. When the doctor came to me, he explained me. I thoroughly understood, including your medical aspect. And I said, don't worry, you will get the result, positive result. And then, if you settle, then it's a question of our practice, our knowledge. So I always say, if you want to settle the matter, I won't be your representative. સેટલમેન્ટ ક્યાં મને જરાય વાંધો નથી એક દાખલો આપવામાં there was a second hip replacement. Get the complication. હતું એટલે ની રિપ્લેસ કરવું પડ્યું બીજી વાર. ઓપરેશન થિયેટરમાં બધું બરાબર થઈ ગયું, ની બેન્ડ કરીને રિલીઝ કરવા ગયા. પલ્પેશન હતું, પલ્પેટર નો. Doctor immediately sent to him to the Rajkot. Patient died after. He had a highly diabetic. એનું સિરમ ક્રિએટિનિન પહેલેથી ઘણું બધું આવતું હતું. ઘણા બધા કોમ્પ્લિકેશન હતા જ્યારે સેકન્ડ સર્જરી થઈ એની પહેલાં. એને એક્સપ્લેન પણ કર્યું હતું. એમની ટ્રીટમેન્ટનું એક્સપ્લેનેશનમાં સહીઓ પણ લીધી હતી. Patient went to Rajkot in private hospital. He died after 15-20 days of treatment. The relative of the patient filed a consumer complaint to the institute where he was admitted and the doctor who was treated him. Doctor came to me. I said, don't worry, you have no any negligence in this part. Procedure શું છે જો I demonstrate on laptop to the judge that this is the procedure of the replacement. એમાં એની ક્યાંય negligence નથી. That pulpative now start નથી, એના કારણે ડાયાબિટીસને કારણે એને જલ્દી ઇન્ફેક્શન શરૂ થઈ ગયું. હવે જે પાર્ટ ઓફ નેગ્લિજન્સ છે કે ત્યાં તમે જે ઓપરેશન કરો છો ત્યાં એની ટ્રીટમેન્ટ છે તો છે નેગ્લિજન્સ ગણાય. ઇટ્સ એ ડિબેટેબલ બિટવીન અસ એન્ડ યુ. પણ એ વખતે ત્યાં નહોતું એટલે એને રાજકોટ મોકલાયું. He was totally released from a pay of single money in consumer case. The patient went to the state commission where doctor had compromised. I was so shocked. I have decided when they came to me that I am going to resign as a on the panel of the IMA. Because if this is the compromise method, I don't agree. મને લાગશે કે તમારા અહીં ક્યાંક છે ને just because of you want to save your identity, તમારી પ્રતિષ્ઠાને ધ્યાન રાખો છો અને કરો છો તો એ ભૂલી જજો આ કંઈ ગુનો નથી. તમે જે કર્યું છે this is not કાલ ઉઠીને તમારી પાસે જવાબદાર પણ આવી. ચાલો consumer form of compensation. The compensation paid by the insurance company or the PSS, your PSS, or by the insurance company. તમે એ કેમ કંઈ લ્યો છો કે ભાઈ આ કોમ્પ્રોમાઇઝ કરવું એ અમારા ક્લાયન્ટની મરજી ના નથી પાડતા. પણ આટલું કર્યા પછી કોમ્પ્રોમાઇઝ થતું હોય તો નો ગુડ લોયર વિલ કમ ટુ સેવ ધી ડોક્ટર્સ. જ્યાં અમને લાગશે કે હા ડૉક્ટર અહીંયા ભૂલ છે તો અમે સામેથી કહીશું કે આમાં આપણે તમે જોઈ લો કે આ વાયા મીડિયા થતું હોય. કારણ કે આ કોમ્પ્લેક્સ તમારો પર્સનલ આવતું હોય તો બરાબર છે. વેન યુ આર પ્રોટેક્ટેડ બાય ધ ઇન્સ્યોરન્સ, યુ પ્રોટેક્ટેડ બાય ધ સ્કીમ, ધ સ્કીમ વિલ ટેક કેર ઓફ ઇટ. એના કારણે તમને વધુ એકાદ કોઈ પેપરમાં આવી જશે. ડોન્ટ વરી, ડોન્ટ ટેક ઇટ ઇન માઇન્ડ કે આના કારણે મને મારા વ્યવસાય. ઇફ યુ આર એ ગુડ ડોક્ટર, ઇફ યુ હેવ એ સ્કિલ ટુ ઓપરેટ, અમે પણ તે હારી જઈએ છીએ. એમસીપી હારી જાય છે મર્ડરના કેસ. એના લીધે અમારું નામ મટી નથી જતું. એવું નથી કે અમે નથી હાર્યા કેસ. વી આર લોસ ઇન સો મેની થિંગ્સ, સો મેની કેસીસ. બટ યુ હેવ ટુ ટેક કેર કે જ્યારે તમે કોર્ટમાં જાઓ છો ત્યારે ફૂલ્લી પ્રિપેરનેસ સાથે જાઓ. સારા એડવોકેટને કન્સલ્ટ કરી સ્પષ્ટ માંગી લો કે આમાં એડવોકેટ શું થશે, આપણે જીતીશું કે હારું. એટલે અમને આઈડિયા છે કે આપણે જીતીશું કે નહીં, કેટલા પાસે જીતવાના છે, કેટલા પાસે હારવાના છે. તો ગુડ એડવોકેટ વિલ એડવાઇઝ યુ. એટલું કહું, બીજા નહીં એડવાઇઝ કરે કારણ કે જેમ કહ્યું દે આર કન્સર્ન વિથ ધ ફીસ. પણ ગુડ એડવોકેટ વિલ explain you. Yes, આપણે લડીએ, કોશિશ કરીએ એક વખત, પછી જોઈશું આગળ ચાલતા. ડ્યુરિંગ ધ કોર્સ ઓફ ટ્રાયલ વિલ ફાઇન્ડ સમ વે. પણ એક કોમ્પ્રોમાઇઝમાં પછી તમારી ઇન્સ્યોરન્સ કંપની મદદ નહીં કરે, નહીં PSS કરશે. એ તમારે ઇન્ડિવિડ્યુઅલ આવવું પડશે. એટલે આ વસ્તુ એટલા માટે કહું છું કે જે પ્રિકોશન માટે કીધું એ જરૂરી છે અને ફોર્મનેસ જરૂરી છે. તો જ અમને કામ કરવાની મજા આવશે.
સર ઘણો ટાઈમ લઈ લીધો છે એટલે હું કહીશ કે જેવી રીતે સારવાર કરો છો એ એકદમ ખંતપૂર્વક એવી રીતે કાગળિયાનું કામ પણ ખંતપૂર્વક જ કરજો તો ક્યાંય તકલીફ નહીં પડે.
બધાને ભૂખ લાગી છે અને બધા કરતાં વધારે મને લાગી છે. પણ I have tried to sum up the whole thing. 7 points है, जल्दी कह दिस. If somebody wants to jot down, please jot down. If somebody wants to record, a video record, you are free to do. Number 1, treatment first. First priority should be treatment with all precautions. કે જે આપણે ડિસ્કસ થયું કે એના રિલેટિવ્સને પેશન્ટના રિલેટિવ્સને લોકમાં લઈને કોન્ફિડન્સમાં લઈને કરવાનું. સો નંબર 1 ઇઝ ટ્રીટમેન્ટ ફર્સ્ટ વિથ ઓલ પ્રિકોશન્સ. नंबर 2, डॉक्यूमेंटेड पैरेलली. ऐसा नहीं है कि ट्रीटमेंट किया और बाद में पैरेलल डॉक्यूमेंटेशन शुड बी पैरेलली एंड प्रॉपरली. नंबर 3, रिपोर्ट व्हेन लीगली रिक्वायर्ड. पुलिस को जो रिपोर्ट करना है, इन्फॉर्म करना है, वो करना है. नंबर 4, प्रिजर्व द एविडेंस, नेवर डिस्ट्रॉय. चाहे 16 साल हो, 25 साल हो, प्रिजर्व द एविडेंस. नंबर 5, call police when threatened. Don't wait for the actual assault. आपको लगता है कि they are aggravating, they are in aggression mood, they are in the threatening mood, तो बुला लीजिए पुलिस को. It is your right. Number 6, don't panic in adverse outcome. See, every failure of treatment is not a crime. Treatment है, कुछ भी हो सकता है, successful या failure. Every failure of treatment is not a crime. So panic नहीं होना है. FIR or arrest are not the ultimate punishment. FIR itself says first information report. वो फर्स्ट इंफॉर्मेशन जो आई है वो उसका रिपोर्ट हुआ है, वो आपको पनिशमेंट नहीं है. अरेस्ट इज ऑल्सो नॉट पनिशमेंट, इससे पुलिस का राइट है. लेकिन ऐसा कुछ भी हो जाए आपके खिलाफ तो डोंट गेट पैनिक. नंबर 7 एंड लास्ट, कोऑपरेट इन एवरी लीगल प्रोसेस विथ प्रैक्टिसिंग ऑल योर कॉन्स्टिट्यूशनल राइट्स. जो आपके कॉन्स्टिट्यूशनल राइट्स है, FIR कोर्सिंग करने का, एंटिसिपेटरी बेल का, जो जितने भी रेगुलर बेल का, ऑल योर कॉन्स्टिट्यूशनल राइट्स यू कैन प्रैक्टिस, बट प्रैक्टिसिंग देम कोऑपरेट इन एवरी लीगल प्रोसेस एंड द आउटकम विल बी इन द बेनिफिट ऑफ द सोसाइटी, in your benefit, in the benefit of the whole system and in the benefit of the patient and all the society. Thank you.
हेलो સરે બધું કહી દીધું. હું એક જ લાઈનમાં કહીશ, પોલીસ ઉપર વિશ્વાસ રાખી પોલીસને કોલ કરી પોલીસને બોલાવજો, બાકી પોલીસ બધું સંભાળી લેશે.
He said 3 लोगों से दोस्ती करनी है अपने को. बॉक्सी में MC पटेल और भुज में है तो साहब के साथ दोस्ती कर लो. अगर आपने बाहर निपटा दिया केस सेटलमेंट से तो ठीक है, सेटलमेंट से नहीं हुआ तो सालों साल तक केस चलते रहेगा. सर अपने हैं, वो लड़ते रहेंगे जो 15 साल 20 साल वो लड़ते रहेंगे. दैट्स ओके. सो अगर सेटल कर सको तो जल्दी मामला निपट जाएगा. बिकॉज है ना, अंदर से पता चलता है अपने को, अपने से नेग्लिजेंस हुआ है कि नहीं. अगर ऐसे लग रहा है कि कुछ गड़बड़ हो गई है तो सेटल करके मामला निपटा के अपने प्रैक्टिस के बाद ध्यान दो, नहीं तो सर के पास के. तो सेकंड फ्रेंड विल बी हिम एंड थर्ड फ्रेंड विल बी पुलिस ऑफिसर. 3 जन से दोस्ती करना जरूरी है और कुछ नहीं. अपने बीवी के साथ नहीं करेगा तो भी चलेगा. अभी घर में ना एक को लॉयर बनाओ, एक को डॉक्टर बनाओ, दूसरे को पुलिस में डालो.
मेरे साथ दोस्ती भी करोगे ना तो भी अगर आप गलत हो तो मैं हेल्प नहीं कर पाऊंगा.
सर जी अभी टाइम घर पे आओ ना, पुणे आए तो बैठेंगे हम लोग.
આટલું બધું ડિસ્કશન સરસ મજાનું હતું, બહુ હેલ્ધી ડિસ્કશન થયું. પણ આટલા બધામાં એક વસ્તુ ખાસ ડૉક્ટરે પેલી વસ્તુ રાખવાની, જ્યારે પણ પેશન્ટ આવે તમારા પાસે ત્યારે સૌથી પહેલાં એની જે ચીફ કમ્પ્લેન છે સાંભળો, સમજો, એની હિસ્ટ્રી લો, બધી વસ્તુઓ નોટ ડાઉન કરો. તમે જે ટ્રીટમેન્ટ એના માટે પ્લાન કરો છો, ઇન્વેસ્ટિગેશન પ્લાન કરો છો, એ એને સમજાવો. અને ધેન આફ્ટર જ્યારે આ બધી વસ્તુ સમજાઈ જાય એનો રિટર્ન કન્સલ્ટ, ઓડિયો કન્સલ્ટ ઓર વિડીયો કન્સલ્ટ, વોટ એવર યુ થિંક પ્રોપર, એનું કન્સલ્ટ લઈ ને ત્યાર પછી કોઈ પણ ટ્રીટમેન્ટ એક્સપ્લેન કર્યા પછી એની ટ્રીટમેન્ટ કરો ત્યારે એના સાથે જે એનો કોઈ પણ આવ્યો છે, બચ્ચો છે તો ગાર્ડિયન આવ્યો છે અથવા તો એની સાથે વાઈફ છે તેનો હસબન્ડ આવ્યો છે, એને બધું સમજાવો ને ધેન આફ્ટર યુ ગો ફોર એ ટ્રીટમેન્ટ. જો તમે સાચી રીતે ટ્રીટમેન્ટ કરશો, સાચી હિસ્ટ્રી લેશો તો આ કોઈ કોમ્પ્લિકેશન લાઈફમાં આવતા નથી. યુ કેન ડુ રાઈટ પ્રેક્ટિસ ઓન અ રાઈટ વે. થેન્ક યુ.
હવે આ મેડિકોલેગલ કોન્ફરન્સ કરવી જ ના પડે એવું જો આપણે કરીએ, પેશન્ટને દરિદ્ર નારાયણ સમજીએ, આપણો ભગવાન સમજીએ, ઈશ્વર સમજીએ. બીજું, સમાજમાં, સોસાયટીમાં આપણા સ્ટાફ સાથે સારા સંબંધ રાખીએ, પોલિટિશિયનો સાથે સંબંધ રાખીએ, વકીલો સાથે સંબંધ રાખીએ, પોલીસ મિત્રો બનાવીએ કે પોલીસ પ્રજાનો મિત્ર જ છે, અને મનુભાઈ અને વાલકે સાહેબ જેવા જોડે સંબંધ રાખીએ તો મને નથી લાગતું કે ક્યાંય આપણી પ્રેક્ટિસમાં આપણને કોઈ ટેન્શન આવે અને બેસ્ટ આપણે કામ કરી શકીએ. થેન્ક યુ.
આટલા બધામાં આટલું શીખવાનું, ગુડ કોમ્યુનિકેશન અને ગુડ ડોક્યુમેન્ટેશન, બે વસ્તુ પર
I like to add what Dr. Vishal Desai said. Good documentation, record keeping is always there. But in spite of all this, whenever you are landing in trouble or when you are taking a complicated case, like if I am operating something, always feel free to call help with your fellow colleagues. So never feel that you go to name, that is not possible. Because whenever you ask for help, no one will deny it. And 2-3 people when get together, the complications will go down. Because as a surgeon, as an obstetrician, complication is a part of medical field. No one can tell no, nothing can happen with me. No, everything can happen with you. But what happens when you call for help? When 2-3 people are gathered together and the patients and relatives see everything has been done simultaneously, then such type of litigations go very low. That's why I think.
So,
Jacob Matthew is a Gita for you. Please have a copy of that from Google. ગૂગલમાં જશો ને તો આ જેકબ મેથ્યુનું તમે જજમેન્ટ માંગશો તો સુપ્રીમ કોર્ટનું મળશે. ઘણા બધા કાનૂન છે, પ્લીઝ રીડ કરજો. એ તમારા માટે ગીતા જેવું છે અને એ તમને પ્રોટેક્ટ કરશે અને અમને સગવડ કરશે ઘરને છોડાવવા.
So to summarize all the, usually whenever we face any litigation, we have to face certain question in court of law. And very important questions comes to, was it preventable? Whatever has happened, was it preventable? Usually you cannot say no, because any complication is preventable. And if it was preventable, then what did you do to prevent it? You will have to prove from your documentation that what you have tried to prevent it. And in spite of all your care, caution, you couldn't prevent. Then did you diagnose that complication well in time? And very important question, did you manage that complication or that case way in which any prudent doctor would have managed? If you can answer all those questions, you are out of problem, out of any litigation. And for that, only 3 things you have to remember. 1, foreseeability or anticipation. You should anticipate that in this surgery or in this procedure, this can happen. So it is anticipation. And you should be readily available to deal with that very complication if at all it happens. And for that, proper counseling and proper consent is very much must. And all this will be properly taken care by proper documentation. So anticipation, proper consent and proper documentation, you will be out of problem. So before I conclude, big round of applause for all the panelists. So this is science of uncertainty and art of probability. And problem with world is that intelligent people are full of doubts, while stupid ones are full of confidence. So we have to decide where we are, and I have mentioned that also, so I do not want to go into detail. But with regard, salute to all. Wherever you are, I will be there. Promise to reach the unreached. Whenever any assistance required, we are always there to assist you in any given situation. Let us hope nobody should end up into any kind of litigation. But if at all it happens, then we are always there to guide you, help you, assist you. Thank you very much.
Thank you so much, all the panelists, especially Dr. MC Patel, sir.
આ સબ્જેક્ટ એવો હતો ને ખૂબ મોડું થઈ ગયું છે, બધાને બહુ ભૂખ લાગી છે. આ સબ્જેક્ટ એવો છે કે જે ભણવામાં નથી આવતો, પણ આ મેડિકો લીગલ ઇઝ અ પાર્ટ ઓફ અવર પ્રેક્ટિસ. એટલે આ સબ્જેક્ટ આપણે સમજવો પડશે ને દિમાગમાં ઉતારવું પડશે આ વસ્તુ. ને જ્યારે પેશન્ટને ઇમરજન્સી હોય છે ત્યારે ડૉક્ટર પાસે જાય છે, પણ ડૉક્ટરને જ્યારે ઇમરજન્સી હોય ત્યારે આ લીગલ માટેની ત્યારે આપણે આ એડવોકેટ, પોલીસ અને એ લોકો પાસે જવું જોઈએ ને એ લોકોનો સાથ સહકાર લેવું જોઈએ. બસ હવે આ ડેસ્ક ઉપરથી હું MC પટેલ સાહેબ, ડૉક્ટર MC પટેલ સાહેબ, ડૉક્ટર દિલીપ વાલકે સાહેબનો ખૂબ ખૂબ આભાર માનું છું. અહીંયા આવ્યા, અમારા સાથે આ મેડિકોલિગલ કોન્ફરન્સમાં અમને ખૂબ જ સારી સમજૂતી આપી. પછી હું મારા પેનલિસ્ટ સાહેબો બધાને UISP સાહેબ, પછી જેઠી સાહેબ, પછી એડવોકેટ રાજેશભાઈ ઠક્કર સાહેબ અને એડવોકેટ હેન્સિંગ સાહેબને ખૂબ ખૂબ આભાર માંગુ છું. એમણે પોતાનો ખૂબ અહીંયા સમય આપ્યો, અમને ખૂબ સારું માર્ગદર્શન આપ્યું. એના માટે હું અંતઃકરણપૂર્વક મારો આભાર માનું છું એમનો. અને આ પ્રોગ્રામ માટે જે લોકોએ અમને ફંડ આપ્યું ને આટલું સરસ સ્પોન્સરશિપ આપી છે એવા AU બેંક અને મેઇન સ્પોન્સર આપણા શિવાલિકા ગ્રુપનો પણ ખૂબ આભાર માનું છું. અને આ પ્રોગ્રામ કરવા માટે જેટલા પણ લોકોએ આપણે સાથે મળીને આપણી કમિટીએ જે સમર્પિત રીતે પ્રત્યક્ષ અને પરોક્ષ રીતે જે મદદ કરી છે એના માટે પણ ખૂબ આભારી છું. અને અહીંયા કેટલાક લોકો એવા છે કે જે લોકોએ કામ કર્યું છે પણ એને એપ્રિશિએટ કરવાનો ક્યારે નથી આવતા, જે મિસ્ટર ઇન્ડિયા કહું આ પ્રોગ્રામના, જેમ કે મહેશભાઈ IMA ના આ હોટલમાં જે લોકો સ્ટાફ એ લોકો એટલું બધું કામ કર્યું છે, જે 2 દિવસથી સતત કામ કરી રહ્યા છે. રાવત છે, રવિભાઈ છે, જે લોકો આ મંડપનું કામ કર્યું છે, અનિલભાઈ, તેજભાઈ અને બીજી નાની નાની ઘણી ટીમોએ આ બધું સફળપૂર્વક આ કાર્યક્રમ કર્યું છે. એ લોકોનો પણ ખૂબ આભાર માનું છું. અને છેલ્લે સૌથી મહત્વના જેટલા લોકો અહીંયા આવ્યા અને આનો લાભ લીધો, આ 3 સંસ્થાઓનો IMA, NMO અને ડેન્ટલ ક્લબ ઓફ ભુજ એના મેમ્બરોનો, દરેક વ્યક્તિઓનો, સંસ્થાઓનો ખૂબ ખૂબ આભાર માનું છું. કેટલું સારું નોલેજ તમે લઈને જાઓ છો જે જીવનભર તમને ઉપયોગી થશે. થેન્ક યુ. વંદે વંદે